Oh boy. Oh, you're welcome. Thank you, bros. Thank you, guys. Hello. Yeah, so please don't forget to thumbs up the. You see that thing that is like this? Please click on it. Very important. Also, subscribe. If you don't subscribe, I'll kick you out. Don't mind me, I'm just kidding. Okay. How many are we here? We are 32? No, we need to be up to 100. Here is everybody. Where is everybody? 911 is. You're welcome. Thank you. You're welcome. I know that most of you must have been stressed. I hope all of you watched the two other videos I released yesterday. I did Neuro 1, Neuro 2, Neuro 3. The reason I did it is so that you'll be very well acquainted with what we are doing today. All right. It's very easy for you if you have taken your time to watch those videos. To be extremely it will be extremely easy for you, whatever we are doing today. So this is more like assimilation point, right? Okay, good. I will know if you did, when the question time starts. We already a few minutes past, so I think we can now start. Yeah. So the rules and regulation, as usual, I will. This is neuro, you understand. So I'm not going to fly as I always do, because sometimes it's a little more technical for a whole lot of people. I'm going to take at least 30 minutes to describe the slides before I jump into the equations. All right. I'll be very fast. Don't worry. We are going to do chapters. Let me see. We're going to do the. Is this chapter 12? Yes, the nervous system, the spinal cord, and the brain itself. So it's going to be a long ride. I was supposed to start at 6, but one thing or the other made me decide to start by 7. I want to be sure that everybody will be here before we start, because some people complain that 6 o'clock is too early for them. Oh, I see you. Steph, how are you doing? I see you. Welcome. Okay. So I'm going to share my screen right now. We are still 45 here. I'm expecting 100 people today. It's all of them. Okay. Thank you for hitting blah blah. Okay. All right. So as usual, I always start very slow, so bear with me. I'm going to share my screen. Please, once the stuff starts freezing, please make sure you tell me, all right? Because most times, once I start, I don't even bother to look at my image here. It's always a long ride. Okay, so we are starting with the nervous system. No. No evil on life. This one is captured. No evil on life. Okay. Can you see my screen? Guys, can you see my screen? I share the screen. Please, if you can see it, tell me so that I'll be sure to continue. I want this camera to follow me. Okay. It's following me. Following me. Okay. Perfect. So usually once we are done with each chapter, I start throwing questions. We are 59 here. I'm expecting 100 people here today. All right. So I think people are still coming in. So by then I should be expecting at least every question to be, up to 20 people to answer every question. Okay, so let's start. Nervous system. We know what nervous system is about. So I'm going to avoid some information, all right? Because I've already discussed it in the videos and in classes. And, some of your other professors definitely must have taught you some of these things. So I'll be very specific about some certain places that is of interest to your professors, people that are setting your exams based on experiences in the past and also based on present experience. All right. So first of all, you need to know the difference between the nervous system and the endocrine system. Extremely important that you know the difference between the nervous system and the endocrine system. Endocrine system is always very slow. That's one thing you need to know. Always very slow. Why? Because it uses what? Chemicals only. And which chemical is that? Hormones. How does it send it? Through the blood. That is what they're going to ask you. I'll show you questions on that. Now, the nervous system uses, instead of hormones or just any chemical, it uses some specialized chemicals known as what? Transmitters, neurotransmitters, and also electrical activity. So it employs both electrical and chemical. All right. So this makes it very fast, extremely fast. You understand? If I touch you here now, you will respond because of nervous system. So it's extremely very fast compared to the endocrine system. So that's a very big difference that you guys need to know. Also, you need to know the differences in the nervous system, right? The three basic steps: sense organs receive information, CNS processes those information, and sends out command to the muscles and glands, right? We call them effectors. So we have the receptors, we have the processors, and also we have what? The effectors. So you need to understand these three basic concepts because that is what the entire neuro is about. Okay, we are up to 6-1. We are getting we are growing now. I hope some people don't miss out on information. Oh, sorry. Okay, so the major subdivisions of the nervous system: TNS, peripheral nervous system. All right, we have the central nervous system, we have peripheral nervous system. Central nervous system is brain and spinal cord. Peripheral is anything that is not brain and spinal cord. Usually nerves and what? And ganglia. Anything that is not brain and spinal cord is what? Peripheral. All right. So nerves and ganglia are the major peripheral, the components of the peripheral nervous system, and that's what we are going to discuss in this chapter, this specific chapter. All right. So the nerve are just bundles of fibers, while the ganglion is just swelling. All right, where the neural cells or bodies are concentrated. They'll tell you a knot-like swelling in a nerve where neuron cell bodies are concentrated is called dash. Trust me, the first option you see there is what? Nerve. But they want to confuse you. Don't allow them confuse you. All right. Okay. So you need to know the difference between nerve and ganglions. Also, I don't want to spend too much time discussing this. Instead, I will just use this diagram to discuss it. So if you all are seeing my diagram, I want you to notice that, okay, this is central nervous system, this is peripheral nervous system. So this is the entire nervous system. How is it divided? The central nervous system is divided into brain and spinal cord, which we've already discussed. So this is out. We are not discussing this now. We are discussing spinal cord in the next chapter, and we are discussing brain in the third, neuro 3. So this is neuro 1, neuro 2, and neuro 3. All right. Now, we are basing our discussion today on neuro 1, which is the peripheral nervous system. Now, this peripheral nervous system is divided into two major components, which is the sensory division and the motor division. What is sensory division? Information going up. All right. Going up. You understand? That's information going to the central nervous system. That is what the sensory division. Going up. Then the motor division is coming back. You need to understand this. Another name for sensory is A before E. Efferent is going. Efferent is coming back. So that efferent that is going is the same thing as what? Sensory. That efferent coming back is the same thing as what? Motor. So you need to be able to differentiate between sensory and motor divisions. Very important for you to differentiate these things. Now, if you are able to differentiate them, then I want you to also be able to differentiate the difference between somatic and visceral. For people that have listened to me talk before, sorry, I have to put my hand so that this AI will recognize my hand and move this. This thing is stressing me. I'm gonna blink. Don't mind me. I started using this thing newly so that the image will be clear. It's not working. Please, I'm continuing my thing. As far as you guys can see me, that's what matters. Okay. So the we have the visceral and the somatic. Anything visceral, guys, anything visceral is talking about smooth muscle and cardiac muscle. Viscera is organs. Visceral what? Visceral organs. Smooth and what? Cardiac. So I just want you to put that in your head. Then anything somatic is what? Body. All right. So when I say sensory division of, it's not okay. So yeah, sensory division is now divided into visceral sensory and motor sensory. Motor and visceral sensory and what? Somatic sensory rather. The motor is also divided visceral motor and somatic motor. So if I say visceral sensory, for example, it means the information is being taken. Visceral sensory, the information is being taken from a cardiac or a smooth muscle component and going to the central nervous system. That's what visceral sensory is. Then when you hear somatic sensory, it means the information is taken from the skeletal muscle and going to where? The CNS. Now, when you hear visceral motor, it means the information is coming from the CNS. You understand? Visceral to where? To smooth and cardiac muscle. And when you hear somatic motor, it means the information is coming from the CNS going to where? Skeletal. S for S. Chicken. All right. So, and now this visceral motor is now divided into sympathetic and parasympathetic. We will still discuss it. All right. But if you can, conceptualize this image in your head and know which one is visceral motor, which one is somatic motor, which one is sensory motor, sensory somatic, which one is visceral sensory, you'll be able to differentiate these things. All right. Because this is the bedrock of nervous system. Now let's talk about neurons specifically. What do you need to know? I'm specific about what you need to know. You need to know the universal properties of neurons, which is what? That it is excitable. Let me spread this thing so that it gets bigger. Perfect. Yeah, I hope it gets bigger for people. Let me spread it a little. This is good. Okay. So the universal properties of neurons is irritable. That's excitability, can respond to environmental changes called stimuli. All right. Conductivity, it can respond to stimuli by producing electrical signals, all right, that go to different places very fast. Then secretion, that is production of what? Neurotransmitters. Now, these are the three things that we ask you about the functional classes. Functional class, this is universal properties. That's three of them. Remember, this is functional classes. Functional. What is functional? Functional is physiology. Mind you, this is anatomy and physiology. Anatomy is what? Location, location, location. Or what? Structure, structure, structure. And physiology is what? Function, function, function. Some of you have already had this lecture in class, but why I'm pushing it now is to consolidate. That's what we call consolidation in terms of learning. All right? When you are in the class and you saw the video and you are in this revision class actively engaged, trust me, there is no question that you will not answer in neuro. There is no question you will not answer in neuro because you've already consolidated in three different places. All right. But some people, probably, we are not in classes and they didn't see the video. So they are just here. It will still be a little difficult for you. But if you pay attention, you'll be good to go. So functional classes, we have the sensory neurons, we have the interneurons, and we have what? The motor neurons. Now, there are some special neurons that take information to the CNS. Those neurons are called what? Sensory or efferent neurons. There are some neurons that bring information back from the CNS. We call them what? Motor or what? Efferent neurons. They take that information to the glands, to the muscles, called what? Effectors. Now, there are the ones that lie entirely within the CNS. They will tell you, one of the following neurons lie entirely within the CNS, connecting the motor and the sensory. What do you call it? Interneurons. They will ask you, one of the following neurons constitute about 90% of all neurons in the human anatomy. The answer is this number 2, interneurons. All right? So you need to be able to understand what it does is it receives this information from the afferent, processes the information, organizes the information, cooks the information, prepares it as a dish, package it, and give it out through what? The motor. Stop laughing. Somebody is busy laughing. Instead of you to pay attention, you're laughing. I see you in your house. Don't worry. I know what you're doing. Okay. So the control center of a neuron. Let's talk about a neuron. That structure. Remember, this is anatomy. We are, gradually we are moving. Neuron, the control center is neurosoma. All right. Another word for neurosoma is cell body. Cell body, centrally located. All right. It has its own cytoplasm, contains mitochondrial lysosomes, Golgi complex, inclusion, all those things. These are everything it has. But there are two things that it does not have. or that doesn't happen there, that they will ask you, what is it? Centrioles and what? Mitosis. No mitosis, no centrioles. What are the inclusion it contains? They may ask you, all the following are inclusions in the neurosome, except these are the inclusions: glycogen, lipid droplets, melanin, lipofuscin, pigments. All right. So extremely important that you know this. Now, somebody was asking me, somebody sent me a message and was asking me the difference between dendrites and terminal arborization. You will understand it now here. Dendrites are branches that come off what? Neurosoma. Look at it. See my hair? See this, my long hair. This, my long hair is what? Dendrites. I want you to always regard, anytime I say dendrites, this is what I'm talking about. All right. Then take my face. This is my very handsome face. Take it as what? As the cell body or the neurosoma. All right. Then this place, this in my neck, take it as the axon hillock. And down here is what? The axon. Now, dendrites are branches of the neurosoma. And what is their function? Their primary function is to receive signals from other neurons. That's why axodendritic synapse is the most common synapse we have in the brain. Why? Because most neurons receive information through what? The dendrites. So meaning that, oh, if this is a neuron and it has a lot of dendrites, the more dendrites it have, all right, the more information it can receive. So the amount of dendrites is directly what? Proportional, for people that know mathematics, to what? Information received. You must not forget this, because they will ask you, what is the function of the dendrites? Or the branches that come off the neurosoma is what? All right. Now we have the axon. Let's talk about the axon. The axon originates from a mound on the neurosoma called what? The axon hillock. This is the hillock, the neck. I always call it the neck. All right. That is where, arranges the entire, accumulates all the potentials, local potentials, and know if it's enough to give off action potential through the neurons, through the axon. All right. Now, an axon has what? Axon collaterals, that's branches, exoplasm, exolemma, and myelin sheaths. Extremely important. I'm not going too deep into it. All right. Now, somebody was asking me about terminal arborization. This is terminal arborization here. Distal end of the axon. All right. This is terminal arborization. Look at it. Terminal arborization here. All right. Then the tip is known as axon terminals. This axon terminals. But this long stuff here is known as what? Terminal arborization. It's different from the dendrites. This is the dendrites. So the person that sends me that email, if you are here, please, this is the dendrites here. This thing is it's just like my hair. Then this is my toenails, more or less. All right. Okay. So I'm fast forwarding. They will ask you about the multipolar neurons. Why would they ask you about the multipolar neurons? Because it's the most common neuron. That's what they will ask you. Because it's the most common neuron. But I want you to also know that we have structural classification. Remember, this is the functional classification of neurons. This is the property of neurons. And this is what? The structural classification. You need to compartmentalize how you understand neurons. Now, the structural classification, we have the multipolar, we have the bipolar, we have the unipolar, we have what? The anasonic. Look at it and know what it does. I'm not going to go into it. I'm jumping. All right. Okay. In every system, for people that have already taught AP1 and AP2 here, I keep telling you that every system has what? Support systems. In the brain, there is what we call supportive cells. Like in the digestive system, liver is a supporting cell. That's why we call it accessory digestive organ. So in this brain, we have what? In the nervous system, we have supporting cells, accessory. All right. They are called what? Neuroglia. Neuro what? Glia. I know you're laughing at my pronunciation. Keep laughing. So it's called what? Neuroglia. All right. I always call it like that so that I'll be able to remember it. So just do anything that will make you remember something. All right. So neuroglia, they outnumber neurons by 10 to 1. So there are a whole lot of neuroglia, meaning that they, affect things that are happening. All right. So these are their functions. I'm not going to go into it. I want you to read it up later. But what you need to know is the types of neuroglia and what they do. I'll be very fast about it. The types, there are 4 types in the CNS and there are 2 types in the PNS. All right. In the CNS, we have oligodendrocytes, epididymal cells, microglia, and what? And astrocytes. These are the 4 we have. What are their functions? Oligodendrocytes, specifically myelin sheath. I'm not talking more about that. Myelin sheath in the CNS, oligodendrocytes. Epididymal cells, epithelium, from the word epithelium. What does it do? It lines everything, the cavities, all right? What does it do specifically? It helps in secretion of and circulation of CSF. But what produces CSF exactly? is what choroid plexus. I'm just saying it here because we're discussing later. Choroid plexus is what produces CSF exactly. Why the ependymal cells now helps the choroid plexus to push it out. They will ask you which type, what is the epithelium of the ependymal cells? Remember, I told you something for people that were in my class during tissue. If you're not, go and watch the video on tissue. All right. I told you that the CSF, anything that produces fluid has to deal with what? Cuboidal, cuboidal. So it's definitely cuboidal epithelium, and it has cilia. Thank you. Thank you so much, Bronx. Now we have microglia. Microglia is, more genitors. Let's call it genitors. Okay, no. Let's call it NYPD. New York Police Department. That is what microglia is. What do? They go around looking for anything that is not supposed to be there. Like what? Like debris. Like what? Like damages. Like what? Like any infectious material. So they are produced from white blood cells. That's monocytes. So you need to know, catch this thing, catch it, so that you don't mistake it in the exam. Because they will tell you, that is the most abundant glia cells in the CNS. And your first option will be what? The first option will be oligodendrocytes. Why? Because it's very common. But no, the answer is what? Astrocytes. Astrocytes is the most abundant glia cells in the CNS. You must know this. All right? What do? They do everything virtually. But the major thing they do is that they help to form what? The blood-brain barrier. They help to form what? BBB. Chickener. And they are very important. And because they are so numerous, they can easily be damaged. All right? And when they are damaged, we call it what? Astrocytosis or sclerosis. So, I'm not going to go too far into it. All right? This is the diagram. This diagram you should always expect in all your exams. For people that are, going to do lab exams and also lecture exam, you should expect diagrams like this. All right? This is the neuron. This is the body. This is the dendrites, right? Then look at this thing. It looks very ugly, right? Very, very ugly looking. This is the microglia. This is the microglia. I hope you can see my mouse pointer. Can you see my mouse pointer? Yes? If you can see, type yes, type yes. Quickly. Perfect. Okay. So this is microglia. Very ugly. Look at it. If it captures anything, it's eating it up. It's mopping everything. Thank you so much, guys. Now, this is what? The oligodendrocytes. I need you to notice something. Did you notice that this oligodendrocyte producing myelin sheet for this guy at the same time? Yes. That's the difference between oligodendrocytes and what? And Schwann cell in the PNS. Because Schwann cell, if there's one Schwann cell here, it can only be producing myelin for this guy here, only on this branch. Thank you, guys. So this is the ependymal cells, all right? And this is the astrocytes. What is the function of the astrocyte again? For BBB. Thank you. You guys are the best. Okay. Thank you for helping me not to spend too much time here. So this is Schwann cells. For PNS, we have Schwann cells and satellite cells. Schwann cells is exactly what oligodendrocyte does, all right? Ugly octopus, yes. But it's not as ugly as microglia. Microglia is more ugly than oligodendrocytes. Trust me, oligodendrocyte looks soft. Look at it now. It looks soft. See it now. It's an octopus, but it looks soft. But this is a more terrible and deadly octopus, right? Yes. It's more ugly than this guy. This guy looks soft and beautiful. Okay. So I want you guys to also know Schwann cell and satellite cell. Schwann cell, what do? Schwann cells in the PNS, right? Specifically the PNS, they help to produce what? Myelin sheets. And also they help to assist in regeneration of damaged fibers. I want you to notice something. In the CNS, regeneration is hardly possible there. But in the PNS, Schwann cells help for regeneration. Make sense? And also we have satellite cells. This one helps to insulate everywhere in the neurosoma. So you need to know what they're asking you, all right? So this is myelin sheet. I'm not going to talk about it. But remember, you see this thing, they always ask it in the exam. I think I should make it bolder. B. So they always ask this in the exam. Myelin sheets consist of the plasma membrane of the glial cells. 20% protein, 80% lipid. They ask this question every time. All right? Okay. So you can look up this. This is talking about neurolemma. Neurolemma is also very important. It's found in the Schwann cell. All right. It's also very, very good. Helping to produce nerve growth factor for regeneration. All right. So I don't want to go too deep into it. You see what I was talking about? This is Schwann cell. This Schwann cell is only taking care of this arm of the axon. But look at this oligodendrocyte. This guy, this axon, this axon, this axon. So that's the major difference between oligodendrocytes and Schwann cells, apart from where they are located. Okay. There is segmentation, node of Ranvier, internodes, initial segments, and trigger zone. I want you to go and look at it, all right, so that you will understand it properly. Now, these are tumors, and usually in physiology, they hardly ask you these tumors, apart from pathophysiology. That is pathology, part of physiology, all right? This question always comes out for people that are studying for patho exam and people that are preparing for NCLEX. You need to understand this. So glial cells and brain tumors, all right? One thing I told people is that brain tumors arises from the meninges, metastasis from organs that are not in the brain, that are not part of the brain. You understand? Like lung cancer goes to the brain. Do you understand? Bone cancer goes to the brain. They are deadly. But, you know, within the brain, because of that lack of mitosis, right, a lot of tumors don't grow in the brain. Even if they grow, they are hardly, you know, deadly. That's just the thing. All right. And another thing that causes brain tumors is glial cells. These glial cells, remember, they are not neurons. They are accessory. So these glial cells, they are mitotically active. The neurons are not. They are not mitotically active. So they hardly grow tumors. And remember, tumors need something that's mitotically active so that it can keep getting bigger. All right. And, you know, glial cells, their tumors is known as what? Glioma. All right. They pass the blood-brain barrier, decreases the effectiveness of chemotherapy, and blah, 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 blah. Okay. Other things like degeneration disorders of the myelin sheath. You talk about multiple sclerosis. Well, that you talk about Tay-Sachs disease. I want you to look these things up. Very important for you to know. Okay, I'm jumping. Okay, yes, they would ask you what helps in conduction speed of the nerve, diameter of the fiber, and what presence or absence of what myelin. If there is presence of myelin, fast conduction. If the diameter is larger, fast conduction. All right. But look at something like this. Now they will give you all this thing and tell you which one conducts the fastest. All right. This is small, unmyelinated. You know that this thing will have to be very slow. Small, and it's unmyelinated. It has every characteristics that will make it not to have fast conduction. All right. So these slow ones are usually found like in the GIT. So that's why if you eat food, it takes almost 4 hours for the food to digest because it will be contracted like this. That's how peristalsis work. Very slow. Very slow. You see me? Slow motion. But if it is a skeletal muscle, so most skeletal muscles are large and what myelinated what fibers, very fast. 120 meters per second. Very, very fast. But this one is here struggling at 0.5 to 2 meters per second. All right. So you need to understand so what they usually ask you is this diameter of fiber and presence of myelin. Remember that. Okay. So this is electrophysiology. I don't care about these people. Go read them up if you will love them so much. But don't share my love with anybody. Okay, nerve growth factor. There's something called nerve growth factor. They are proteins secreted by the glands, muscles, or glial cells and picked up by what? Axon terminals of neurons. So this nerve growth factor really helps, you know, for repair. It helps a lot for repair. All right. Okay, but there are some places it's not found. But, you know, that's by the way. In terms of electrophysiology, you need to know what electrical potential is and what electrical physiology is and what electrical current is. These 3 things are very important. You need to be able to know the differences between each and every one of them. We are 68. We are not up to 100 yet. Why? Better call them. I hope I sent message out. I don't know, but, you know, if you guys have group, put it in the group that I've already started. All right. Okay. So that it will benefit everybody, especially before I start the questioning. Okay, electrophysiology is the study of cellular mechanisms of producing electrical potentials and currents, blah, blah, blah. Electrical potential, you need to know it. That's the difference, all right? Then electrical current is the flow of charged particles from one point to another. You need to understand. What causes these flows, all right? Ions, such as what? Sodium and potassium, right? Passing through gated channels. You need to be able to understand this. There's something called RMP. We already discussed this in the muscle. If you don't understand this electrophysiology properly, please go to muscle physiology. I have the video here. All right, go to my channel, go to muscle physiology, watch it very well, understand it, because all these things are sequence, they are serials. Is this series or series? What am I even saying? So RMP is the resting membrane potential, all right, that exists inside the nerve fiber, all right. So there is the distribution between the extracellular fluid and intracellular fluid. Remember, this nerve fiber is considered as a cell. So inside it has its own fluid. That's why we call it what's the cytoplasm of a nerve. All right. So that inside and outside has its different constitution of ions. So inside the nerve cell, just exactly what I described before when I was talking about the nerve fiber for muscles. All right, the muscle fiber inside the nerve cell has RMP, resting membrane potential, and it's always negative. When it becomes positive, action potential arises. It raises the local potential rather. All right. Then potassium goes out. It drops the RMP. It takes it back to RMP. Sodium enters inside. It takes it out of RMP to positivity. So this keep going up, down, up, down, up, down movement. All right. Depolarization, repolarization, depolarization, repolarization, hyperpolarization, depolarization, repolarization, hyperpolarization. It keep going on until what? It gets to all the local potential, sums up to form an action potential. It now starts moving down from the axon hillock down to the axon. That's how it works. You know, so if you don't understand it properly, please go and look it up when I describe muscle physiology. It's the same thing. The same thing. Potassium has the greatest influence on RMP. We already know this. All right. Potassium is inside. Sodium is outside. Sodium flows inside. It becomes positive. So I'm not going to describe this, but I'll ask you a lot of questions on it. So I'm not going to describe it. I need you to go look it up. Now, you need to know the characteristics of local potential. Local potentials are changes in membrane potential of a neuron occurring at and nearby the part of the cell that is what stimulated. It is not up to action potential. So it has different characteristics with what action potential. What causes local potential? We know opening of sodium gates, all right, which allows sodium to enter into the cell, all right? Immediately soda enters inside, it triggers the entire zone. So I'm not going to spend more time on it. But remember, when sodium enters, it causes what? Depolarization. Depolarization. A change in membrane potential towards what? 0 MV. Remember, it is negative. So when it's going to 0 MV, it becomes what? Positive. All right? Okay. These are characteristics of local potential that you must know. They are graded, they are decremental, they are reversible, they are either excitatory or inhibitory. They are graded, unlike action potential that is not graded. They are decremental, they can get weaker. Action potential does not get weaker. They are reversible. Action potential is not reversible. They are excitatory or inhibitory. All right. So these are characteristics of what? Local potential. I'm just comparing the action potential. This is now action potential. All right. Okay. Just a dramatic change in membrane polarity produced by voltage-gated ion channels. So these are everything that happens in action potential. You understand? But the major thing you need to know is that sodium enters inside, potassium what goes out. When potassium goes out, it makes it more negative. When sodium enters inside, it makes it more positive. All right, until action potential what is reached. So look at it. Once it passes minus 55 MV, we call it what? Threshold. Immediately, it can get from this minus 70 to minus 40, minus 60, right? And it falls down. We call it local potential. It gets up again to minus maybe like minus 50. It falls down again. But anytime it gets to minus 55, all right, that is what we call what? Threshold. Minus 55 becomes threshold, and it immediately causes a depolarization. Don't worry, you see it more in the question, all right? Look at it. Okay, look at it. Let me describe it then. So what usually happens is the threshold is minus 55 MV. All right. The threshold is minus 55 MV. But the resting membrane potential, let me use this diagram. Look at the resting membrane potential. Somebody says she doesn't understand. So I want you to look at it because I'm going to ask you a lot of questions from this. So you really need to understand. Now, in the nerve cell, it's at minus 70 degree, minus 70 MV, right? Look at minus 70 MV here. That's what we call what? Look, resting membrane potential, RMP. I hope that is clear. Now, suddenly there's local potential from minus 70 to maybe minus 60, somewhere here. And it falls down. That is what we call local potential. It can increase and it is what? It can decrease, decremental. So local potential can fall down. But if this local potential continue rising until it gets to minus 55 MV, that's what we call what? Threshold. At this threshold, immediately it gets here, it will become an action potential. And once it becomes an action potential, it must get to this peak here, which is plus 35 MV. It gets here. So going up to this point is called what? Depolarization. Coming down is called what? Repolarization. So what you need to know is what causes depolarization and what causes repolarization. And even what causes this hyperpolarization. Because these are the things they will ask you in the exam. All right? Sorry. So the major constituent of the intracellular environment is what? Potassium, K. Meaning that potassium has the highest say for resting membrane potential. You understand that, I believe. Now, potassium, despite the fact that potassium is positive, right? But the inside membrane potential and it's inside inside the intracellular fluid, yet that intracellular fluid is minus 70. Now, imagine the gate opens, piam. Then sodium, mind you, sodium rush inside. What do you think will happen? Sodium is positive. So when sodium rushes inside, it will change that internal environment from minus 70 towards positivity. That's what happens here. So it was at minus 70. Immediately sodium rushes inside, it starts increasing. Start going up. All right. So what causes local potential or even action potential is sodium going in. So sodium makes it more positive. What makes it come back to negativity is what? Potassium. So immediately sodium enters inside, it becomes positive. Then potassium will be like, oh, you made me positive. You made this cell positive. Okay, I'll make the cell negative. Potassium will do what? Will go out. So potassium efflux, pay attention. No? So that potassium efflux leads to negativity. Potassium efflux leads to what? Repolarization, which is this guy here. That's why it's falling down, because potassium is going out. And you know potassium is positive. So if positive is leaving the cell, it will start falling back down to what? Negativity. So sodium makes it go up. Pew. Potassium makes it come down. Pew. But you should know which one is influx and which one is efflux. Influx is going in. So sodium going in is influx. Influx. That's what leads to what? Depolarization. And potassium going out is efflux. That's what leads to what? Repolarization. Now they will ask you what causes this hyperpolarization, because it becomes so more negative than minus 70. What causes this hyperpolarization is two things. One, more sodium still going out. One. Two, chlorine entering inside. Chlorine efflux. So instead of it just saying chlorine, you need to know efflux, efflux. That's where they catch you. Trust me, they know that you know that chlorine is negative. It inside the cell makes it more negative. They know you know that. But chlorine what? Because you see a question, they'll tell you, oh, so dash causes hyperpolarization. Option A, chlorine efflux. Option B, chlorine influx. Hey, you'll be like this. Oh Lord, I know this thing is, I know it's chlorine. I know it's chlorine. By then you pick your pen and you're eating your pen. I'm sure this thing is chlorine. Then you now close your eyes. You do, what do you people call this thing? Shoe, paper, scissors, say shoe. And you say sodium efflux and you fail it. So guys, what causes hyperpolarization is what? Potassium efflux, more potassium effluxing. Okay, rock, paper, scissors. Thank you. Potassium efflux and what? Chlorine influx. Potassium efflux and chlorine influx causes hyperpolarization. Okay. I believe somebody said she didn't understand. I believe you understand now, because I've spent a whole lot of time on this. Okay. So this is everything that happens. Please go look it up. So this is action potential. We've already discussed this. Yeah? It follows all on non-law, non-decremental, irreversible. All right. I don't want to waste too much time on these. So there's something we call refractory period. Somebody said I should not say evil. Yes, I'm not going to say evil. But we have refractory period. Refractory period is when it will not what? During an action potential and for a few milliseconds after, it is difficult or impossible to stimulate that region of what? A neuron to fire again. All right. So the neuron will know what? Fire. It will know what? Fire. I hope you see my hand. Fire. 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 For that few period. for that millisecond. That is called what? Refractory period. So no matter what you do to it, no matter where you put it, it will not rise. Right? We call that one absolute refractory period. No stimulus of any strength will trigger it, no matter where you put it. All right? Now we have relative refractory period. Only especially very strong stimuli. Okay, you do it very, very well. Very especially very strong stimuli. We make it what? Rise again. Rome has fallen. Thank you. Rome has fallen. There's nothing you can do. All right? You just have to, nourish it very well. Anyway, that's by the way, evil people. So this is what absolute refractory period. This is relative refractory period. I hope you understand what I'm talking about. Please don't die. Somebody said I'm dead. Okay, so this is signal conduction, saltatory conduction because of myelination. You have to go. It jumps. Pium, 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 pium. Somebody said I remembered. Perfect. Thank you for remembering. Thank you. All right, I'm really jumping these guys. Okay, now you need to know synapse. Very, very important that you know different types of synapse. All right, a nerve signal can go no further when it reaches the end of an axon. Pium. Remember, it starts from here. Pium. It gets to my leg. When it gets to my leg, can it go any further? No. So what does it do? It will trigger a neurotransmitter to be released. How does it do this? It will immediately call calcium. When action potential gets to the cleft, it calls calcium. Calcium jumps into the cleft and does what? Bust the neurotransmitters, vesicles, and push them, not cleft, the knob rather, and push them into the cleft. The knob is the end parts of that axon, that leg part. There's one large thing, all right? So it pushes. The cleft is the the distance between the presynaptic and what? The postsynaptic. I'll show you the diagram. So synapse between the two neurons. First neuron is what? The presynaptic. Is the one that releases the neurotransmitter. You must know this because they will ask you. That's why this is colored. Second neuron is the postsynaptic neuron. It's the one that has what? The receptor for the what? Neurotransmitter. So the one that produces the neurotransmitter is what? The presynaptic. The one that receives it using its receptor is what? The postsynaptic. So if they ask you, oh, a neurotransmitter, what has its where is the receptor found? It's found in the post. Guys, it's found in the post. What produces the neurotransmitter? The pre. Okay. Okay. So these are a lot of things you need to know, right? The presynaptic neuron, many dendrites, neurosoma, blah, blah, blah. So we have something we call, okay, so know that the presynaptic neuron may synapse with what? A dendrite, a neurosoma, or an axon of the postsynaptic neuron. All right. So the presynaptic neuron always brings information through the axon. The presynaptic is always the axon, but the postsynaptic can be anything. That's why I told you that we discussed that the dendrites helps to receive information, right? In majority, but not all. So the one that receives information through the dendrites, you understand? It's called what? Exodendritic, because the one that is bringing the information is bringing it through the axon compulsorily is the axon. But the one that is receiving now decides to receive with its dendrites. It becomes what? Exodendritic. Exodendritic. I don't know if you understand. Yes. Now, if you decide the one that is receiving, that's the postsynaptic, decides to receive using its cell body, it becomes what? Exosomatic. If it decides to receive using its axon, it becomes what? Exoaxonic. So you should always know that presynaptic always brings through what? The axon. Check it out. Why the post can have the axon, the dendrite, the soma, anyone, you can receive with any of them. All right? Okay. So this is diagrams. Look it up later. If you don't understand it, check my video. Look at the synaptic cleft. The synaptic cleft is the gap between the two. So this is my hand. This is the postsynaptic. This is the presynaptic neuron. This space in between them is called what? Synaptic cleft. This end part of this presynaptic is known as what? Synaptic knob. All right? This is where the neurotransmitter is released and it enters into this space, this synaptic cleft. All right. From here, it will come to the cell wall of this guy. All right. Because this guy, the cell wall, this postsynaptic has what? Neurotransmitter. It will now receive it. Immediately it receives it, it causes action potential inside here. So that's why its action potential is transferred from this presynaptic to this postsynaptic using the vesicles. I believe you understand. If you don't understand, you can always leave questions. All right. So synapses do exist, gap junctions and other things. All right. So this is what I was talking about. This is presynaptic. You see it. These are the vesicles. This is the cleft. This is the postsynaptic. These red things are the receptors. So it will receive this vesicle, this neurotransmitter through these receptors. I hope you understand this. In case of they bring it out in the exam for you, you should be able to know it. All right. So now the neurotransmitters can be acetylcholine, can be amino acid neurotransmitters, can be monoamides, it can be neuroleptides. All right. Acetylcholine, we already know acetylcholine when we did muscle physiology. Amino acid transmitters can be glycine, glutamate, aspartate, or aminobutyric acid. That's GABA. GABA aminobutyric acid. All right. So all these things are called what? Amino acid neurotransmitters. They may ask you, oh, one of the following is not a neurotransmitter. One of the following is an amino acid neurotransmitter. So you should know which one is amino acid neurotransmitter. You should actually know it because they contain what? Amino acid. That's why. So this glycine contains amino acid. Glutamate does. Aspartate does. GABA does. All right. Now we have the ones we call monoamines. Mono what? Amines. Only one amine. All right. Synthesized from amino acids by what? Removing carboxylic group. You understand? But they retain this one amino group. Example is what catecholamines, like what? Epinephrine, norepinephrine, dopamine, also histamine, ATP, and serotonin. So all these guys are what? Monoamine. So you need to know which ones are monoamine. Your question may be, one of the following is a monoamine, or one of the following is what? An amino acid neurotransmitter. You should be able to know the difference. All right. Then we have the neuropeptides. Neuropeptides like adenosine and what? ATP. Okay. The structure is not really very important. Nobody's going to ask the structure. So don't kill yourself about it. All right. So remember, synapses vary, right? There are excitatory neurotransmitters and inhibitory neurotransmitters. Excitatory excites, inhibitory inhibits. So some receptors are for excitatory, some receptors are for what? Inhibitory. Very, very important for you to know. All right. Now there are three different kinds of synapses. We have the excitatory cholinergic, inhibitory GABAergic, excitatory what? Adrenergic. Excitatory cholinergic. So cholinergic is excitatory. GABAergic is inhibitory. And adrenergic is excitatory. They may ask you, one of the following is an excitatory synapse. That's what they may ask you. They'll give you cholinergic, they'll give you GABAergic, they'll give you adrenergic. Then they will add one more thing, maybe brocholinergic. For people that are living in Brooklyn, brocholinergic. Some people will choose the answer. Okay, so cholinergic synapse, we say that it's excitatory, right? Somebody's in Brooklyn. I am already seeing them. Okay. So cholinergic synapse, we said it's excitatory, uses what? Acetylcholine. All right. We already know this thing. This is exactly what happens in the muscle. They may ask you what triggers exocytosis of the acetylcholine. What triggers it? It's calcium. Remember, I told you when action potential gets to that synaptic knob, right? What does it do? It opens way for calcium to enter inside. It causes calcium to enter inside. And when calcium enters inside, it will burst those vesicles and push out what? Acetylcholine. That's what happens for cholinergic. Very, very important. Then from there, the depolarization starts happening. This is it. You see? Calcium enters. Immediately action potential comes in. Calcium enters here. Bust these guys. These guys, oh, we've been busted. We've been busted. All of them rush into where? This place, the synaptic cleft. What happens when they rush into the synaptic cleft? Look at the green thing. That's the acetylcholine. It attaches itself to the receptor. This is the receptor, the red stuff. Right? When it attaches itself to the receptor, what does it do? That's another question that we ask you. What happens when it's attached to the receptor? Immediately it's attached to the receptor, it opens the potassium. Potassium rushes in into the cell, raising the local potential up. Depolarization happens. Immediately, sodium rushes in. Did I make a mistake? Sodium rushes in. Then immediately, potassium opens up, but potassium rushes what? Out. So immediately, this acetylcholine laps on this receptor. First thing that happens is sodium rushing in. And after that, potassium rushing out. Then sodium rushing again, potassium rush out, sodium rushing again, potassium rush out. So the difference, end plate potential, right? If the difference gets to threshold, it will shoot action potential. So action potential will be automatically transferred from this guy presynaptic to what? This guy postsynaptic, using what? Neurotransmitters. Okay, please, this thing should end. So this is GABA. GABA is inhibitory. So what do you think it will use? It will use what? Chlorine. It's a simple thing. GABA receptors are chloride what channels. All right. So when it is GABA as the neurotransmitter, chlorine will what enter, leading to what inhibition. So postsynaptic neuron is inhibited. So remember, GABA uses what chlorine. GABA uses what chlorine. All right. Why cholinergic system uses what acetylcholine and it's excitatory. All right. GABA uses a chlorine and it's what inhibitory. It's it's common sense. I believe you know it. Now the last one is that we're going to discuss for this level. There are other neurotransmitters, but they are focusing on this major three. The last one is what the adrenergic synapse. What does it employ? The non-epinephrine or not adrenaline. All right. Then from there it causes the cyclic AMP to move the G protein, and the G protein we move to the adenylate cyclase. Adenylate cyclase. Let me see if I can see a diagram and explain it better. Okay, perfect. This is a good diagram. I believe you guys know this thing. I discussed this thing before. All right. I'll remind you. I don't know if any of you have been around when I was describing something with the bouncer on the gate. All right. Somebody came. The first, we call it first messenger. So this norepinephrine, this is adrenergic system. Norepinephrine is the first messenger. What does he do? It comes to lap on this neurotransmitter receptor. I call this neurotransmitter receptor the bouncer on the door. What does this bouncer do? The bouncer removes his shoe, all right, and gives to the second bouncer. Now, that shoe he removes is the G protein. The G protein. So this the receptor removes this G protein and sends it to this second bouncer, still on the wall. Adenylate what? Cyclase. What does this second bouncer do? Immediately he receives the shoe, you say, oh, okay. Then he brings ATP, breaks ATP down to produce what? CAMP. CAMP is the second messenger. First messenger is the norepinephrine here. Second messenger is the CAMP. Those CAMP will now start doing a whole lot of things. What does he do? A lot of possible effects, like what? Enzyme activation, metabolic changes, right? Transcription, enzyme synthesis. And the most important of all it will do is what? It will open what? The sodium channel. Immediately the sodium channel opens up. What happens? Sodium rushes inside. Leading to what? Leading to action potential. Everything becomes positive. That is how it causes what? Excitation. So at the end of the day, CAMP will open sodium. So this is very stark difference to this guy here. Very stark difference to this guy. Let me see. To this acetylcholine. You see the difference? This guy is excitatory. This guy is also excitatory, but they use different mechanisms. I need you to understand that. All right? If you don't understand, you can always write that you don't understand. I will explain later. Then at the end of the day, what happens? Look at this guy here. When the excitation has happened, remember during muscle, what did I tell you what happened? When sodium enters, potassium goes out, sodium enters, potassium goes out, sodium enters, potassium goes out, it causes action potential. For muscle, this is neuromuscular transmission, not neuroneuronal, because what we are discussing is neuroneuronal. But if you understand it with neuromuscular, it's the same thing. So when sodium enters, potassium goes out, sodium enters, potassium goes out, it builds action potential. The action potential will go round on the cell membrane, and enter inside the muscle fiber. Enters inside the muscle fiber through what? I'm just recapping for people that we understand or remember. Enters into the muscle fiber through what? The T-tubule. Remember I told you about the T-tubule and two sisters. Those two sisters are the sarcoplasmic membrane, right? Sarcoplasmic membrane, or the cisterns, which are the terminal end of the sarcoplasmic reticulum. What do they contain? They contain what? Calcium. All right. So that action potential will pass through the T-tubule. Immediately it passes through the T-tubule. What will happen? To push out calcium. The calcium will go inside. Inside. And you see the calcium holding on to what? The door handle. What is door handle? Troponin. To move troponin. All right. Then troponin is on what? The door itself. What is the door? Tropomyosin. So when the handle is moved, troponin moves tropomyosin. Right. The tropomyosin will open the active site of actin, and the myosin outside will lap on the active site of actin and cause what? Contraction. So that's what happened. But the question I want to ask is, at the end of it all, what happens to the acetylcholine that is attached on this receptor? Okay, guys, look at it. Immediately after, at the end of the day, this acetylcholine that's attached to this receptor, look at this green thing. Look at it. It has to break down. What is breaking it down? ACHE. That's acetylcholinesterase. You must remember this. You must remember this. Acetylcholinesterase is the enzyme that does what? That breaks down acetylcholine. Does it break it down to? It breaks it down to what? Acetate and what? Choline. Acetate will go out And calling, we do what? We enter back into this place through this channel, enter back, pew, and enter the vesicle again. Then the contraction will stop. So that's or the excitation will stop. So that's exactly what they are trying to describe here. That they call it cessation of the signal. You see how it moves back, choline goes off, choline goes back here, acetate goes up. But what you need to know about is ACE. ACE. All right? Okay. So these are everything you need to know about the excitation and the inhibition. I'm not going to discuss all this. We've already discussed the EPEP. Another thing you need to know about ACE is that in skeletal muscle, it excites it. It causes contraction. That's what we discussed in muscle. But for the heart, it inhibits the heart. It inhibits cardiac muscle because of what different ACE receptors. So there are different ACE receptors on the heart. So it inhibits it. So if ACH is causing a sympathetic, all right, it's sympathetic, like making everything active, to be causing a parasympathetic, a sympathetic on the skeletal muscle is causing what? Parasympathetic on the cardiac muscle. Everything is more relaxed on the cardiac muscle. So you should remember that, all right? Basically. So other basis of memory, we talk about synaptic plasticity, synaptic presentation. Plasticity is the ability of synapse to change. Presentation is the process of making the transmission easier. All right. We have immediate memory, long-term and short-term memory. We discuss this when we talk about the brain. All right. This immediate memory to hold things like, oh, what did you eat yesterday? I'm talking to you. What did you eat yesterday night? Okay, yesterday morning. What did you eat? What's the color of clothes you are wearing yesterday? So all these things are just short-term memories, all right? Now, this is STM, that's short-term memory, all right? Exactly what I've discussed. There's something we call tetanic stimulation. It's rapid arrival of repetitive signals at the synapse, all right? This one helps to foster what? Brief memories. Causes calcium accumulation and makes postsynaptic cell more likely to fire. That firing is, when you are, trying to retain things. We call it tetanic stimulation. Then we have the post-tetanic potentiation. It appears to be involved in jogging a memory from a few hours ago. Calcium level in the axon terminal stays elevated. So the higher this calcium is, the more you remember things. All right. So don't worry, we'll discuss it later. This is a long-term memory, LCM. Memories that can last for lifetime. For example, the fact that I'm bringing out this time to discuss with you guys is going to enhance your long-term memory of me. You will always remember Nchebe. You understand? When you guys are now in the clinic earning a lot of money, people should remember me. I'm buying me no. What do I want? I want Mercedes. No, Ferrari. That's what I want. Okay. So types of long-term memory, we have explicit and we have implicit. Explicit is retention of events you can put into words. All right. You must think to remember these events. Implicit is reflex. For example, driving car. That's a reflexive or implicit long-term memory. Do you think when you want to drive car, somebody said lemons are oatmeal? Do you think when you want to drive car? No, you didn't. You don't think when you want to drive car. That's what we call implicit or reflexive or unconscious memory. You already know it. You know where to do your hand. You know how to navigate. You don't think, oh, are you sure I'm not going to go off the road? No, it's just there. All right, that's what we call implicit. Then we have explicit. Explicit is like if I tell you now, I discuss muscle physiology for me. Okay, I will test your explicit retention when I start giving you questions. I will test it. All right. So long-term potentiation involves what? NMDA receptors, all right, on dendritic cells and blah, 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 blah. Calcium acts as a second messenger. Later, you look it up. This is long-term depression. This is Alzheimer's disease. Later, you look it up. Atrophy of the gyri in cerebral cortex as a result of what? Like for people that are going to do, people that are going into medicine, internal medicine, nursing, you have to understand Alzheimer very well because it's very common in the US. All right, it's usually as a result. They will ask you what they will ask you in pathology is what causes it, usually. All right, or they'll tell you about the patient that comes to the hospital clinic, forgetful. They'll just give you the concept of Alzheimer and tell you what do you think if this patient dies, what do you think will be found in the brain of this patient? That's when you talk about neurofibrillary tangles and what senile B amyloid plex. They will ask you if the patient dies, what will you see? That's the major question that comes out, especially for you guys that are preparing for NCLEX. This is the kind of things they will ask you. All right. Okay. Then this is the treatment. What are we treating these patients with? We are treating them with NGF or cholinesterase inhibitors. Why? Nerve growth factors. Okay, I understand this, but why cholinesterase inhibitors? Cholinesterase, remember what cholinesterase is. All right. It's what breaks down what? The ACH. Breaks it down into choline and acetate, what we've discussed before. So when I give something to inhibit that thing that breaks it down, what will happen? It means that the ACH will remain more in the cleft. And when ACH is more in the cleft, it will continue what? Exciting the receptors, causing more excitation in the brain. All right? For you to be able to remember things. That is memory. That's how it works. Okay, these are the tangles that we're talking about. These are the tangles. You see the neurofibrillary tangles. These are the synapses. All right. Then we talk about Parkinson. What causes Parkinson? Progressive loss of motor function. All right. Usually as a result of degeneration of dopamine-releasing neurons. Where? Because the question they will ask is where. In short, they will give you a diagram and tell you to point where it degenerates. For people that are preparing for NCLEX. You say? What inhibits? What are you asking? Are you talking about the NGF? NGF is nerve growth factors. Nerve growth factor is what helps the nerve to repair the nerves. All right. Cholinesterase inhibitors. Look at what is cholinesterase inhibitor. Let me go back to this diagram. Just pay attention. All right. See this diagram? Do you see? This is acetylcholine, right? Remember, I told you that when acetylcholine is done with all this firing in the brain, acetylcholinesterase will break it down. Acetylcholinesterase will break it down into what's choline and acetate, so it will stop firing. But in people that has Alzheimer, what happens? This guy doesn't work very much. So what do? We give it cholinesterase inhibitors. Cholinesterase inhibitor will inhibit this guy. You see this blue thing that's wrapping this acetylcholine. It will inhibit the acetylcholinesterase. If it stops something that is going to break down the acetylcholine, what do you think will happen? There will be more acetylcholine in this cleft. That's just what we are telling you. The idea of that medication is just to allow more acetylcholine in that cleft. So if there's more acetylcholine in that cleft, what do you think will happen? It will cause more firing, more excitation. And that excitation is what helps memory. Okay, we'll discuss it more when we talk about questions, all right? So for Parkinson disease, all right? Thank you, okay. I heard wrong, okay, it's fine. So for Parkinson disease, all right, we need dopamine. What does dopamine do? Dopamine stops unnecessary motor movement. You see how my hand is going like this? If I do like, I love you guys. Do you understand? If I do like, I am the one that decides to do it, voluntary. But imagine my hand is like this, suddenly my hand do like, without me knowing. That is involuntary movement. So what dopamine does for you and for me is to stop those involuntary movements so that any movement I will make will be what? Voluntary. Chicken. It's as simple as that. So a situation where that particular place that coordinates it is a substantia nigra. That's where the dopamine receptors are. Now, in that particular substantia nigra, if there is degeneration of the receptors, remember, guys, in anatomy, we talk about what? When we talk about the messengers, we always talk about the receptors. Why? There must be a receptor to receive that messenger. All right? Professor, you are here. I greet you. So there must be what am I saying? See, Professor, you've confused me. So there must be a receptor. All right? That's what you guys need to know. There must be a receptor to accept. Okay, let me give you an example. Diabetes mellitus. I gave this example in class. Diabetes mellitus, myasthenia gravis, the same pathology. What is the pathology? The receptors are not there. Diabetes type 2, for example, the receptors that receives what? Insulin. Remember, insulin mops up the excess glucose, and converts it to glycogen, correct? So that it will not be in the cell because it's toxic to everything we are doing. Problem with insulin. So no, diabetes type 1 is problem with insulin production in the pancreas. Problem with insulin production. But type 2 is not problem with insulin production. It's problem with the insulin receptor. So look at this diagram. Let me give you this diagram for you guys to understand. Look at this diagram, for example. Just imagine this ACH is produced, right? But there is no receptor here. Do you think anything will happen? No. Nothing will happen. You are just producing ACH, but nothing will happen. That is the problem with what myasthenia gravis. That's why myasthenia gravis is what is an inhibitory type of paralysis. We call it what? Flaccid paralysis. So what happens is that the receptors are not enough. The same thing with dopamine. The receptors are not enough. All right. So there are two things you can do. You can either do anything that will increase the amount of receptor. All right. But in the brain, you can't put more receptors. So instead, what do? We want to give you something that will lead to more of that neurotransmitter in that place, so that even if there are few receptors, those few receptors we be able to catch all the neurotransmitters. So for dopamine, for example, all right, for dopamine, for example, there is a reduced receptors of dopamine. Sorry, for Parkinson, there's reduced receptor for dopamine. If there's a reduced receptor for dopamine, even if you have enough dopamine, all right, what will happen? There is not enough receptors to catch the dopamine, and before you know it, the dopamine has broken down. And dopamine, if the dopamine matches on the receptor, it will stop the firing. So, but because there's not enough receptors, the dopamine produced don't have something to match on to stop the firing. So, because of that, what will you have? The person will start moving, uncontrollable movements, tremors. That's what happens in the brain. So, what do we usually do for dopamine? We give you what? We give you all these things that will increase dopamine there. For example, MOAs will slow neural degeneration, but the major thing we give you is what? Dopamine precursors like carbidopa, L-dopa. What do? Carbidopa will pass the BBB, go to the brain, and keep a lot of dopamine there for a longer time. So when it keeps it for a longer time, even if there are small receptors remaining, those receptors will have a lot of dopamine for a long time before the dopamine breaks down. I'm not teaching pathology. Okay, guys. So that is that for this discussion. Time for question. We really took time here, but I understand this is neuro, guys. Neuro is tough. Sorry to say that. Neuro is tough, but you know we will toughen it. So I want to give you questions now. Are you guys ready? If you are ready, write yes in the thing. If you are ready and activated, I need all of you to be activated, firing in very high wavelengths. I need your stuff to be firing up there, because I'm going to throw questions and I'm going to be very fast. And each question, I'll be expecting 20 people to respond to each question. Our discussion will be fast, will be long. Trust me, not fast. It will be long. The idea of this is for you to consolidate what you already know. This is not. You see how I jumped? Normally, this course, this stuff, I can teach it for like 3 hours. All right, but I jumped very fast. All right. Because the idea is for consolidation, not for teaching. Consolidation. I need all of you to smash your exam. No matter what your professor gives you, you should be getting 100. All right, as far as neuro is concerned. Okay. So since all of you said that you are ready for me, let's check your explicit memory. Testing the microphone. Testing the microphone, guys. Now, I'm not giving you option here. I need you to write, and there are 2 answers. All right, like that's 1 bracket. There are 2 answers you have to give me. All right. So, guys, number 1, testing the microphone. The dash division carries signals to the smooth muscle in the large intestine. Guys, you will have to help yourself. And how do you help yourself? You must make comments. All right, that's the rule. Please, you have to make comments. No, I said the answer has to be 2 answers. Let me give you options. visceral sensory, somatic sensory, visceral motor, somatic motor, something like that. The option visceral sensory, somatic sensory, visceral motor, somatic motor. Once I get 20, I'll be counting it. Once I get 20 answers, I'll tell you the right answer and we move. I'm reading it for the benefit of people that will watch this later, because you will still need this later. The Dutch division carries signals to the smooth muscles in the large intestine. Visceral motor, sensory motor, visceral sensory, somatic sensory, visceral motor, somatic motor. Is it up to 20? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Exactly 20. Yes, the answer is what? Visceral motor. Who is confused? Please, any question you are confused in, say 911. All right, or emergency. Don't keep quiet, though. I'm here for you. Trust me. If you say 911, I'll stop everything I'm doing and explain it. I don't care if anybody wants me to be fast or not. I'm not. If you are anytime you're tired, anytime you're tired, you can go off, all right? Because I know this will be a pretty long discussion. You need to understand the brain. I'm not just teaching you to pass your exams right now. I'm teaching you so that when they ask you a question in the clinic, you can answer. Please. And if you get the answer, if they ask you that question in clinic, you get the answer. They ask you who taught you. Tell them it's Nchebe. But if you fail the answer, if they say who taught you, tell them that it's one professor that uses glasses. I can't remember his name. Please don't call my name if you don't get the answer. Don't call my name. Yes, the answer to that question is what? Visceral motor. All right, we got this. Perfect. And if you don't know the answer, please don't call me. Don't call my name. Please call the name of another professor. Okay, guys. Testing the microphone. The Dutch division tends to prepare the body for action. A, sensory efferent. B, motor efferent. C, somatic motor. D, parasympathetic. E, sympathetic. This one is just a giveaway now. The Dutch division tends to prepare the body for action. 20 people. 20. Keep going. It's up to 20. Perfect. You guys are very active. Oh. Everything is firing in your head very fast. Everything is firing. Okay. Look at this question. Which of the following is an effector? Thank you, guys. The answer is sympathetic. You are very correct. The answer is sympathetic. You are extremely correct. Look at this question. Which of the following are effectors? I'll give you options. A, receptors. B, stimuli. C, reflexes. D, glands. E, sense organs. A, receptors. B, stimuli. C, reflexes. D, glands. E, sense organs. Let's go, guys. Let's go. Everybody needs to be active and engaged. Let me tell you, even if you think you know the answer and everybody's picking the answer, when you type it, your brain will register it. I'm telling you, that's how you consolidate knowledge. Don't say, oh, they have already given the answer. Let me just stay and be watching. No, just type it. Oh, everybody's saying glands, and I know glands is the answer. Type glands. Cha, 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 cha. Trust me, when you see something similar, you will remember. Now, yeah. Welcome. Okay, guys. Yes, you guys are very correct. The answer is glands, all right? Yes, D. What is another name for? Yes, you guys are so correct. You guys are very active and engaged. I love it. Look at this. What is another name for the autonomic nervous system? Another name for autonomic nervous system. I can give you option if you want. A, visceral sensory division. Somatic sensory division, visceral motor division, somatic motor division. C, central nervous system. A, visceral sensory division. B, somatic sensory division. C, visceral motor division. D, somatic motor division. E, central nervous system. Guys, when we are done with this, we do spinal cord. Spinal cord is actually shorter. But the one that will take us more time is the brain, because we are going to do the brain this night. We are going to do everything. If you're tired, that's fine. But I will remain with people that are here as far as you are up to 20. If you don't know the answer, just still type it. If you don't understand it, tell me 911. Okay, I believe everybody understands this. The answer is visceral motor division. Did anybody get it wrong? No. Perfect. You guys are very active and engaged. Very, very, very active. Okay. I'm still testing the microphone. Don't brag. Don't think you got it. I'm still testing the microphone. Yes, it's visceral motor. Don't brag. I'm still testing the microphone. All right, this one I'm not giving options. Some dash neurons are specialized to detect stimuli, whereas dash neurons send signals to the effectors of the nervous system. All right, answer. A, efferent, afferent. B, afferent, efferent. C, motor sensory. D, efferent inter. E, afferent inter. Efferent, that's E. Efferent, A, or afferent. E, A. The second one is A, E. Efferent, efferent. The third one is motor sensory. The fourth one is efferent, E, and inter. The fifth one is A and inter. Efferent and inter. Come on, guys. You guys are so very correct. Let me see if anybody got it wrong. No. Ha. I'm already hot. I'm dealing with hot people here. Somebody's sleeping. Did I see somebody sleep? Wake up. Why are you sleeping? It's too early. Oh. This is just 8:16. I wonder what you do by 12 o'clock. So the answer is what? A, E. Efferent, efferent. Efferent takes it up. Efferent brings it back. All right? They can give you the answer as sensory, motor. Sensory, take it up. Motor, bring it down. See me dancing. It's not a little thing. People like me, I can dance so much if I'm sitting down. Let me stand up now. Dancing has ended. Oh boy. We are still testing the microphone, guys. Trust me, we are. About 90% of the neurons in the nervous system are dash neurons. Hurry, 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 hurry. I need 20 people. Quickly. About 90% of the neurons in the... You see, I told you this kind of question always comes out. Let me see if everybody we get it. About 90% of the neurons in the brain, the nervous system rather. You guys are so brilliant. Too. Everybody's getting it. Is everybody here in the US? No, I'm very sure that some Nigerian students are also here. Okay, look at this. What is the most common type of neuron? Quickly. Yes, that answer is interneuron. Yes, interneuron is the correct. But what is the most common type of neuron? Quickly. What is, yes, I know you're answering for the other one. Interneuron is very correct in the other one. What is the most common type of neuron? Multipolar, bipolar, unipolar, Amazonic, dendritic. Quickly, guys, quickly. Perfect. Multipolar. You guys are so hot. Don't bomb me up. Oh. Okay, look at this one. Yeah, multipolar is correct. Look at this one. Most metabolic and regulatory functions in a neuron happen where? Which part of the neuron houses the most metabolic and regulatory function? The axon, the cell body, the dendrites, axon hillock, Schwann cell. Quickly. Quickly, guys, quickly. Don't tire out. Okay, we are up to 80 now. That's good. quickly. The faster, the more questions you get. Because, and the truth of the matter is that when you get more questions, it's easy for you in the exam. If you get more questions in my review, it's always easy for you in your exam. Trust me. I can easily just give you 10, 20 questions, but I always want more questions so that you'll be, more excited. All right. Like your brain will be more excited. The more questions you see and get it, the more strong you are in your exam. Someone said 911. Okay. The answer is actually cell body. In the cell body, that's what coordinates a lot of things, right? Remember, the dendrites are there. It collects the information and pushes it there in the cell body. So the cell body regulates everything, arranges everything, then, pushes it out, all right? So, yeah, the cell body. Look at this question, guys, quickly. Which glial cell is found wrapped around axons in the PNS? Which glial cell is found wrapped around axons in the PNS? Quickly, guys. Quickly. Okay. I see somebody say oligo. Oligo is not in the PNS. So if you see oligo in that option, throw it away. Remember, in the CNS, we have 4 of them, right? 4 glial cells. Can you still remember? Yes. Oligo, that's CNS. Oligo, ependymal cells, astrocytes, and microglia. Why in the PNS, we have what? We have the Schwann and the satellite cells, double S. Yes, the answer is what? Schwann cells. And Schwann cells is wrapped around, right? Where it produces what? It produces about somebody wrote Schwann and said that is 20. You want me to move ahead? No, I want everybody to be part of it too. Okay, look at this question. We are still testing the microphone, guys. I've not given you any question. This one is just testing the microphone. I want everybody to be excited and be here before we start. In which part of a neuron is the postsynaptic membrane usually found? Axon terminal, axon dendrite, pericardium, axon collateral. We are still testing the mic. Let's go, guys. Let's go. Let's go, guys. Yes, the answer is dendrites. Okay, we got more than 20. The answer is dendrites. So I need you to put that in your head. Look at this question again. Quickly. I really like the fact that you guys are very fast. So I'm also going very fast. What is the primary site on a neuron for receiving signals from other neurons? What's the primary site, guys? Quickly. Move it. What's the primary site? 20 people. Dendrites. You guys are so wow. Then I think I'll just let me ask few of these microphone questions, then I'll go to the main thing. No, I'm not asking this question. Or should I ask it? Let me just ask it. Let me ask it and test if you are with me. Okay, yes, guys, the answer is dendrites. The same question, really? No, it's not really the same question, but it's just the same answer, but different question pattern. So look at this question. Which cells form myelin sheets in the spinal cord? Quickly. Spinal cord. Quickly, guys, quickly. I want everybody, we are up to 80 here. So why am I not seeing too many answers? I want to be seeing answers and say, please, or you say no for type. It's fine. You can actually type, right? Spinal cord is CNS, so it's oligo. Perfect. So the answer is what? Oligodendrocytes. You guys are very correct. Look at this question quickly. A myelin sheet is composed primarily of dash. Let me give you the options. A, lipids and proteins. B, carbohydrates and proteins. C, glycoproteins and carbohydrates. D, proteins and glycoproteins. E, polysaccharides and proteins. A myelin sheet is composed primarily of dash. A, lipids and proteins. B, carbohydrates and proteins. C, glycoproteins and proteins. And glycoproteins and carbohydrates. D, proteins and glycoproteins. And E, polysaccharides and proteins. Let's see. Somebody is giving me the percentage. Oh, Jesus, these people are hot. Oh. Your hotness is touching me. It's giving me heat. You know, I'm wearing a cardigan. Please don't hit me up. Okay, you guys are so correct. The answer is lipid and protein. Now look at this question. Look at this question. So just give me a minute. Let me put the option answers in the option. All right. This is the question. This is A. This is B. This is C. This is D. People are too hot though. So conduction of a nerve impulse would be the fastest in which of the following? A large diameter myelinated axon. B, a small diameter myelinated axon. C, a large unmyelinated axon. D, a small unmyelinated axon. And E, a small axon with multiple Schwann cells. Let's go. Let's go. Let's go. Let's go, guys. Perfect. Perfect, guys. You guys are so correct. No. You guys are so correct. It's not small myelinated. It's large diameter myelinated. I told you myelination and the size. The diameter is directly proportional to the amount of conduction. All right. So the larger the higher conduction. Same thing to myelin sheets. They're direct proportionality. All right. So the answer is A large diameter myelinated. All right. Look at this question. So A is correct. You guys are so good. Look at this question. Let me see. Which of the following ions has the greatest influence on the resting membrane potential? I'm not giving you option. Trust me, I'm not. Sorry. Let's go, guys. Let's go, guys. Which one has the highest influence on RMP? The one I told you that is more in the RMP. Okay. Yes. Yes, you guys are so correct. Somebody said 911. So RMP is resting membrane potential, right? Inside the cell is negative, right? So what controls that resting membrane potential is potassium. Potassium is the highest intracellular what? Cation. All right. Extracellular cation is sodium. That's why sodium is always influxing. Why potassium is what? Effluxing, going out. So the answer is potassium. You guys are so correct. Look at this question. Where do most local potentials form in a neuron? Where do they form? The dendrites, the cell bodies, the axon hillock, the trigger zones, the Schwann cells. Answer. It's okay. Where do most local potentials form? Okay, so the answer is dendrites. For people that are confused about it, yes, you asked me on Thursday. The answer is what? Dendrites. Dendrites is, where catches, you remember, it catches the stuff, it forms the little things. Exon hillock is what checks if it is enough to give out action potential. All right, but the dendrites is what catches most, remember, not all, most local potential. Cell body is involved in every other thing, like the coordination, the different functioning of the cell. All right, but what catches that local potential is dendrites, please. So look at the option. The option says the dendrites, the cell bodies, the exon hillock, the trigger zone, the Schwann. They want to confuse you. Please don't choose cell body. The answer is dendrites. All right, don't choose cell body for any reason. Okay, look at this question. Please, I'm going to put the question, then I will put the options. All right. So just pay attention. Let me put the options so that you'll be able to attempt it. This is the question. This is A. This is B. This is C. This is D. And the problem is that most of these options are almost E. So just to confuse someone, this is E. So in a neuron, the opening of sodium gates typically leads to dash. A. Repolarization of the plasma membrane. B. Hyperpolarization of the plasma membrane. C. Depolarization of the plasma membrane. E. Drifting of plasma membrane voltage toward a more negative value. And E, the last one, plasma membrane voltage returning to the RMP. So what you need to do, if I am you, is to put what leads to each of these options. All right. So that when you see this same question in another format, you won't even think twice. You won't be confused. Yes, the answer is C. You guys are so correct. The answer, somebody said 911. Oh, okay. Look at what we are talking about here. Let me share this screen again. Hold on. Somebody said 911. So I am under obligation to share this. So I want you to look at this. Where is this? Look at this diagram. This is what they're asking you. This depolarization. What leads to this thing going towards positive? You see, it's going towards positive, means that it has to be what? Sodium. That's what they're asking you. All right. Somebody said 911. So that person that said 911, they're asking you this depolarization, this number 3, depolarization. What causes this number 3 is sodium. All right. Sodium channel, when the gates open, sodium rushes inside. Sodium is positive, coming out from outside, entering inside a negative environment to make the cell what? Positive, leading towards depolarization. Okay. I believe you understand that. Okay, let me give you. You see why I told you that you really need to understand this. That's why I want to give you series of questions now to try and see your understanding. I'll pay attention. Let me read out these options. Which of the following will cause the plasma membrane to hyperpolarize when at its RMP? A. Inflow of sodium. Are you okay? I am okay. I'm fine. Why? Okay, is it my leg? I'm still having a serious. The leg is still hurting me badly, but it is what it is. Which of the following will cause the plasma membrane to hyperpolarize when at its RMP? A. Inflow of sodium. B. Inflow of potassium. C. Inflow of calcium. D. Inflow of chloride. And E. Outflow of chloride. No, no, no. No, I didn't call your name. Is it because I said inflow of sodium? I did not say inflow of sodium. A, inflow of sodium. B, I should not even call option for this question, but I'll call option. Inflow of sodium, inflow of potassium, inflow of calcium, inflow of chloride, outflow of chloride. What's the answer? Yes, inflow of what? Chloride. I told you, inflow of chloride causes what? Hyperpolarization. Remember it. Chicken now. Inflow of sodium will cause depolarization. All right. Aha. So look at this question. Local potentials are dash, meaning they vary in magnitude according to the strength of the stimulus. What's the answer? Local potentials are dash, meaning they vary in magnitude. What's the answer? I don't know if that worked. Sorry, it came up. You replied 911, but was probably lagging. Another person who commented. Okay, you're talking to Sarah, not to me. Okay. Yes, you guys are so correct. The answer is graded. The options is stable. What's stable? Okay, stability. Graded, self-propagating, excitatory, inhibitory. All right. Okay, yes, it's graded. Yes, it's graded. Look at this question. Very fast. Which of the following is most likely to cause a rapid depolarization? A, opening of chloride channels. B, opening of sodium channels. C, opening of potassium channels. D, inactivation of sodium channels. E, closing of sodium channels. Which of the following is most likely to cause a rapid depolarization? A, opening of chloride channels. B, opening of sodium channels. C, opening of potassium channels. D, inactivation of sodium channels. And E, closing of sodium channels. Let me see. Do I have up to 20 people? 1, 2. Sorry. 1, 2, 3, 4. 19, 20. Yes, you guys are very correct. The answer is B. Yes, somebody said, let me see. Somebody said D. D is what? Inactivation of sodium channels. If sodium channels become inactive, all right, the depolarization will stop. All right? The depolarization will stop. The first one says opening of chloride channels. It will lead to hyperpolarization. The third one says opening of potassium channels. Potassium will start leaving. It will lead to what? Hyperpolarization or what? Repolarization. All right? So the answer is what? Then they said inactivation of sodium channels or closing of sodium channels, the same thing, to stop the entire process. All right. Then, but the answer is what? Opening of sodium channels. Opening of sodium channels. I really want to give you guys more questions to avoid any problem for you. Look at this question, guys. I'll call out the option, so pay attention. I'll call it once. A neuron receives a stimulus. Which of the following events happen? A neuron receives a stimulus. Which of the following events happen next? A, local potential develops. B, threshold is reached. C, hyperpolarization of the membrane. D, repolarization of the membrane. E, a resting membrane potential is established. Yes, you are correct for that question. Yes, the answer is B. Yeah, you're correct. That's opening of sodium channels. But we are in another question now. A neuron receives a stimulus. Which of the following events happen next? A local potential develops. B, threshold is reached. C, hyperpolarization of the membrane. D, repolarization of the membrane. E, a resting membrane potential is established. Yes, the answer is A. You guys are so correct. A local potential develops. Once a stimulus receives once a neuron receives a stimulus, it develops a local potential. And if that local potential keep growing and gets to threshold, it becomes action potential. Okay. Oh. This is the question I want to see people that they are explicit. This thing is working. In an action potential, which event directly follows repolarization? I'll give you options. I'll put the options there. So relax. Which events? This is A. This is B. This is C. This is E. I'll still put my option, whether you people like it or not. This is D and this is E. In an action potential, which event directly follows repolarization? I'm reading it for the benefit of people that are not here so that they can watch this video. So after repolarization, what's the answer? Let me see. Yes, you guys are so correct. After repolarization, the answer is what? It will hyperpolarize. Hyperpolarization of the membrane. All right? Yes, please don't forget that too. Ha! Let me now ask you people this question. You guys, look, how many questions will we have for the test? Depends on what the spirit is saying 100. So that's why I'm giving you as many questions as possible so that you test yourself. Because the spirit is saying 100. So, and you know, this thing is very, very important. It's very extremely important. All right. So that's why you really need to say I rebuke the devil. It's extremely important. Look at the next question. I'll give the option. No, this option is too long for me to start writing. So let's cleanse. A. No, final is 150. B. C. D. And let me put the big for nothing option. E. So local potentials are dash, whereas action potentials are dash. A. Irreversible, reversible. Self-propagating, local. Graded, all or none. Non-decremental, decremental. Produced by voltage regulated channels. Produced by gated channels. You guys are so correct. The answer is C, graded. Local potential are graded. Action potentials all or none. That's very correct. They want to confuse you. They want to confuse you. Don't allow them. Look at this question. They want to confuse you. So if you notice, you see that most of these questions is the same thing. You understand? Most of them is the same thing. Do you understand? Let me give you an answer to this one. This is A. This is B. This is C. This is D. Relax, relax. This is D. And this is E. So, answer. What causes hyperpolarization of a neuronal membrane? A. Sodium ions enter the cell. B. Sodium ions leave the cell. C. Potassium ions enter the cell. D. Potassium ions leave the cell. E. Both sodium and potassium ions leave the cell. Come on, guys. Come on, guys. We are almost 80 here. I need almost at least 20 to 25 people to respond. Are you sleeping? Wait, I see somebody that is sleeping. Let me put my spiritual eye. Some is that person typing D. Yes, you are very correct. This potassium ions leave the cell. All right, it leads to hyperpolarization. Also, chlorine entering the cell. Potassium out, chlorine in. Thank you. Somebody just said the two of them. That makes sense. Yes. Yeah, that's D. All right. Look at this question. Look at this question, guys. You say you are fighting the spirits. Let her not fight it too. Let the spirit not be angry. When the voltage of a plasma membrane shifts from plus 35 MV towards 0 MV, the cell is dash. A. Depolarizing. B. Repolarizing. C. Hyperpolarizing. D. Reaching the threshold. E. Exiting the threshold. My friend just texted me. She said I'm talking too fast. I'm sorry. Please, if anytime I'm talking, I speak very fast. So if I'm talking too fast, please, you guys should talk or stop me so that I don't keep vibrating. You know me now. All right. Because the idea of this is no matter how long we spend, for you to be able to get it and internalize it, it's what is in your head that matters. All right. So please stop me if you don't understand anything. Stop me if I'm talking too fast. Sometimes I don't even know when I'm talking too fast. All right. Thank you. You guys are so correct. The answer is repolarizing. Repolarizing. All right. So if you don't understand anything, please write 911. Don't keep quiet, though. Don't think you are going to slow everybody down. Anybody that is feeling sleepy can go and sleep. Don't think you are slowing anybody down. Now, this particular one is nervous system. Nervous system and the brain. Those two are so huge. All right. So you don't play with them. But if you understand them, you understand them. If you understand, is it plus 70 or minus 70? You're talking about RMP. Minus, not plus. Okay, look at this question. This question I'll give you the answer. All right. So everybody just relax, pay attention, and see the answer. This is A. This is B. This is C. We dropped to 68. Where are all of them going to? This is D. And this is E. During the absolute refractory period, which of the following is true? During the absolute refractory period, which of the following is true? For the purpose of the people that are not here, I'll read the options. A, if a neuron reaches threshold, the action potential goes to completion. B, the neuron fires at its maximum voltage if a stimulus depolarizes the neuron to threshold. C, the signal grows weaker with distance. D, it is possible to trigger a new action potential, but only with an unusually strong stimulus. And E, no stimulus of any strength will trigger a new action potential. Answer. Somebody said Rome has fallen. Please, Rome should not fall. Rome does not need to fall after 2 minutes. Rome needs to stay for at least 20 minutes upwards. You are laughing. Evil. Evil people everywhere. Please, I'm of Christ, though. He says, see, it's confusing. See, the signal grows weaker with distance. We're talking about absolute refractory period. So you guys are so correct. The answer is E. Absolute refractory. Rome has fallen, as he said. It has fallen. Nothing you do, no matter where you put it, nothing will happen. That's what absolute refractory period. No action potential can trigger anything. All right. Rome has really fallen. Look at this question. Look at this question, guys. I'll put the answers, options, all right? So just pay attention. If you read it, you need to be reading the question right now to try to understand what it's about. This is A. It's getting tougher, right? You know, we were testing the microphone all along so that we excite our brains. But now, and please don't use all your brain cells. So we still have spinal cord and brain, please. And they are extremely important. But, you know, the spirit is saying, make sure everybody understands this topic very well. That's what the spirit is saying. Then this is E. So this is A to E. What would be the best explanation for why myelinated axons conduct signals faster than unmyelinated axons? A, there are no sodium channels in unmyelinated axons. B, myelinated axons contain more sodiums. C, myelinated axons have more sodium-potassium pumps in their membranes. D, active transport of sodium and potassium is faster in myelinated axons. E, electrical signal spreads faster through uninsulated (myelinated) regions of what axon? Let's move it. Let's move it. Ha. Out of 75 people, I'm having 10 people answer. Please, I need up to 20 people. Oh. And it's not one person to write E for me. I know people are still thinking about it. It's okay. What would be the best explanation for why myelinated axons conduct signals faster than unmyelinated? You guys are so correct. The answer is E. Electrical signals spread faster through myelination. That's insulation. It jumps like gallop. That's what we call sortatory conduction. Look at this question. It's a little technical, so you need to understand it. Look at the question. I need you to understand it. Remember, when they say except, it means that you need to look at the entire options before you pick your answer. All right? Or if you see the one that you know that is obviously wrong, you don't even need to look at the entire options. You get it? So it's this kind of questions really require you to stimulate your brain, all right, to fire. So all of the following are typical characteristics of neurotransmitters except dash. All are typical characteristics of neurotransmitters A, they are synthesized by a presynaptic neuron. B, they are released in response to stimulation. C, they are released into the bloodstream before reaching the postsynaptic cell. D, they bind to specific receptors on the postsynaptic cell. And E, they alter the physiology of the postsynaptic cell. All of the following are typical characteristics of what? Neurotransmitters. Come on, guys. Come on, guys. Come on, guys. Yes, you guys are so correct. The answer is C. All right. If you don't understand it, always say 911. They are released into the bloodstream before reaching the postsynaptic. Bloodstream? Bloodstream? Neurotransmitters? Never. That's endocrine system. Yes. So that's the answer. That's why we said except. Look at this question very fast, very fast, very fast. I have limited time now for this topic. I need to jump into the next. Answer very fast. A cholinergic synapse uses dash as neurotransmitter. Quickly, quickly, quickly. Uses dash as neurotransmitter. Quickly, quickly, guys. If you're not sure, say 911. You guys are so correct. It uses what? ACH, acetylcholine. Look at this question. What is the most common? Yes, that's correct. Acetylcholine. What is the most common inhibitory neurotransmitter in the brain? Which one is the most common, guys? Quickly, quickly, quickly. We have GABA, that's gamma aminobutyric acid. We have noradrenaline, epinephrine, acetylcholine, norepinephrine. Answer quickly, quickly. Let us be very fast, guys. I want you to be very extremely fast. Perfect. The answer is GABA. GABA is inhibitory. If you see it in your exam, please choose GABA. This is the question. Look at this question very fast. Option A, this. Option B. Yes, it's GABA. You're correct. This is option B. Option C. DOPA is inhibitory, but it's not the most common. They're asking the most common. This is option C. This is option D. This is option E. Yes, it helps in Parkinson because it inhibits. All right, it inhibits those tremor, those excitatory, uncoordinated excitation. The dopamine stops it. All right. Okay, which of these happens first in a cholinergic synaptic transmission? A, acetylcholine diffuses across the synaptic cleft. B, a postsynaptic potential is produced. C, sodium enters the postsynaptic cell. D, the synaptic vesicles release acetylcholine. And E, the acetylcholine binds to ligand-regulated gates. Answer. What happens first in a cholinergic synaptic transmission? You see the kind of question they will ask you? This is exactly the kind of question they will ask you. Trust me. All right. You see why I said you need to understand this topic. If you understand it, you don't even need to think 2 times about these questions. For real. And your answer will be like. So remember I said when the action potential comes, the calcium enters and breaks down the vesicles. The vesicles pores inside, all right? So it's the first thing that happens. Vesicle. You are correct. The answer is D. The synaptic vesicles release what? Acetylcholine through what? Exocytosis. All right? When it releases it, then A starts. That's acetylcholine diffuses across the synaptic cleft. Then it goes to E. Acetylcholine binds to the ligand-regulated gates. Then from there, it goes to C. Sodium enters the postsynaptic cell. Then it goes to B. A postsynaptic potential is produced. So you need to, if I'm you, arrange it. I wish this question says arrange it. Maybe you get a question that says arrange. They'll give you these 5 things. They'll tell you arrange it in order. In A, you will see 1, 2, 3, 4. In B, you see 2, 4, 5. See, you know that kind of question. So I need you to look later when you are viewing this video. Go to that question, look at it, and arrange it accordingly, and you'll be fine. All right. Look at this. Look at this, guys. Which of these happens first in adrenergic synaptic transmission? I'll give you the options, so pay attention. Remember, the one we discussed is cholinergic. This is the kind of question they'll give you. This is adrenergic. These people that are not here, I wonder why they're not here. If they're not here, better tell them to go and watch this thing after, because this is the best revision they can ever get. Trust me. When you understand these questions, you don't even need to remember them. And when they ask you something similar, you will smile. You will laugh. Be like, what? Why are they giving me this question? This is child's question. This is for children. Which of these happens first in... Hold on. Hold on. Which of these happens first in a cholinergic? No. Sorry. Neglect what? Which of these happens first in adrenergic system? Please neglect the options I gave. Neglect the options I gave. What am I doing? Please, I made a mistake. I linked 2 questions. Neglect the options I gave. This is the question. Neglect the options I gave. This is A. This is B. Yes. I'm sorry. This is C. This is D. And this is E. So the other question we did was cholinergic system. This is adrenergic system. So which of these happens first in an adrenergic synaptic transmission? What you need to remember is the bouncer at the door that I mentioned, I explained. Bouncer at the door with the other bouncer that's close to him. Options: A, ATP is converted to cyclic AMP. B, adenylate cyclase is activated. C, G protein dissociates from any receptor. D, G protein binds to adenylate cyclase. And E, cyclic AMP induces several effects in the cell. You can actually use your pen now and arrange them, how it happens. You understand? We discussed it, we drew it. Yeah, so and me, I don't know whenever we are done with what we have, but what I know is that I'm going to discuss these 3 topics this night. There's nothing anybody can tell me. I will discuss these 3 topics this night, because I know some people are writing their exam tomorrow. That's Monday. So, you know, I don't have a choice. And I don't want to rush it because, you know, this is for your understanding, not for me to finish anything. I'm not under any time constraints. Trust me, I can talk to you too. Okay, the proper order. Okay, guys, the answer, you guys are very correct. The answer is G protein dissociate from the NE receptor. Look, remember what I told you? The first messenger, all right? These are adrenergic systems, so not epinephrine. First messenger laps on the picture. Yes, I will show you some pictures. Laps on the bouncer, all right? When it laps on the bouncer, what happens? The bouncer is wearing a shoe. He removes the shoe. That's the first thing. That's G protein dissociates from the NE receptor. The bouncer is the receptor and gives it to the fellow bouncer. That shoe he gives to the fellow bouncer is G protein. And that fellow bouncer is adenylate cyclase. So immediately, the first one is G protein dissociates from NE receptor. Then he gives it to that next bouncer, which is adenylate cyclase. So the next one will be, the question is 3. That's C. The order is C, followed by G protein binds to adenylate cyclase, followed by D, then followed by B, adenylyl cyclase is activated, then followed by A, ATP is converted to cyclic AMP, then followed by E. Cyclic AMP induces several effects in the cell. So that's the sequence. I can't even remember what I just said now, but if you remember what I just said now, arrange it like that. All right? Oh, thank you. You guys, they have to give me an award though. They should put money in the award. I don't want to pay all this award that there's no money involved. Okay, look at this medication. No, this is no, this is pathology. No pathology. No pathology. Look at this question. This question is very easy, but they want to tempt you. They want to tempt you. Don't get tempted and miss it. Look at the question. I'll give you the option. This is A. This is B. Yes, so tell them to give me a raise. Oh, tell the school to give me a raise. Oh, they should make it like $300 per hour. I need to buy Mercedes. Hey. Okay, so that's the question. Which of these does not guys always read the question, even if you obviously think I know this thing. Always read the question, please. People that pay attention to read questions are the people that pass more in the exam. Which of these does not contribute to cessation of the signal in a synaptic transmission? You ask yourself, what causes cessation of signals in a synaptic transmission? Synaptic vesicles secrete neurotransmitters by exocytosis. Neurotransmitter escape from the synapse into the nearby extracellular fluid. Neurotransmitters are no longer released. The exon terminal reabsorbs more neurotransmitters by endocytosis. Enzymes in the postsynaptic cells break down some neurotransmitters. What is the answers, guys? He said $500 or we leave CSI. Please don't leave. Don't leave, oh, please. We need you. We need you in CSI. So, guys, which of these does not contribute to the cessation of the signal in the synaptic transmission? So, I need you guys to know this thing. Please, any question we are doing, read the question. Attempt it so that you don't even need to go and start doing this thing later. If you know it now, you know it for life. Trust me. Your pathology, you will be answering questions in pathology smiling. Because all of you are going to do pathology. Most of you are nurses. Some people here are physician assistants. There are even some people that are going for medical school here. All right. Some people are going for physiotherapy. All right. So, like, you at the end of the day, you still do pathology, you do pharmacology. And if you don't understand physiology and anatomy, trust me, you cannot know all those things. Manifesting messages, yes. So the answer is A. You guys are correct. Synaptic vesicles secrete neurotransmitter by exocytosis. No, we are talking about cessation. Why are you secreting? You see? Wisdom. All right. So this question is a giveaway. This question is a giveaway. Testing the microphone. I'm ending this chapter. So let me give you some giveaways. Which neurotransmitter excites skeletal muscle and inhibits cardiac muscle? Quickly, guys. Quickly. This one you don't even need to think. Quickly. Yes, I need at least 20 people to answer that question. Quickly, guys. Not one person answering 20 times, so 20 different people. Quickly. So I'm going to give you 5 more questions. I'm trying to get the proper. This Parkinson disease, everybody know that it's dopamine. What neurotransmitter is affected? Dopamine. So if you see it in the exam, know it's dopamine. Yes, acetylcholine is correct, guys. Yes, the answer is acetylcholine. It's actually excites skeletal muscle and inhibits cardiac. All right. Look at this question. I'm actually looking at some possible this thing here. I need you guys to know this thing everywhere. All right. So any question that they're bringing from this chapter, you are terrorizing the question. Don't allow the question terrorize you. Look at this question, the options. I'll give you the options. Just relax. Any question that looks like what we've done before, I don't want to ask it again so that it will not be unnecessary repetition. We've repeated enough. So these ones are more like new questions, but you need to know them because so if you have not subscribed, please try to subscribe. Click the notification bell so that in case of if I don't send you a link whenever I'm doing live, even if you are doing AP2 or anatomy, another anatomy or pathology, when I'm teaching those things or microbiology, if you see that I'm going on live, you check. If it's something that concerns you, you'll be part of it, all right? Look at this question. Accumulation of calcium in the axon terminal is called dash and probably plays an important role in dash. A, synaptic facilitation, short-term memory. B, neural coding, immediate memory. C, postsynaptic potential, long-term memory. D, neural coding, short-term memory. And E, long-term potentiation, long-term memory. Quickly. And sometimes they give you very long question that the options are very long to confuse you. Please take your time. All right? Take your time to find the problem. Quickly, guys. Quickly, guys. Yes, the answer, I'm not going to wait anymore. The answer is A. You guys are very correct. The answer to that question is A. No, not neural coding. It's synaptic potentiation, facilitation. All right? Not neural coding. Synaptic facilitation and short-term memory. That's what calcium being in the axon terminal does. Look at this question, guys. That's the question. Look at the option. I'll give you the option. Just give me a moment. A, B, C. I need everybody to answer, at least 20 people. D, E. Quickly, guys. What's the answer? Oh, I need to read it. Why both systems maintain homeostasis? How does the nervous system differ from the endocrine system? A, the nervous system releases neurotransmitter between cells, while the endocrine system releases hormone into the blood. B, the nervous system releases neurotransmitter into the blood, while the endocrine system releases hormones between cells. C, the nervous system releases hormone between cells, while the endocrine system releases neurotransmitter into the blood. D, the nervous system releases hormones into the blood, while the endocrine system releases neurotransmitter between cells. Both systems releases hormones between cells, but only the nervous system releases neurotransmitter into the blood. Yes, you guys are so correct. I shouldn't even be wasting my mouth reading this thing because you know the answer already. So the nervous system actually releases neurotransmitters between cells, all right, not into the blood. If you just say nervous system, neurotransmitter in the blood, please, it can never be the answer, all right? You just jump and pass. That's what we call it in Nigeria. Which statement is true? Look at this. Yes, the answer is A, guys. Which statement is true? This is A. This is B. This is C. This is D. This is E. Answer. Which statement about the nervous system and endocrine system is true? Both systems are dedicated to maintaining stable internal conditions by detecting and responding to stimuli. B, the endocrine system helps maintain stable internal conditions while the nervous system is dedicated to affecting change. C, the nervous system helps maintain stable internal conditions while the endocrine system is dedicated to affecting change. D, the nervous system monitors internal conditions but cannot alter them. To effect change, it must activate the endocrine system. E, the endocrine system monitors internal conditions but cannot alter them. To affect change, it must activate the nervous system. Answer. Quickly, guys, quickly. At least up to 20 people. Quickly. Yes, you guys are so correct. The answer is what? A. If you don't know what A is, please, you need to go back and look at what A is. The answer is A. Now, I want to give you this interesting question. Yes, the answer is A. Look at this question here. This is one question. Place the following events in synaptic transmission at a cholinergic synapse in order. I want you to write A to E in order. A post synaptic potential is produced. B, voltage gated calcium channels open, the calcium enters the cell. C, ACH is released and diffuses across the exon terminal. D, a nerve signal arises at the exon terminal. E, ligand gated sodium channels open, the sodium open and sodium enters the cell. Arrange it. I'm not giving you option. So arrange it. According to order, which one comes first? Just give me the arrangements. Quickly, guys. Let me see people that understood everything we've been doing. One more question and I'll give you some pictures. This is a very quiet house. This is very unusual, though. What is happening? Ha, 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 ha. Challenging question. This is an arrangement question. No, don't write it that way. Write it A, B, C, D, E. Like that. That's how you need to write it. Just write it, then I will tell you the correct order. Somebody's already 911. Hey, God. Come on, guys. We are almost 80 here. What is why is somebody's already with bandage on the head? Hey, God. I don't understand. Don't tell me that so you people are writing, you people are copying each other. Now I know if you are really copying each other, because if you arrange this in differently, you should be getting different things. But it seems everybody's getting the same thing. I don't agree. You people are copying each other, whether it's correct or not. Hey, don't do that. Just write your answer. Allow other people to write theirs. Because when you do that, it takes away the entire thing from the screen. I want everybody to write their own answer. Guys, I need up to 20 people to put down their answer. I need to be sure you understand what we are doing. I caught you. I know what you wanted to do. No, I don't understand. Why are you people starting with D? Let's start with that. Even one person here didn't get the right thing. You can't start with D. Are you telling me that G protein dissociation comes before NE binding to the receptor? I told you guys that the first messenger has to bind. No. It means you don't understand it. It means you don't understand it. Then I will have to share this screen again. No. It means you guys don't understand it. You understand? Except each other, because it seems the first person did it and everybody is now copying the first person. First person made that mistake and everybody's copying the first person. That means you guys don't understand it. So let me go back to this. Pay attention. I really want all of you to, where is it? Look at it. Please look at this sequence. What happens first? What happens first? It can't be D first. What is the first thing there is NE binds to norepinephrine, or the neurotransmitter binds to the receptor. Look at it. Something has to bind to the bouncer. That's number one. The first thing is E. Then after E, you talk about D. When it binds, look at it. It binds. Immediately it binds. Look at it. Norepinephrine. This is the norepinephrine, the green one. It binds to the red one. That's the first thing. NE binds to the receptor. When it binds to the receptor, then look at the where is the G? This is the G protein. You see it? This G protein lifts this guy. It didn't lift this guy until there is this binding. So this binding happens. This G protein lifts this guy and merges to the what? Adenylate cyclase. Just like the bouncer removing his shoe and giving to the second bouncer. So after E, that's NE binds to the receptor. The next thing is what? G protein dissociates. That's D. Then after it dissociates, that's G. Then after that, it's G protein binds to adenylate cyclase, which is C. Look at it. It binds to the adenylate cyclase, which is C. And after binding to the adenylate cyclase, what happens next? You see, ATP is converted to CAMP. CAMP is the second messenger. That is A. Then the last thing that happens is what? The last thing that happens is, let me see. ATP is converted to, yes. Then the last thing that happens is B. The cell metabolism is adhered. Look at the last thing that happens. Every other thing, look at metabolic changes happens. They can tell you that the last one is enzyme activation. They can tell you genetic transcription. They can tell you ligand-gated channels open. They can tell you postsynaptic potential happens. All these things are the last things. So it's this sequence. The answer is what? E, D, C, A. That's the answer. You say what? The answer is what? Cholinergic what? No. Adrenergic is different. Adrenergic is different from cholinergic. This question is about adrenergic system. All right? The question is adrenergic system, not cholinergic. This is cholinergic. This is what happens for cholinergic. This is how cholinergic happens. All right? Calcium enters, breaks up the vesicle. ACE exists through exocytosis, comes to the receptors, merges to the receptors, immediately merges to the receptors. Sodium channel opens, sodium rushes into it. Potassium channel opens, potassium rushes out. That's how it happens. This is cholinergic. But the question they asked you was what? Adrenergic. This is the adrenergic system. That's the question they asked you. Which question? Let me see. Oh, did I ask you a different question and I'm explaining a different thing? Hold on. Okay. I'm crazy. All of you are correct. I'm wrong. This is the question. This is the question I was answering. You guys are so correct. Don't mind me. Don't be confused, please. Sometimes it happens to me like that. You guys are correct. Look at the question I was asking. I was answering. This is the question I thought I asked you here. It's a similar question. I'm so sorry. You guys are very correct. Yes, you guys are very correct. That answer is, let me see, DBCEA. Yes, that answer is DBCEA. Yes, I understand. Sorry. My hands in the air. So that second question is actually the one I wanted to give you. I didn't know I gave it first. I gave the cholinergic first. So anyway, I'm so sorry. You guys are correct. The answer to that question I gave you, the first one is DBCEA. 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 All right. Now, the one I was answering was the second one I intended giving. All right. So that second one is EDCAB. All right. So please correct it in your brain. Not adrenergic. Ask about cholinergic. Yes. So that question I asked was cholinergic, but this second one is adrenergic. Okay. Sorry for that. My brain is jamming. Okay. I'm actually done, but I just want to give you some pictures. So I will hold on, guys. I should give you. Oh, you want more pictures? Hold on. So let this thing, this pictures. Hold on. You can see my screen. This is how I usually give pictures. The following events. Which one? Yes. You guys are very correct in that question. All right, you guys are very correct. For that cholinergic question I asked is DBCEA. Yes, you're correct. But for the adrenergic, please also look at the adrenergic. Don't get confused like me. Not that I was confused, but I opened this other second question to give it second to you guys. So there are two questions like that. The one for the cholinergic and the second one for the adrenergic. All right. So the most important thing is that you guys are able to understand it, and I love that. I appreciate it. Thank you very much. Okay, so guys, I want to give you some questions on some image questions. That's why I powered my this thing. So I will post the question there, and I need you to pay attention. And it will be very fast because we need to move up over to the next thing. Look at this question, guys. You said 20 points extra. You wish. Please look at this image. I'm not perfect now. I can make mistake. Look at this image. All right. I'll ask you questions with this image. Quickly, guys. Quickly. If you can be very fast, if you want me to give you more questions, you should be very fast. And I need everybody to answer. What type of cell is labeled 1 in the figure? Quickly. Which one is number 1? Don't open your slide though. I know some people. I catch you. You opened your slide. You. Stop laughing. I'm talking to you. Don't open your slide. I want to answer it by heart so that you know it consolidates. All right. If you are not sure, just write not sure. I need you to write something. Don't just keep quiet. Write not sure if you are not sure. Okay, you guys are so correct. The answer is astrocytes. So quickly, you are so right. I need you guys to be very faster than this. What is number 2? Quickly, what is number 2? What type of cell is labeled 2 in the diagram? Quickly. First of all, okay, just know that. Let me just tell you the answer. Know that as I want you to write the cell and what it does in one word. Like epididymal cell, what it does. The other one is astrocyte, BBB. Epididymal cell, what does it do? Yes, I know it's cuboidal. Epididymal is cuboidal. You're correct. But what does it do? CSF. Okay. Everybody. CSF. Perfect. You guys are so right. Look at this question. So that number 2, yes, is epididymal cell. Cuboidal secretes CSF. Okay. What type of cell is labeled 3? 3. Options: satellite cell, neuron, ependymal cell, oligodendrocyte, Schwann cell. Quickly. Quickly, guys. Quickly, quickly, quickly. Neurons. Perfect. What type of cell is labeled 4? Quickly. Yes, neuron. Yeah, you know, neuron is 3. You guys are so correct. What type of cell is labeled 4? Quickly, guys. Yes, oligodendrocytes. What about this cell labeled 5? Somebody's already ahead of me. What is number 5? What's number 5? Quickly, guys. Let's go to this picture. What's number 5? NYPD. Genital. Yes, you guys are so correct. Microglia. Yes, genital, COP, NYPD. They should not come and arrest me. Okay, so look at this particular picture I just sent you right now. This is the question: which option below correctly matches the type of neuron to the numeric values? So I want you to put the name of the neuron and the number. 1, this, 2, this, 3, this, in one listing. Quickly, guys. Quickly. Only one person? Come on, guys. Come on, come on, come on, come on, come on. Let's go. We are up to 80 people here. Come on, guys. What is this question? Yes, you guys are so correct in that question. You are so correct. Number 1 is afferent. 2 is interneuron. 3 is what? Efferent. So that's just it for that question. I'll give you this image for you to look at this image quickly. Yes, you guys are very correct. Efferent, inter, and afferent. Look at this. What is number 1? Quickly. What's number 1? Quickly. That's good. What's number 2? Quickly. What's number 2? Quickly. Yes, number 1 is dendrites. You're correct. Dendrites, number 1. Dendrites. Number 2 is what? Very fast, very fast. Rush it. Let's move. Cell body. Yes. What's number 3? Quickly. What's number 3? Number 2 is cell body. Yes. What's number 3? What's number 2 is cell body, please. Not cell membrane. Cell body. What's number 3? Yes, you are so correct. Number 3 is nucleus. What's number 4? Quickly. What's number 4? Number 4 is what? Quickly. Yes, node of Ranvier. Number 5 is what? Quickly, quickly, quickly. Number 5 is what? Yes, number 4 is node of Ranvier. Number 5 is what? No, not myelin sheath. Number 5 is internode. Please, number 5 is internode. If they want myelin sheath, they will point to it. So look at this diagram quickly. Look at this diagram quickly. Look, this is not the question here. Hold on. This one is a bit lengthy, but we will overcome it. Look at this question, this diagram. This is the question. They say what is happening in number 1. The options, I'll give you the options. A. Do you now see why I am taking time to review this? Because it's a little difficult, and it will be difficult for a lot of people that are not here. That's why I'm taking time to make sure you know this thing for life, for both your exams and for the final. If you know this thing very well now, even your final, you'll be laughing. You will say, please, we need neuro question. And neuro always comes out a lot in the final. Look at this question. What is happening during the points on the graph labeled 1? A, the local current arrives at the exon hillock. B, voltage gated sodium channels quickly open. C, voltage gated sodium channels rapidly inactivate, while voltage gated potassium channels quickly open. D, the all or none point has been reached and an action potential is inevitable. E, this is the peak of the action potential. Answer quickly, guys, quickly. More people. I need more people to answer these questions, guys. Yes, you guys are so correct. The answer to that question is A. All right. The answer to that question is A. At that stage that you are looking at right now, that's one. The local current arrives at the exon hillocks. That's what's happening here. So that we will know if it will push it up towards to action potential or not. All right. So look at this question, guys. Just pay attention. This question is a little dicey, and I know this is difficult, but you know it is what it is. All right. This is the question there. I'll put the options for you. This is A, incoming missile. So you need to read it very well, look at the image very well, and answer accordingly. This is B. See, guys, I'm not going to explain the spinal cord that much. I'll take 10 minutes to explain it. Then we jump into the questions. I'm more interested in the questions than in the explanation. If you need the explanation, you can go watch my video. So what's the answer to this question? Why is the membrane hyperpolarized at the point on the graph labeled 6? Oh, somebody said nucleus. Oh, I guess you are still answering that picture that we looked at 5 years ago. And that's fine, all right? The answer to that question is nucleus, all right? Cell body, inside it, you see nucleus. I know what you're answering. So look at this question. Why is the membrane hyperpolarized at the point on the graph labeled 6? A, voltage-gated potassium channels are open, so the membrane is more permeable to potassium than at rest. Voltage-gated sodium channels are open, so the membrane is more permeable to sodium than at rest. All voltage-gated channels, both sodium and potassium, are inactivated at this point. All voltage-gated channels, both sodium and potassium, are fully open at this point. The potassium leak channels are temporarily closed. Answer, guys. This one is shaking my people. My people are being shaken. This one is shaking my people. Ah, hey, out of 70 people, nobody has answered. This question must be very tough. Is it? Yes, I'm not loving this. You see, everybody's giving me different answers instead of one stereotyped answer. Let's see. Someone said, never mind, B. Guys, guys, why is it hyperpolarized? Remember, in hyperpolarization, I told you there are two things involved. The one is making my head hot. I'm sorry. There are two things involved, right? One is chlorine, and it's not in this option, so that's out. Then the second one is potassium, right? And what is happening to potassium? More potassium is going out. Does it make sense? Potassium out. For potassium to be going out, what do you think will be happening to the gate of potassium? Will it be closed or open? That's how you think about it. Will potassium gate be opened when potassium is going out, or it will be closed? Thank you. So that's how you think about it. So you'll go to the option and say, which one is talking about potassium gates being open? Because it's only when potassium gate is open, more potassium will keep going, even when the thing is at rest. That's when it goes to hyperpolarization. So look at the option again. No, he says potassium leak channels are temporarily closed. It's closed. We are talking, that one is still closed. Look at D. All voltage gated channels, both potassium are fully open. Sodium and potassium are not open. If sodium is open, sodium will be rushing into the cell. So it will be going towards positivity. But this is going towards more negativity. So E is out, D is out. I'm sorry for people that choose E and D. Sorry. Now let's look at C. All voltage gated channels, both sodium and potassium, are inactive. That's closed. I told you it can be closed. So C is also out. Look at B. Voltage gated sodium channels are open. How is that even possible? If sodium is open, what do you think will happen? Depolarization will happen. But here is hyperpolarization we are talking about. Then look at A. A says voltage gated potassium channels are what? Open. Yes. So the membrane is more permeable to potassium than at rest. Actually, that's the correct answer. So it's at rest, but yet the potassium gate is open. What do you think will happen? More potassium will keep going out, keep going out, keep going out. You understand? It's already at rest, yet the gate did not close. It's supposed to close at rest, but because it did not close immediately, more potassium is keep going out. And if more potassium keep going out, it will cause more negativity. That's hyperpolarization. So the answer is A. The answer is A. So voltage, so that's how you have to think about it. Oh, why is hyperpolarized? Potassium must, or the gate must be what? Open. And every other thing is closed. But potassium gate must be what? Open. Then you look at the options and you get the right answer. I hope that question. So let me give you the last picture. Sorry, I know it's tough. Life is tough sometimes. So what is I was close, yeah. So what is labeled A? Labeled 1. What's 1? 1 is A. A is axon of presynaptic neuron. B, axon of postsynaptic neuron. C, axon terminal. D, initial segment. E, dendritic spine. I know somebody somewhere will say I should repeat these options. I'll do it. It's okay. It's okay. Don't stress yourself. What is labeled 1 on this figure? A, synaptic neuron. B, axon of postsynaptic neuron. C, axon terminal. D, initial segment. E, dendritic spine. Quickly, guys, quickly. Quickly. The faster you go, the faster we finish up. 2 more questions to go. This is the last picture. Option: axon of presynaptic, axon of postsynaptic. Yes, the answer is what? Axon of presynaptic. All right, that's the answer is A. It's the presynaptic axon. All right, guys, what is 2? What is 2? What is 2? Quickly, what is 2? Keep going, guys. Yes, you guys are correct. 2 is synaptic vesicle. Then what is 5? Quickly. What is 5? What is 5, guys? Perfect. 5 is clefts. Okay. Okay. You guys are hotting. So okay. So this is spinal cord. I'm going to take 10 minutes to do this spinal cord. Then we jump into the question. So please pay attention. Extremely important that you pay attention. All right. I don't want to explain too much. These are the functions of the spinal cord. You already know that. All right. This is surface anatomy of the spinal cord. Occupies the upper 2/3 of the vertebral column. Ends at L1 vertebra. All right. Gives rise to 31 spinal nerves. It has enlargement, cervical enlargement, lumbar enlargement, where the nerves of the upper limb and nerves of the pelvic region are found. Then you remember the medullary conus, that's conus medullaris, that's the tapered end, all right, inferior to the lumbar enlargement. Remember the cauda equina, that's bundle of nerves that occupy the L2, L5 vertebra. Extremely important. You should know this diagram, know where the enlargements are, know the meanings of the enlargement. These are the meninges. I told you from out to in, you have DAP, which is the dura, arachnoid, and the pier. From out to in the spinal cord, before the between the spinal bone, all right, that's the vertebra, and the D, we see what? A space there, which we call the epidural space. That's where we give our epi anesthesia. So somebody said I should hold my hand in my nose if I want to say it. Anesthesia. Okay. Now, after the space, you see the D, that's dura. Then you see the arachnoid space. Then between the arachnoid and the pier, you see what's the CSF. That's why when somebody has meningitis, it inflames the pier and what? The arachnoid the most. All right. And that's that arachnoid space is where we do lumbar puncture. I'm not gonna stress on it. This diagram you should be very familiar with it. All right. This is the bone. Then this is the space, epidural space. This red one is the dura. All right. After the dura, there's something whitish just below the red one. That is the arachnoid matter. Then this one that looks like the rivers of life is what? Is the subarachnoid space, below the arachnoid subarachnoid space. And this one that is lapping to the spinal cord itself is called what? It's called the pia mater. And the most delicate is what? The pia mater. And remember, for people that were in my class, I gave you the principle that anything up is posterior, anything down is anterior. Anything up is dorsal, anything down is ventral. By the sides are what? The lateral. You understand? Then anything white, you talk about what? Column. Anything white, you talk about what? Column. All right? Then anything, what is it called? Anything gray. You see this gray one that looks like butterfly inside? That's the gray matter. Anything gray, you talk about what? Horn. That's the rules. All right? Remember the positional rules. All right? So if you say something like posterior column, column has to be white, posterior has to be up. So you point to this place. This place, anterior column. Anterior has to be down. Column needs to be what? White. You point there. Then this middle is central canal. This opening here is anterior fissure. Then you know the meninges. Then that's you are good to go. All right. This is spinal bifida when we have a problem with folic acid for people that are pregnant. All right. At least before you get pregnant, 3 months before you get pregnant, you should be taking folic acid. You understand? And what you need to know about white matter and gray matter, for spinal cord, the white matter is where? The white matter is outside. The gray matter is inside. For the brain, it is opposite. You should remember that. What makes it white? What makes it gray? It is white because it's highly myelinated. Myelin sheet is always whitish, highly myelinated. All right. But gray, it has what? Low myelination. And another thing you need to know is what they do. The gray matter is where it processes the information. The white matter is where it carries the information, the signals. All right. From one part of the CNS to another part, because it's myelinated, so it's carrying this information. It's very fast. All right. Okay. Okay, we've discussed this. Then remember the roots. The roots are these. Look at what roots are. You see, I didn't mention it. These are the roots. If you can see my mouse, you see where I'm pointing. These are the roots. This yellow stuff that is offshooting from this bunch. All right. This is the root. And I told you the one up is what? Posterior root. All right. The one down is anterior root. If you look at this posterior root, it has a bulging here. The bulging is what? Ganglion. And the advantage of this, the idea of this posterior root ganglion is that, for example, if you have chicken pox, all right, it's a viral disease caused by VZV. After it's you become better, that chicken pox, that VZV goes to this place, this posterior root ganglion, pays for rent, 2 rooms and a bed, 2 baths, 2 rooms, and it stays here till for years. It will not die. It will just remain there in the posterior root ganglion till you become the person becomes immunocompromised. You should know what causes immunocompromised states. All right, both HIV, both cancer, even pregnancy causes physiological immunocompromisation. So all those things can actually cause this guy here to descend, and it will descend through what? It will descend and cause what? Shingles. That's what causes shingles. So I came back here so that you'd be able to remember. And now we have the anterior down here and this posterior. You should know information that they carry. Very, very important. You should know information that they carry. If you look at here, the posterior root, the one up, carries what? Only sensory information. And the anterior root carries what? Only what? Motor information. Remember that. The posterior root carries sensory. The anterior root carries motor. All right? Then this is the gray commission. This is lateral horn, other parts of the gray matter. When you talk about the white matter, all right, that surrounds the gray matter, we are talking about a lot of things. There are bundles that goes up and down the cord. Very, very important. Columns or what? Funiculi. Another name for columns is what? Funiculi. And there are 3 pairs of it. Listen, there is a difference between funiculi and fasciculi. I know I didn't explain this thing much in the other video, but you should know that there is a difference between funiculi and fasciculi. When you talk about columns, another word for column is what? Funiculi. You are talking about the big express, big track, big way. All right. Now, in that big way, you have tracts in it. Oh, these vehicles are going forward, these vehicles are coming back, but it's still the same big way. So that big way is called column or funiculi. Column or funiculi. But the individual small tracts is called what? It's called tracts or fasciculi. So you should know what they're asking you. So that's the big road is what divided into the small road. Now, as we are talking about white matter, we said that some go up and some come down. So what you need to know is the ones that go up, what are the tracts that go up and what are the tracts that come back? What are the vehicles that go up and what are the vehicles that come back? The tracts are the roads, the vehicles are the neurons. That's what you should know. So I'm not going to be reading all these things. But the tracts are the roads, the vehicles are what? The neuron. We have ascending tracts and we have descending tract. Ascending tract carries sensory. Anything afferent, ascending, sensory. Descending tract carries what? Motor. All right. Then we have something we call decussation. So some of them will be going up, then they will move to the other parts. So decussation is crossing of the midline that occurs in many tracts. And what is the idea of this decussation? Sometimes we say, oh, you are writing with your right hand. That means you are using your left brain. That is because of what? Decussation. All right. That leads us to what we call contralateral and ipsilateral. So if a nerve is going up, right, before it decussates, it has an injury. That nerve has an injury. It will affect that part of the nerve. So that part of the nerve we call it what? Ipsilateral. When the origin and the destination of a tract are on the same side of the body, that's what it's ipsilateral. It did not decussate yet, but immediately it decussates, and it now have a problem here. If it has an injury here, the problem will be happening where? Down here. All right, down here. That is what we call what? Contralateral. So contralateral is when the origin and the destination of the tract are what? In the opposite sides. So what do you need to know? Ascending tract, descending tract, contralateral, and ipsilateral. All right. So these ascending tracts are ascending ways, routes, all right, roads, all right. And descending is descending ways, routes. And remember, on the road, what goes on the road is the vehicle. So when you talk about the vehicle, you talk about what? The neurons. All right. So for the ascending, you have the tracts and you have what? The vehicles. For the descending, you have what? The tracts and you have what? The vehicle. Extremely important that you remember this. I know why I'm stressing on it. All right. Now let's talk about the ascending. Let's say ascending. Maybe the CNS is Brooklyn. Let's say the CNS is Brooklyn. So it's going to Brooklyn from Staten Island. So that is ascending, right? Sensory, right? Efferent, right? Yes. So what are the roads that goes to Brooklyn? For ascending, there are 5. I told you 5: gracilis fasciculus, cuneate fasciculus, spinothalamic tract, spinal reticular, and what? Spinocerebellar. You must know these 5. And what are the roads that passes these 5 tracts? The vehicles that passes these 5 tracts. That's the neurons. We have the first order neuron, second order neuron, third order neuron. Chicken. Now, if you talk about the descending tracts, I've now gone to Brooklyn. The person wants to come back to Staten Island. All right, coming backwards. That's moto. That's efferent. All right. So the tracts are 4, and the vehicles are 2. So what are the vehicles that comes back? We call them upper motor neuron and what? Lower motor neuron. You must remember this. Upper motor neuron and lower motor neuron are the motor. They are coming back. But first order, second order, third order are the vehicles that are what? Going. Now, what about the tracts? Upper motor, for the tracts, we have the tracts that are coming back. All right. We have what? The corticospinal tracts. We have the tectospinal tracts. We have the reticulospinal tract and vestibulospinal tract. So one thing you should know is that all of them are spinal. So the ones that are coming back, if you just see spinal, know that is the answer. All right. And you need to know, for these ones coming back, you really need to know what they do. So fine, precise coordination, maybe like writing. I'm writing. Now that's very precise coordination. That is what corticospinal tract. Extremely important. Why tectospinal is when you turn your head, watch me. So for me to be able to do this in response to sound, hey, Nchebe, I turn. Hey, Nchebe, here, I turn. For me to be able to do that, that is tectospinal. Tecto, turning, tecto, turning, tecto, turning. Now, the reticulospinal is where you can stand on all fours, all right? Maybe the upper limb, as I'm standing on my feet, or if I'm putting my hands down, that is what? Coordinated by reticular what? Spinal. Reticular what? Spinal. That's posture. Then we have what? Vestibulospinal. All right. This one control extensor muscles of what? The limbs for balance control. So you need to know these things. Now, this is poliomyelitis. This is amyotrophic lateral sclerosis. I'm not discussing pathology, so go read it up later. All right. Now, you need to know important. What wraps up the nerve? Remember these small things inside our fascicles. Fascicles are group bundles of these are bundles of this thing here. They are bundles of cells or nerve cells, all right, or nerve fiber, all right. This is it. So this fascicle is wrapped up by what? That's what you should know. It's wrapped up by what? Perimyosome. Then if I bring one of the muscle the nerve fiber, this one, you see, I brought up this nerve fiber, this particular nerve fiber. So this is a fascicle we brought out, wrapped up by perimyosome. If you bring up one cell in it, it's wrapped up by endomyosome. Then the entire thing is wrapped up by what? By epimyosome. All right. So you should remember that. I'm not going to discuss it, but you should remember it. Now, another thing you need to know is that if you look at this picture, let me go to this picture quickly. Look at this picture. Do you notice something? You notice that the posterior root and the anterior root join together to form the spinal nerve. What does it mean? Remember, the posterior carries sensory, the anterior carries motor. So meaning that every spinal nerve that you see carries both sensory and motor. Chicken, huh? Interesting, right? Every of them carries both what? Sensory and what? Motor. So mixed nerves, we have nerves that we call mixed nerves. Most of them are mixed nerves. It carries both sensory and motor. That's efferent nerves. All right. Okay. So this is what we are discussing: endoneurium, perineurium, and the epimeneurium. So these are nerves. There are some nerves that are sensory, afferent nerves, motor, efferent nerves, and mixed nerves. Mixed nerve is the one that we are talking about. All right. These are majority of them are mixed. Okay. And ganglion is cluster of a neurosoma outside the CNS. You see the elevation, like the posterior root ganglion, the two beds and sitting room that the VZV always hides inside. That is ganglion. All right. Okay. Please, you need to know about this spinal nerves. All right. It's cervical, 12 thoracic, 5 lumbar, 5 sacral, 1 coccygeal. Pairs. Remember, they are pairs. Mixed pairs. All right. Okay. Now you need to understand something as well. The posterior dorsal root is sensory. We discussed this, right? The anterior root is what? Motor. We discussed this. This is the quadra equina. Now, after, I don't know how to, can I see a picture to explain this? Let me see if I can get a picture. You should no need. I don't have time, much time. Now, what you need to know is that the roots form the nerves, right? Then that nerve comes out and form two another branches. Those two branches are called what? Ramus. We have the anterior ramus, we have the posterior ramus. It has another branch which we call meningeal and even communicating. But the major ones are the anterior, posterior, and what? The meningeal. The anterior ramus formed from the nerve, from the spinal nerve. Anterior ramus, they will ask you this question. That's why it's colored. Is in thoracic, it gives rise in thoracic region. It gives rise to intercostal nerve. They will ask you what forms the intercostal nerve. It is what? The anterior ramus of the spinal nerve. So in the thoracic distal cavity, it forms the intercostal nerve, and in other places like the lumbar, like the cervical, like the sacral, it forms what? Plexuses. Cervical plexus, lumbar plexus, sacral plexus. It is formed by what? Ramus. Anytime anterior ramus, anytime you see plexus, anterior ramus, they may tell you, they may be specific about asking you the region. Thoracic region, it doesn't form plexus in thoracic region. It forms intercostal nerve. Then the posterior just innervates the back, the muscles of the back and joints. All right. Very, very important for you to know. So, okay, this is what I was talking about. You see, this is the nerve, the root joined to form the nerve. This is the nerve. You see, the nerve gives out what? This branch that goes up. I told you anything that goes up is posterior. All right. So this is it, posterior ramus. This one down here is anterior ramus. All right. This guy is just communicating. And meningeal. Okay. This is the VZV. I've already explained it. This is the plexuses that are formed by anterior rami. We have the cervical plexus. The major nerve in the cervical plexus is the phrenic nerve. Remember that. Once something happens to your phrenic nerve, you cannot even breathe. All right, because it controls the diaphragm, and diaphragm is the major one of the muscles of that causes what's breathing. Then we have the brachial plexus. All right, a lot of nerves that control the upper hand forms brachial plexus. All right, then we have the lumbar plexus. All right, the major of them is the femoral nerve. Then we have the sacral plexus. All right, the major of them is what? Sciatic nerve. Then we have the coccygeal plexus. All right. So you need to know the particular plexus that each of them comes out from. Then when you talk about somatosensory function, they are the ones that carry sensory signals from bones, joints, muscles, and skin. And we have the proprioception. Not going to spend too much time on this. This is the brachial plexus. This is the lumbar plexus. This is the sacral plexus. This is nerve injuries. I'm not going to waste much time on nerve injuries. All right. Now you need to know the dermatome. Dermatome is a specific part of your skin that conveys sensory inputs. We have 46 people. Where is everybody? Hey, what happened? Are they tired? Don't get tired though. These are the reflexes. You need to know the reflexes. We have somatic reflex, we have visceral reflex, we have spinal reflex. Okay. Hello. Yeah. So this is muscle spindles. All right. You should remember muscle spindles that determines the length that you have to stretch. So this is this water. I want to touch this water. For me to know that I have to take my hand to this water, that is muscle spindle. It's what tells the nerve the extent to extend and also the extent to contract. All right. So remember that. Then proprioceptors are specialized organs to monitor position and body movements. All right. Okay. These are different reflexes categorized. We have stretch reflex, we have flexor, we have cross extension reflex, we have tendon reflex. All right. And based on the synapses, we have monosynaptic reflex and polysynaptic reflexes. Poly is when it is more than one reflex. So down goes the explanation of these reflexes. Go and watch my video so that you understand it properly, because I'm jumping to the questions right now. So if you have a problem, go watch the videos so that you understand more. This is a paralysis. We have paraplegia, quadriplegia, hemiplegia, paresis. All right. Okay, please. You have to watch this video later if you leave. All right. I'm going to ask you some questions. Not much questions from spinal cord because it's small, but I'm going to ask you questions right now. All right. Let me remove this thing so that it will stop lagging. Okay. Spinal cord. Are we here? If you are here, say yes, say yes. At least 20 people. Let's start. You have to do like this. Stop sleeping. Why are you sleeping? Wake up, wake up, wake up, wake up. You have to do like this. Stretch. You see me, I'm even stretching. Come on, guys. Stretch, 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 stretch. Excite yourself. You need to excite yourself. I know this is the part you are waiting for. You're not interested in all the things I've been lecturing. You'll be like, Nchebe has lectured this thing before. I've watched the video. So I need keep saying yes, keep saying yes. Let me see how many people. It's just 12 people that are saying yes. What happened? We have up to 60 to 70 people here. He said I'm too hyper. Funny enough, somebody asked me one day, Nchebe, tell me the kind of coffee you are using. And I told the person, I've not taken coffee for the past 2 months. I've not taken coffee for the past 2 months. Yeah. You just have to tell yourself that I need this thing, I need to get this thing. Like me, I just tell myself, hey, Nchebe, these people need this thing. You need to get it done. You understand? Any way you want to push it into their head, do it. So that's why you see me this way. Trust me. I can do it for, like, when I take the math and chemistry students the other day, we talked for more than 6 hours. For real. If you go to my live, you'll see the video. Wi-Fi problems, I'm sorry. Tell the wifey not to misbehave, that you need it. Because one of the major ones is even the last chapter. That's one of the major ones. The brain and the brain and the nerves. So anybody that is not here now, better tell that person to start coming back. That one is the most important. All right. And this thing is sequential. If you don't understand the first one we did, this one will be difficult for you. Same thing with the last one. That last one is very important because that one has a lot of volume, just like the first one. All right. So any professor that is teaching you definitely will get more questions from that first one and the last one. Like this one here now, I may just we can just discuss 20 to 25 questions and that's it. All right. But the other one we discussed almost 50 questions. You understand? This coming one now, the third one, we're also going to discuss almost 30 to 40 questions or 50 questions. All right. So that's how important it is. Okay, let's test the microphone, guys. You know, I always ask the easiest questions when we want to test the microphone. You're welcome. So this is the question, and this is the options. I'll give you the options. So relax. We need glutamate, ACH. Please, oh, you believe like, see how my face is doing. Please, oh. So this is A. This is B. Testing the microphone. This is C. This is D. Yes, this is E. So which of the following is not a function associated with the spinal cord? If you are sleeping, rub your hand like this. Rub your hand. If you are sleepy. Shake yourself. So let's go, guys. Which of the following is not a function associated with the spinal cord? A, protect neurons in both the ascending and descending tracts. B, mediate a reflex such as the withdrawal of the hand from pain. C, conduct sensory information up to the brain. D, conduct motor information down the cord. E, coordinate the alternating contraction of several muscle groups associated with locomotion. Answer, guys. Let's go, let's go, let's go. Let's go, guys. How many? Let me see. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. No, up to 20 people. Oh. Up to 20 people. I'm waiting, guys. The more you people have to answer, the more you, I don't want you to waste time so that we can, answer these questions I've already listed out for you to answer. I have questions I've listed out for you. You understand? There are some repeating questions I won't be asking. I just want something that will make us move very fast. Yes, you guys are so correct. The answer is there is A. Please, if you are not sure of the answer, you can write not sure. And if you have a problem, you can write emergency. Look at this question. Which of the following is not considered a region of the spinal cord? Which one is not a region? A, cervical, B, thoracic, C, lumbar, D, pelvic, E, sacral. Quickly, testing the microphone. Cervical, thoracic, lumbar, pelvic, sacral. Cervical, thoracic, lumbar, pelvic, sacral. Which one is not considered a region of the spinal cord? Quickly. Quickly, guys. Yes, the answer is pelvic. We are still testing the microphone, guys. No, I can't ask you this question. Well, maybe you get this question, but okay, fine. But this question is just a very simple thing. I don't want to waste time with it, but let's just still test the microphone since we are testing the microphone. The middle layer of the meninges is called the dash. Quickly, guys. Not yet. No, not yet. It's not time to bring the microphone yet. Come on, everybody. At least if you've not been answering before, if I give these easy ones, try to answer it. Don't. You have to consolidate what you are learning by typing something. All right. If you're not sure, just write not sure. Quickly, guys. Exactly. That is what arachnoid, the middle layer. So just write DAP or pad, depending on where you are going from, either up or down. All right. Good. Look at this question. Voluntary motor impulses leave the spinal cord. Yes, that answer is arachnoid. Voluntary motor impulses leave the spinal cord via the dash of the gray matter. A, anterior horn. B, posterior horn. C, anterior funiculus. D, posterior funiculus. E, lateral horn. Quickly, guys. Voluntary motor impulses leave the spinal cord via the dash of the gray matter. Somebody said folliculus. Okay, you're talking about folliculus? No, now that's white matter now. You should be thinking of anterior and posterior. Folliculus is white matter. They are telling you voluntary motor. That you need to read the questions very well. This is very technical because a lot of people don't know questions See, the thing about spinal cord is the questions are fewer but very technical. So I said gray matter. Yes, that's why I said horn. So it has to be your answer. Once you see that gray matter, cut out everything that is white matter, like anterior and posterior funiculus. So you're thinking about horn. So you have anterior, posterior, and lateral. Now you now ask yourself, oh, which one is sensory? Which one is motor in it? Exactly. You guys are very correct. Anterior horn. Anterior horn is the motor. Remember that. Remember, these questions are technical, but they are very, very important. All right. Anterior horn is what? The motor. Look at this question, guys. Very fast. I'm not giving option. Quickly. CSF fills the space between dash and dash. We are still testing the microphone, mind you. Quickly now, quickly. CSF fills the space between the dash and dash. Come on, guys. This question, you shouldn't even look at it 2 times. You give the answer. Piam, 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 piam. Yeah, subarachnoid space. That's D and A. Is it D and A? Someone say dura and arachnoid. No. Between dash and dash, like some people say subarachnoid space. It doesn't answer it. Well, I agree, subarachnoid space, but the answer will be between dash and dash. Between dash and dash. Between what and what? All right. Between what and what? So it's arachnoid and pia mater. A and P, yes. I told you you need to know the subarachnoid space, that's arachnoid and pia mater, where the CSF flows, and also you need to know about the epidural space. All right. So look at this question. Quickly, guys, quickly. The bundle of nerve roots that occupy the vertebral canal from L2 to S5 is called the dash. I mentioned it. We have the medullary cone, we have the chorda equina, we have the lumbosacral enlargement, we have the cervical enlargement, we have the spinal cord. We have the medullary cone, that's conus medullaris. We have the chorda equina, we have the lumbosacral enlargement, we have the cervical enlargement, we have the spinal cord. Is that all? Come on, guys. I need up to 20 people. If you are not sure, write not sure instead of keeping quiet. Write not sure instead of keeping quiet. You know, if I see a lot of people commenting, I know that a lot of people are still active, and it really triggers me to, give more. And I really want to be very fast with this. Yes, the answer is chorda equina. You guys are so correct. Look at, okay, not sure. The answer is chorda equina. All right. Once you see L2 to S5, it's chorda equina. And you see bundle of nerve roots that occupies the vertebral canal, that's chorda equina. All right. Good. So if you are not sure, always write not sure, so that I can see that, okay, there are some people that are not too familiar with it. The answer is chorda equina, L2, S5. Remember that. Interneurons are located in the dash. A, spinal cord. B, sensory receptors. C, effector organs. D, skin. E, ganglia. Answer. Interneurons are located in the dash, spinal cord, sensory receptors, effector organs, skin, and ganglia. Thank you so much. Spinal cord, all right? Or CNS, anyone's, but spinal cord. Look at this technical question. Let me see people that will get this answer. Which of the following fractures will be the least likely to cause a spinal cord injury? Then look at the option. You need to look at the option so that you'll be able to pick your answer. This is A. So we are done with testing the microphone, all right? Now let's break down microphone. This is B. This is C. This is E. And this is F. Oh, this is E. Which of the following fractures would be least likely to cause a spinal cord injury? A. Fracture of the vertebra C2. B. Fracture of the vertebra C6. C. Fracture of the vertebra T5. D. Fracture of vertebra T12. And E. Fracture of vertebra L4. Keep going, guys. Yes, you guys are so correct. It's L4, right? Because, you know, spinal cord ends for adults, it ends at L1. For children, it ends below L2, right? So if anything happens at least from L3, L4, then, you know, it will not affect the spinal cord. And that's why we always do take our tap, you know, below L2. Look at this question, guys. Yes, the answer is L4, guys. Look at this question. What's the answer? Quickly. Epidural anesthesia is introduced to the epidural space between the dash to block pain signals during pregnancy. Answer A, dural sheath and dura mater. B, dural sheath and vertebral bones. C, dural mater and arachnoid matter. D, arachnoid matter and pia matter. E, dura mater and pia matter. Wow. I'm listening to my accent. My accent is sweet. See what I'm saying? Dura mater, dura mater. You know, matter, pia matter. Hey, me that have a very terrible accent. Dear Mara. A, let me say it again. I think I like the sound. A, dura sheath and dura matter. B, dura sheath and vertebral bones. C, dura matter and arachnoid matter. E, D, arachnoid matter and pia matter. E, dura matter and pia matter. You guys are enjoying how the matter is sounding in my ear, right? Yes, you guys are so correct. The answer is dural sheath and vertebral bones. You must remember this. So you must remember this. So guys, now let's see these technical questions. Terrible question. Which of the following structures is the richest in lipid content? Let me give you the option, guys. Relax. Let me give you the option. A, gray matter. B, white matter. C, arachnoid matter. D, dura matter. And E, pia matter. Which of the following structures is the richest in lipid content? Lipid specifically. Which one? Some people are saying, white matter? White matter? Do you remember when we talked about myelin sheath composition? Some people say 80-20. Lipid and what? Protein. So, which of these things has the greatest myelin sheath? White matter. That's how my white matter is the richest in lipid. It's as simple as that. That's why I told you it's technical. The answer is white matter. Because it has the highest myelin sheath. And myelin sheath has a lot of what? Lipid. All right? Look at this question. Technical. Oh, you are feeling that question, right? Look at this question. Which of the following is contained within gray matter? Look at the options quickly. Oh, we have to be very fast because I just want to take like 25 questions here and that's it. Or 30, maybe. I don't know. This is B. This is C. This is D. And this is E. Answer, guys. Which of the following is contained within the gray matter? Quickly, guys. Quickly. Yes, the answer is C. All right. The answer is C. Cell bodies, dendrites, and proximal parts of axons of neurons. Yes, the answer is C. Look at this question. Yes, the answer is C. Look at this question. Many upper motor neurons synapse with lower motor neurons in the dash. Which parts? Posterior horn, posterior horn, anterior horn, posterior funiculus, posterior root ganglion. Many upper motor neurons synapse with lower motor neurons in the A, posterior horn, B, anterior horn, posterior funiculus, posterior root ganglion. Which one? Which one, guys? Let's hurry up. Which one? Which one? Not sure. Not sure. 911. Okay, continue. Continue. I need more people to make attempt that question. More people. Somebody say Brooklyn. Okay, look at it. Let me explain that question. They say many upper motor neurons synapse with lower motor neurons. Many upper motor neurons snaps with lower motor neurons. They are asking you, where do they meet? All right, where do they meet? You should always remember that they meet in the gray matters. So if you remember that they meet in the gray matter, if you look at your slide, it's there in your slide. If you know that they meet in the gray matter, you ask yourself, which one is sensory, which one is motor? Sensory is posterior, motor is what? Anterior. Then you choose your answer, anterior horn. The answer is anterior horn. Please, if you just hear many upper motor neuron synapse with lower motor neuron, tell them it's what? Anterior horn. All right. For people that are confused, spinal cord is a little confusing because it's not something you are very clear, but it's very good that you have this information. All right. All right. Look at this. Motor commands are carried by dash from the brain along the spinal cord. A, both anterior and posterior roots. B, the ascending tracts. C, spinal nerves. D, cranial nerves. And E, descending tracts. Hurry. Motor commands are carried by dash from the brain along the spinal cord. A, both anterior and posterior roots, ascending tracts, spinal nerves, cranial nerves, descending tracts. Yes, you guys are so correct. All right, you guys are so correct. It's descending tracts. All right, that one is very straightforward. No 911. It's very straightforward. So look at this question. This one I'm not giving you option. I need you to look at the question. Everybody, talk to me. What's your answer? Second order neuron synapse with third order neurons in the dash. Second order neuron synapse with third order neuron in the dash. Second order neuron synapse with third order neuron in the dash. First of all, you should know that they are talking about what? Ascending. Remember, going to Brooklyn, ascending, right? We have the first order, second order. The vehicles are first order, second order, third order. And he had 5 tracts or 5 lanes, all right? The gracilis, the cuneate, the spinal thalamic, the spinal reticular, the spinal cerebellar. Those are the 5 going to Brooklyn. So look at this one now. Where does this synapse happen? 911. Okay, that's fine. I need more people to attempt it. Only 2 people? Come on, guys. We're up to 60 here. Not sure? Yes, if you are not sure, write not sure. You don't need to stress yourself. You don't need to stress. Just write not sure. Perfect. So look at it, guys. I zoom this thing so that you'll be able to see it. First of all, these 2 things are up. They are the ones that are ascending, right? Now, this is receptors for body movement, limb positions, fine touch, discrimination, and pressure. This is how it goes. This is receptors for pain, heat, and cold. Do you notice the difference between the 2 of them? This guy for the movement and limbs and all those things, the first order, look at the first order, passes the spinal cord, enters the medulla, stops at the medulla, all right? At this cuneate, it stops at the cuneate here, and it hands over to the second order. So the second order decussates, passes, goes to the opposite parts, and moves up. It keeps moving up. And where did it synapse? It snaps in the thalamus. This is thalamus of the brain. How do you know that you've gotten to this to the brain, not the spinal cord? Did you notice something? The brain, the gray matter is outside. Look at the gray matter outside. Why the white matter is inside? But the spinal cord, did you notice that the gray matter is inside and the white matter is outside? That's how you know that you have gotten to the brain. So you keep going. All these things are brain stem. Remember the brain stem, we have the medulla, midbrain, and the pons, all right? Then here is the cerebrum. Look at where it stopped. So the second order stops in the thalamus. Then the third order takes up from the thalamus to the cortex, all right? Now, I want you to look at this second part, which is the receptors for pain, heat, and cold. I believe you guys can see this thing. This second one is the receptor, this thing for receptors for pain, heat, and cold. So if you are talking about pain, heat, and cold, and no longer about movement or pressure or limb, whatever, all right? Yes, gray matter is outside, white is inside, unlike the spinal cord. Okay, so look at it. See the first order. Guys, I need you to watch this thing. Remember, for this guy, the first order passed the spinal cord and went to the medulla and decussates and stops at the medulla here. Hands over to the second order, which decussates immediately. But for here now, the first order stops at the spinal cord. All right? It stops at the spinal cord and hand over to what the second order, all right? This second order now decussates where? On the spinal cord and moves up. Look at it. It keep moving, passes the midbrain, medulla, passes the midbrain, gets to the cerebrum. And where did he hand over to the third order? Still the thalamus. So meaning that no matter what you are doing, the second order always hands over to the third order at the thalamus. That's what you need to know. That's what I just wanted to show you. I know you got it. So Let me break this thing. Let me remove this shit. You'll be able to see my fine face. Perfect. Thank you. You're welcome. So the second order neurons synapse with third order neurons in the thalamus. They will never ask you this question for first and second order. They won't. Because this is college biology. As in, like for people that are writing their mid exam, USMLE, for example, that's where they will ask. They will not tell you, oh, this person, you touch this person, oh, this person is took alcohol, and the person is no longer having balanced. Where will the first neuron, hand over to the second neuron? All right, that's the kind of question they're asking you. So you now know, you now need to determine which pathway are they talking about. But for you guys, they're asking more straightforward question, so that we are keeping it simple. All right. Look at this question, guys. I hope you are activated. Please, who is sleeping? The spirit is telling me that somebody is sleeping. Just put your leg inside water. All right, cold water, so that it will keep you active. You don't need to doze. If you want to avoid dozing, you have to be engaged. Say me, you have to be engaged. Oh, the spirit told me only one person, but I'm getting more than one confession. So which of the following is an ascending tract of the spinal cord? Say me right now. Please don't sleep. Instead, stand up, fold your hand and be typing. When you type answers, you will not sleep. Trust me. All right. So which of the following is an ascending tract of the spinal cord? We have the pay attention to the options. We have the lateral tectospinal tract. We have the medial reticulospinal tract. We have the ventral corticospinal tract. We have the vestibulospinal tract, and we have gracile fasciculus. Options again. Which of the following is an ascending tract of the spinal cord? That's going to Brooklyn. We have the lateral tectospinal tract. We have the medial reticulospinal tract. We have the ventral corticospinal tract. We have the vestibulospinal tract, and we have the gracile fasciculus. Someone's the last one. Come on. If you are not sure, right? Not sure. Come on. Someone got the formula. Interesting. Come on, guys. I need more people to comment. I need to make sure everybody say. Exactly. So somebody said unsure. Listen, I told you, going to Brooklyn, we have the gracile fasciculus, cuneate fasciculus, spinal thalamic, spinal reticular, sinus cerebellar, right? But coming back from Brooklyn, that's the descending tract. All of them ends in spinal. So you look at this option, what do you see? Lateral tecto spina, yes, it's spina, it has to be coming back. Medial reticulo spina, it has to be coming back. Ventral cortical spina, it has to be coming back. Vestibulo spina, it has to be coming back. That's the formula. So which one is the odd man out? Gracile fasciculus. It does not have spina at the ending. So it's definitely going. Check it out, and you are good to go. Oh, they asked this question. Wow. This question will be the answer is gracile. The answer, let me see the options again. The answer is gracile fasciculus. Gracile fasciculus is the only one that is ascending. Others ends in spinal. So anything that ends in spinal is coming down. That's the formula. The answer is gracile fasciculus. All right. So look at this question. The signals that control your handwriting travel down the spinal cord in the dash tract. Answer. Do you need option? Okay. Tectospinal, corticospinal, lateral vestibulospinal, medial vestibulospinal, spinal cerebellar. Answer, guys. Somebody's remembering what I said, choking. Hey, God, no. I don't want to be evil this night, please. I'm with Christ. Me and Christ is like this. We are inseparable. Yes, the answer is corticospinal tract. You guys are so correct. It's corticospinal. Look at this question, guys. Nerve fibers are isolated from one another by what? A. Perineurium, endoneurium, fascicles, epineurium, blood vessels. Answer. Yes, that answer is corticospinal for that question. Nerve fibers are insulated from one another by A. Perineurium, endoneurium, fascicles, epineurium, blood vessels. Yes, the answer is endoneurium. You guys are so correct. The answer is endoneurium. Look at this question, guys. Yes, that answer is endoneurium. Look at this question. Look at the options. A, B, C, D, E. A ganglion is a dash. A ganglion is a dash. A bundle of axons in the CNS. B cluster of dendrites in either the CNS or the PNS. C cluster of cell bodies in the PNS. D bundle of axons in the PNS. And E cluster of cell bodies in the CNS. Quickly, guys. Quickly. Give me that vibe. Give me that energy, guys. Yes, the answer is C. Guys, the answer is C. The answer is what? Is C, guys. A ganglion is a cluster of cell bodies in the PNS. The answer is C, guys. Look at this question. Which of the following branches of a spinal nerve has the cell bodies of only sensory neurons? Posterior dorsal root, anterior ventral root, posterior ramus, anterior ramus, meningeal branch. Which one? What happened? Which of the following branches of the spinal nerve has the cell body? What happened? Come on, guys. You need to give me the answer faster so that we could be faster. So you need to look at the question very well. Yeah. Keep going. Yes. You guys are so correct. The answer is posterior root. Which of the following branches of spinal nerve has the cell bodies of only sensory? Only sensory is spinal. It's posterior root. Only motor is anterior root. As far as the root, you understand? Then the nerve is now combined. Then when it is now combined, ramus we have both smooth and both sensory and what? Motor. That's what you need to know. So it's posterior root. The answer is posterior root. Quickly, look at this question. Look at this question. A dash is a cord-like organ composed of numerous dash. A, nerve fiber nerves. B, nerve fiber axons. C, nerve axons. D, nerve fiber cell bodies. E, nerve cell bodies. A dash is a cord-like organ composed of numerous dash. Nerve fiber nerves. Nerve fiber axons. Nerve axons. Nerve fiber cell bodies. Nerve cell bodies. Quickly, guys. We are more than 50 people here. Why is very few people attempting the answers? See what Sarah said. Yes, you are very correct. The answer is nerve and axons, all right? The answer is nerve axon. Look at this question very fast. Guys, you give me, like, I need you to energize me. Don't dull my spirit. Which of the following is comprised of anterior rami from C5 to T1? A, cervical plexus. B, brachial plexus. C, coccygeal plexus. C, D, sacral plexus. And E, lumbar plexus. Which one? Oh, cervical plexus, brachial plexus, lumbar plexus, sacral plexus, coccygeal plexus. Come on, guys. Let's go there. If you are feeling sleepy, you have to be doing this thing I'm doing. Okay. You see, the answers are taken from these things, all right? The questions. Look at it now. If you look at the stuff I projected, brachial plexus near the shoulder, C5 to T1. See? Cervical is C1 to C5. So you need to know cervical C1 to C5 phrenic nerve, brachial plexus C5 to T1, lumbar L1 to L4, sacral L4 to S4, coccygeal S4 to CO1, coccygeal 1. So it's very important to know these things, all right? Because if you know it, if they just give you if you just look at the number, you pick your answer and you move. You don't even need to stress yourself too much. Look at this question. The anterior rami of the spinal nerves from the nerve plexus form nerve plexus in all regions except what? Except where? Quickly. Quickly. Quickly, guys. The anterior ramus forms plexuses everywhere in all regions except where, guys? Yes, the answer is in the thoracic region. You guys are so correct. That's why I projected it. You see where the road is crystal clear here. Anterior ramus in the thoracic region, it gives rise to intercostal nerve. In other regions, anterior rami form plexuses. So it's only intercostal in the thoracic region. All right. Extremely important that you guys know this. I love the fact that it's so that you see that these questions are not abstract. It's crystal clear. Looking at you there. You see that question I was telling you about? That stuff I was telling you about, this. The cervical plexus is the origin of the dash nerve. A, oculomotor. B, sciatic. C, musculocutaneous. D, radial. E, phrenic. Phrenic. Perfectly. Perfect. Look at this one. Which of the following? Yes, phrenic. Which of the following nerve plexuses originates in the lumbosacral plexus? We have the axillary, sciatic, phrenic, ilioinguinal, obturator. Which of the following nerves originates in the lumbosacral plexus? Axillary, sciatic, phrenic, ilioinguinal, obturator. Which one? Hurry, guys, hurry. Yes, the answer is sciatic. Very, very correct. I need you guys to arrange this thing for me quickly. I'll put this is the question. I'll put the options. You help me and arrange it. Give me the right option. This is A. Yes, it's sciatic. You're correct. This is A. No, somebody said it's not sciatic, it's sciatic. This is B. Sciatic. This is C. This is D. And this is E. So which one of the following best describes the order of a somatic reflex? A, somatic receptor, interneuron, efferent nerve fiber, efferent nerve fiber, skeletal muscle. B, somatic receptor, efferent nerve fiber, interneuron, efferent nerve fiber, skeletal muscle. C, somatic receptor, afferent nerve fiber, interneuron, efferent nerve fiber, skeletal muscle. D, somatic receptor, efferent nerve fiber, afferent nerve fiber, interneuron, skeletal muscle. And the last one, E, somatic receptor, afferent nerve fiber, interneuron, efferent nerve fiber, smooth muscle. Please don't tell me to read this question again. It's already choking my throat. It's choking me. Yes, for the people that attempted that question, the answer is C. You're correct. So look at this question. Yes, you're correct. Look at this question. A nurse pricks your finger to type your blood. You flinch at the pain, pulling your hand. This is called the dash reflex. Two more questions and I show you some pictures. Which reflex is that? Okay, option: painful reflex, stretch reflex, flexor or withdrawal reflex, tendon reflex, cross extension reflex. Come on, guys. I need 20 people to answer that question. Sorry, we need to. Come on, come on, come on. Hurry up, please, guys. Please, please, please. Please. There are some questions I won't even give you here, but I'll just talk about it because we're already behind time. So yes, the answer to that question is flexor. Is flexor withdrawal reflex. Now, for muscle to be sensitive, the sensitivity of a muscle spindle is maintained by gamma motor neuron. Please put it in your head. That muscle spindle is coordinated by gamma motor neuron. You know, we have alpha, we have gamma. The one that helps you for the fibers that carry the action potential that cause skeletal muscle to contract is what? Is alpha motor neuron. They will tell you to distinguish between alpha and gamma. Gamma is for muscle spindle. The one that tells you, okay, this is this thing. Hold it, you know, hold it. So the one that tells me the distance from me to this thing and tells my skeletal muscle to contract, you know, is what? Muscle spindle, right? This muscle spindle is coordinated by gamma motor neuron. Now, the one that contracts itself, the contraction muscles, right, is coordinated by what? Alpha motor neuron. They give you those questions, you should be able to know the difference. All right. Then you need to know what contralateral is. I won't give you those questions here. We don't have time. Tendon organs are proprioceptors. All right. Tendon organs are proprioceptors. That one, they prevent overcontraction of a muscle. Right. Proprioceptors, they prevent overcontraction of a muscle. That's tendon this thing. You need to know what monosynaptic is. I already mentioned it. Reflex acts that only use two neurons. Two neurons means that they snap in one place. That's monosynaptic. All right. I'm trying to rush this off so that we can. So one last question, then I show you some pictures. Just the last question. I really need you guys to know this answer. Which of the following groups of muscles has the most muscle spindles? A, muscles of the hand. B, muscles of the back. C, muscles of the thigh. D, muscles of the middle ear. And E, muscles of the torso. Quickly, guys. Quickly. Quickly. Yes, the answer to that question is muscles of the hand. Yes. Okay. I need to show you guys some pictures and you have to answer me very fast, please. You have to answer me very fast. Please, I need you to activate yourself. Get activated immediately because these are some pictures you need to know. Get activated, please, guys. Get activated. Look at this image. Let me make it big so that some people will not complain that they have bad eyesight. Yes, that's flexor withdrawal, muscles of the hand. All of you are correct. Look at this image. The place where that arrow is pointing to is what? Ventral rootlets, dorsal root ganglia, ventral rami, dorsal roots, and dorsal rami. Quickly. That place that stuff is pointing to is what? What happened? You guys are confused. Look at where that stuff is pointing to. Options: ventral rootlets, dorsal root gang. You don't even need options to answer that question. Ventral rootlets, dorsal root ganglia, ventral rami, dorsal roots, dorsal rami. Do you still remember the formula? Oh, I did. I cut off. Really? Sorry. One, two, three, four. Why is only four people responding? Is it getting tough? Come on, guys. I need a lot of people. If you are not sure, write not sure so that we can explain and move. Come on. Yes, yes, you guys are so correct. The answer to that question is ventral rami. It's ventral. If you look at it, you see that it's actually ventral. Where is that picture I gave you? Look at it now. This is spinal. Okay, this one here is the posterior root, right? Root attaches to the spinal cord properly. This is the ventral or the anterior roots. I told you anything down is anterior. Then the two of them, this is posterior root ganglia here. Then the two of them merges here to form the spinal nerve. This spinal nerve now divides here. You see, this one is down, this guy is up. So this one that is down is what? Is the what? Ventral or the anterior. Then this one that is up, you should know it. This one down is communicating. All right, because why I said you should know it, look at this other picture that they gave. Look at this picture, guys. So if you know this, you need to know the other. Look at this picture. Some people think it's the same picture, but it's not. You see where the arrow is, where the stuff is now pointing. You guys can see it. So what is this one? What is this one, guys? Somebody is still talking about roots. How can you say that in is roots? Root is this tool now that is touching this guy here. That's root. It can't be root after it has already formed nerve. It formed nerve, so it separates into rami, ramus. This one here is anterior ramus or ventral ramus. This guy that goes up is dorsal or posterior ramus. Because why I'm telling you is because this posterior root that you answered is actually in the option. They put it there to confuse you. I don't want you to get confused. So this guy that is up, that's what they are pointing to. The one that's up. The other question I gave you is this guy here. This one is what? Ventral or the anterior. But this guy up here is dorsal or posterior. Please remember that, all right? Let's not waste too much time on it. Look at this question, guys. Look at it. First, I'm sure. Where do the nerves that innervate the lower... No, I don't like this question. Hold on. Yes, posterior or dorsal rami. Any of them. One of them will definitely be in the option. So look at this, guys. What is the name of the structure labeled D? What is D? What is D, guys? Yes, dorsal ramus is correct. What is D? Come on, I need at least 10 people to answer that question. What is D? Looks like a hostel. I agree with you. So it has to be what? Coda equina. Perfect. So yeah, Coda equina. What is the one E? Very fast. Let's go fast. What is E? What is E, guys? What's E? Option: caudal equina, terminal phylum, medullary conus or cone, dural sheath, lumbosacral enlargement. Lumbosacral enlargement, rather. Come on, I need more people to attempt that question. Yes, it's terminal phylum, all right? I have to remove it because we need to be faster. I have to remove it. It's terminal phylum. Look at this. Look at this. Now, let me give you this question very fast. Yes, that answer is terminal phylum. Look at this. This one is a more interesting question. In which space or spaces is or are CSF found? Quickly, guys. Quickly. In which space or spaces are CSF found? No. No. Why? All of you are wrong. Why? All of you are wrong. Listen, guys. There are two places there. That's why they say space or spaces. You would think, oh, why are they say plural? Because there are two places there. So if you are saying C, you are wrong because C is in the option. Only C is in the option. Yes, terminal phylum, you are correct. I guess you are lagging, but it's correct. So, guys, look at it. You see this place? You see E? E is what? Central canal. So, CSF flows in central canal and in C, which is the subarachnoid space. So, the answer is C and E. That's what the answer is. C and E. Because if you see it in the exam, don't just choose C and you rest. No, yeah, it's two of them. Oh, yeah, give me this answer. Let me see if you people have learned. Where is CE? That's the answer. Where is an epidural injection administered? Quickly, guys, quickly. This is a giveaway. I didn't know E as well. Okay, fine. Now you know E is central canal, guys. So CSF is found in the central canal and in the subarachnoid space. Quickly. Quickly. Where is epidural injection administered? Yes, the answer is A. Epidural anesthesia is in A. All right, it's in A. You're correct. Then look at this question. Where is the spinal tap taken? Somebody said C and E. Please, C and E is where CSF is found, but epidural anesthesia is in A. Now I'm asking the question: where is the spinal tap taken? Somebody is saying caudal equina. Please look at the diagram. This question I'm asking is from the diagram. Is quickly, guys, quickly. From the diagram, where is the tap taken? Terminal phylum. Okay. You are correct, but we discussed it 10 years ago. We're talking about spinal tap. Yes, the answer is very correct. That answer is extremely correct. Now look at this diagram, guys. Okay. Which one is the epineurium? Quickly. Which option is epineurium here? Which one is the epineurium? Quickly. Yes, epidural space. You are correct. Which one is the epineurium? Quickly, quickly, quickly. Let's be activated. Let's be activated. Let's get this thing over with. Yes, epineurium is A. Which connect? Yeah, the answer is A. You're correct. Which connective tissue layer surrounds a fascicle? Which one surrounds a fascicle? Which one surrounds a fascicle? Quickly, guys. Which one surrounds a fascicle? Yeah, A is epineurium. Which one surrounds a fascicle, guys? From the diagram. Yes, you are so correct. Yeah, you guys are so correct. So the B surrounds the fascicle. Yeah, yeah, so correct. Now, which connective tissue layer surrounds a fiber? Which one surrounds a fiber, guys? Which one surrounds a fiber? Quickly. Yes, you are so correct. The answer is D. So last image and last for this topic. Look at the image here. Somebody says C. I don't know which question you're answering, but if it's which connective tissue layer surrounds a fiber, that's D. All right. So look at this question, guys. Look at this diagram. Using this diagram, then answer this question I want to ask now. The plexuses form from which of these structures? The plexuses form from which of these structures? Quickly, guys, quickly. Get activated. Guys, get activated. Do your hand like this. All of you, do your hand like this. Everybody, you are not doing your hand. Do like this. Do like this. So that you wake up. Ha! Why are you stubborn? Do your hand like this. Uh-huh. You come. Do like this. You can even stand up from your seat like this. Do like because this next one we are entering is very, very stressful. It will stress you. And I'm sorry about that. Sorry about that. Yes, the plexuses form from A. You understand? Form from A. That is the anterior or ventral ramus. Rami, rather. No, somebody said D. Somebody said C. If this is the same question we are answering, where does plexuses form from? Is A, guys. It's A. Look at this question. Which structure carries only sensory information? Quickly. Oh, I thought this should be the last question, but no. There's also another image that you guys really need to answer. Which one carries sensitive information? Here is that diagram. Yes, the answer is C. You're very correct. The answer is C. So look at this image. The question for this image, just 3 questions, and that's the last. Which reflex is pictured here? We have the patellar tendon, we have the cross extension, we have the Babinski, we have the Golgi tendon, we have the withdrawal. Patellar, cross extension, Babinski, Golgi, withdrawal. Quickly. See, your questions are very surface level. Yes, the answer is patella. It's patella. Which of the following accurately describes the reflex pictured here? A, polysynaptic; B, contralateral; C, autonomic; D, acquired; E, cranial. Which of the following accurately describes the reflex pictured here? Polysynaptic, contralateral, autonomic, acquired, cranial. No, the answer is polysynaptic, guys. The answer is polysynaptic. So, final question, guys, for that particular question. Final question. No, the answer is polysynaptic. It's polysynaptic. Final question. Look at this question. Let me give you the options. This is A. This is the final question. This is A. This is B. This is C. This is D. This is E. Final question for these parts. Hurry up. Let's go, guys. Looking at the muscles at B and G, which are being stimulated to contract and which are being inhibited from contracting. I need at least 15 people to 20 people to answer this question for me to go to the next part, all right? I just want to make sure that people are with me. This is the last question for this. So, but I need 15 to 20 different people to make a comment. If you don't know it right, not sure, but I need at least 15 to 20 comments. One, two, three, four, five, 6, 7, 8, 9. We have only 9 people here. No, it has to be up to 20 for us to move. Wake up everybody that is sleeping. Wake them up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Keep going. 100. Okay, so that is it. Yes, you guys are so correct. What about for lab? What do you mean? These people don't understand. It depends on the spirit. Let the spirit have the spirit have the final 100. I just said it, and somebody is asking me not the final. Your final is always 150 in every school. Any school you are in, your final is 150. You understand? Okay, listen. Neuro, this part is so large, so I'm going to take 20 minutes to take care of it. All right. So you need to. I'm flying. I'm not explaining anything. I just have to mention things. Then I jump into the question straight. I need you to open your ear, open your eyes, drink. I can give you 1 minute to go and take your coffee now, because this is the bulk. Trust me, this is the bulk. I'm always leaving the best for the last. If there's anybody that is sleeping, go and wake the person up. If there's somebody that is not here, tell the person to come back. Okay. So we're talking about human brain here. Extremely important. All right. Going forward is rostral. Coming back is caudal. We have the three major portions of the brain: the cerebrum, the cerebellum, the brainstem. Extremely important. All right. The largest is the cerebrum, followed by the cerebellum. Yes, thank you for the T. The largest is cerebrum, followed by what? Cerebellum. But posteriorly, or in the hind part of the brain, it is cerebellum that is the biggest. All right. This is the diagram. These folds are called what? Gyri, and the space in between the folds are called what? Sulcus. All right. We have the central sulcus here. This big part is the cerebrum. This small orange at the back is cerebellum. This is the brainstem. All right. And the cerebrum has different lobes, which you also need to know later. I just explained this now, so I'm jumping in. All right. So this is fissure. This is longitudinal fissure. It divides the cerebrum into two equal parts. Longitudinal fissure. This is the lobe, frontal lobe. This is the two frontal lobes. This is the two parietal lobes. This is the occipital lobe, and the temporal lobe is by this side. I got to work early. I got to go. All right. Have a nice one. All right. So you need to know the major landmarks. All right. The brainstem, what it is and what it is not. Very, very important. So if I open up the brain here, you'll be able to see the corpus callosum, the cingulate gyrus, and other parts of the brain. I'm not going to explain it because you have this picture. You should have read it. We have the gray matter and the white matter. We already discussed the gray matter and the white matter, and I'm not explaining it further. All right. Then this is how the formation of the brain, that's embryonic origin of the brain. All right. Starting from 19 weeks, 20 weeks, 22 days, 19 days, 20 days, and 22 days, and 36 days. All right. This is how it folds. All right. I need you to go here and look it up. Go and look it up. How the ectoderm, forms the neural crest and the neural plate. The neural crest joins together to form what? The neural tube here. So I'm not explaining it further. Now, by 4th week, you have the forebrain, the midbrain, and the hindbrain. The forebrain is the prosencephaly, midbrain is mess, and hindbrain is rome. All right. Remember what they form. By the 5th week, they divide. The forebrain divides into two: tell and die. Telencephalon, diencephalon. All right. The telencephalon becomes cerebrum. The diencephalon becomes what? The optic vesicles and also the retina. All right. Okay. Then we have the midbrain, which is the mesencephalon, continues at the midbrain. Then we have the hindbrain, met and mile. Met and mile. You need to know this thing. This diagram is so important for you. Met and mile. This diagram is so important for you. Why am I saying met and mile? Because pons and cerebellum met. That's metencephalon. So use that to remember that pons and cerebellum, they are formed from the metencephalon. Pons and cerebellum met each other. That's why they're here. Then myencephalon is medulla oblongata. All right. Then the medulla oblongata, that's myencephalon. Then pons and cerebellum, that's metencephalon. The two of them are called what? The hindbrain. The midbrain is mesencephalon. All right. Look at the midbrain here. Now we have the diencephalon. Diencephalon forms the ventricles and the optics, right? Then we have the telencephalon, which forms this orange part here. All right, that's the cerebrum. Chicken, and that is it. How many minutes did I take? Less than 5 minutes, less than 3 minutes. We have the meninges. We've already discussed the meninges. I'm not discussing any further. The only difference between the meninges of this the brain and the meninges of the spinal cord is that the dura mater here does not have that space. It's attached to the bone, to the cranial bone. All right, it does not have that space. It doesn't have that space. All right, so there's no epidural space in the brain, but there is in the spinal cord. Remember that. So yeah, there are folds in words. The word falx cerebri, tentorum, and falx cerebelli. You need to know the falx cerebri. Falx cerebri divides the two cerebral hemispheres. Falx cerebri. Falx cerebelli divides the two cerebellums. Then tentorum cerebelli divides the cerebrum and the cerebellum. You need to remember this. All right. So I'm jumping all these because we discussed it. Remember this diagram, extremely important. If you don't know it, go and look at the video I posted and you understand it. Meningitis, I'm not discussing it. Then the next thing you need to understand is the ventricles. All right. Now, remember, the choroid plexus produces the CSF, helps to circulate by and secrete and circulate by the epidermal cells. Where does it store it when it produces it? It stores in the ventricle. So we have the two lateral ventricles. The middle of them is what? The interventricular foramen. After that, you have the third ventricle. Then you have in the middle is the aqueduct of Savius. Then you have the fourth ventricle. And when they are in this ventricle, how do they flow out of the ventricle? Through the apertures. We have two lateral apertures and one median aperture. That's how they flow out. And where do they flow to? They flow to the subarachnoid space. You must remember this. All right, I'm jumping in. These are what we just discussed. The choroid plexus, spongy mass of blood capillaries on the floor of each ventricle. Then the ependyma, we talked about it, is a neuroglia that lines the ventricle and the cavities. All right, all the two of them, they produce the CSF. Very, very important for you to remember. And this is the CSF, colorless, odorless, blah, blah, blah. These are its components. These are the things it contains. All right. Epidermal cells modifies, but choroid produces. Remember that. All right. I've discussed about the apertures. Extremely important that you know that. These are the functions of the CSF. I'm not going to talk about it. Go read it up. This is how the CSF flows. All right. Remember, the choroid produces this red part is the choroid. All right. It produces it, stores it in the ventricle. From there, it comes out through the apertures. You see the apertures? Comes out through the apertures. And what does it do? Look at it, how it flows. It bats the entire brain, bats the entire brain, bats the entire. When I say bats, my pronunciation is terrible. I'm talking about BATH, like to pour water on your body, right? So that's how it pours itself on the brain and also the spinal cord. All right. So this area you see it's flowing now. It's called what? It's called the arachnoid space. All right, that's where it flows, the arachnoid space. So remember that. And after that, it has to flow back into the bloodstream through what? The arachnoid villus. All right, as a result of projection in the superior sagittal sinus. You have to remember that as well. Okay. This is blood-brain barrier. All right, it's formed by tight junctions. Tight, not gap. Tight junctions, not gap. These are the things that can pass through water, glucose, high lipid soluble substances such as oxygen, CO2, alcohol, caffeine, nicotine, and anesthetics. These ones have low permeability. That's potassium, chloride, and others. All right. Aha. Look up these ones. Then we have something we call second ventricular organs. Second ventricular organs are places in the third and the fourth ventricle where barrier is absent. All right. They can ask you what enters through these. Some terrible things like what? Immunodeficiency. That's a virus. Human immunodeficiency virus. That's HIV. It enters through the CVOs into the brain. If not, other parts are protected. Now, talking about the, let's start with the brainstem. The first part of the brainstem is medulla oblongata. This is the medulla oblongata. All right. Where is it formed from? The myelencephalon. Myelencephalon. This is the medulla oblongata here. Remember, this is medulla oblongata. All right. Now, what do you need to know? You need to know the nerve pairs that comes from it. We have the part of 8, 9, 10, and 12. Part of 8, 9, 10, and 12. Part of 8, 9, 10, and 12. You dance with it so that you can remember. All right. Okay. It has pairs of look at it here. This is medulla oblongata. All right. This is pyramids. We call them pyramids. Extremely important that you remember this. Okay. Okay, there is reticular formation on it. But this reticular formation, one thing you need to know about reticular formation is found everywhere. They will ask you which is found everywhere in the entire brainstem, reticular formation. And reticular formation contains cardiac, vasomotor, and respiratory centers. You must never forget this. Reticular formation contains cardiac, vasomotor, and respiratory centers. But when you are talking about medulla oblongata, there is something medulla oblongata have that no other one have, which is what? The inferior olivary what? Nucleus. It's a relay center for signals to the cerebellum. You must always remember this. All right? I will show you a diagram. Look at it. So look at it. So if you see a diagram like this and you see something that looks like intestine here, this is the olivary nucleus. It looks like intestine. This is the pathognomic feature of what? The main feature of what? Of the medulla oblongata. All right. Very, very important for you to know this. Now let's jump to the pons quickly. The pons is this second part. We are going upwards. The pons is the second part. Look at it. It looks like a butterfly. All right. Extremely important that you know that it looks like a butterfly so that you can use it to separate for others. And what are they asking you? They are asking you about the cranial nerves in it. We have the cranial nerve. No, this is midbrain. This is midbrain. The pons have cranial nerve 5, 6, 7, and 8. Part of 8. 5, 6, 7, and part of 8. Remember, we discussed about the medulla, which have cranial nerve part of 8, 9, 10, and 12. So you need to remember that. Extremely important. All right. The pons, the ascending and the descending tracts also passes through it. These are the sensory rows. These are the motor rows. Sensory rows, hearing, equilibrium, taste, facial sensation. These are the motor rows, right? Eye movement, facial, chewing, swallowing, and others. All right. Remember, the reticular formation is also still here. All right. So now let's talk about the midbrain. Midbrain has only two, which is the oculomotor and the trochlear, CN3 and CN4. Extremely important that you know about the midbrain. All right. That's the area where the cerebral aqueduct is found. Okay. It comes from the mesencephalon. One thing about you need to know about the midbrain is the parts of the midbrain. We have the tectum. All right. And this tectum has the upper and the lower. The upper is the superior colliculi, and the lower is what? The inferior colliculi. Remember that. It has the peduncles as well. The peduncles is divided into two. We have the tegmentum, the substantia nigra, and cerebral crus. Why this peduncle is very important is because of this substantia nigra. It contains pigment. That's why it's always black. All right. And this is where the dopamine receptors are usually found. So if a problem here cause a problem for cause Parkinsonism. Extremely important that you know this. Okay. This is just showing you a diagram of everything we just already discussed. So I'm not going to enter into it. This is the midbrain here. Very, very important for you to know. All right. Now, this tegmentum is red, dominated by a red nucleus, a lot of blood vessels. We talked about the substantia nigra, and this is the cerebral crus, just bundle of nerve fibers. So you see, they will give you this diagram. This part that is red is the red nucleus, right, of the tegmentum. Then this is the substantia nigra that is black. You automatically know that, okay, this is talking about what? It's talking about the midbrain. Extremely important that you know this. All right. Then this is reticular formation. Very important that you know reticular formation. You see, it's coming from everywhere. This is everything about the reticular formation. You need to understand it properly. It coordinates virtually everything. This is its function: somatic motor control. All right. It has the cardiovascular center, has the pain modulation, has virtually everything, sleep and consciousness in the pons, habituation as well. Extremely important that you know this. Now we are still going up. The next one is the cerebellum. The cerebellum is also very important. It's the largest part of the hindbrain, but the second largest overall. I gave you a different slide. No problem. The slide doesn't matter. What matters is information. Just if you follow me, you are good. My idea is not teaching this. This is a rough recap. You see how I'm flying? The most important thing is the questions, not the slide. All right. I get it. The only difference between this slide and the other is this one is colored. The other one is not. But the slide is not the important thing. The important thing is what I'm saying. You say, I like yours better. Okay. I can post it for you if you want for your finals. Anyway. Okay. So the cerebellum is the largest part of the hindbrain and the second largest part of the brain. All right. consists of the left and the right hemisphere. All right. Remember the peduncles, we have the inferior peduncle, the middle peduncle, and the superior peduncle. They have things that they carry. It's extremely important that you know this. They have individual things they carry. Look at the peduncles. But one thing you need to know about the cerebellum, you see this thing that looks like a tree. It's called the arbovita. Look at it. The white matter that is inside it. It's called the arbovita. Look at it. Arbovita. They will ask you about this arbovita. Please remember it. Extremely important. That's what we have here. All right. The inner white matter is called what? The arbovita. Okay. Then let's talk about the cerebellum. Continuation of the cerebellum ladder. Rather, these are the things it does: compares object, perceives space, recognizing this and blah blah blah. That's it for that. Let's talk about the forebrain. Forebrain, diencephalon and telencephalon. Diencephalon and telencephalon. It's important. This is it. This is forebrain. This is the telencephalon. This is diencephalon. Telencephalon is the cerebrum. Diencephalon is the ventricles and also the optics. Extremely important that you know this. Diencephalon, thalamus, hypothalamus, epithalamus is also involved in the diencephalon. All right, very, very important. Now, it has something we call nuclei. All right, these are nuclei. They may not seriously be asking you about this nuclei, but you should just remember, especially the limbic system that is in the anterior. It's very, very important. That is in the anterior. All right, it's the gateway to the cerebral cortex. If they ask you the gateway to the cerebral cortex, talk about the thalamus. Everything gets to the thalamus. Remember when we discussed it when we are talking about the nervous system. All right. They has the epithalamus, hypothalamus as well. Very, very important. This one helps a lot in the pituitary, helps the pituitary system, and also relays information in the limbic system. All right. This is the hypothalamus around here. This is the because this is the thalamus, this is the hypothalamus below it. Okay. The hypothalamus is the major control center of the autonomic nervous system. This is function. Look at it later at your leisure time. It is the endocrine system, but don't worry, we'll discuss endocrine system in endocrine system. These are the things the hypothalamus does: thermoregulation, food, water, blah blah blah, memory, and others. Now, one of the most important questions they usually ask is this suprachiasmatic nucleus of the hypothalamus. It's the biological clock that regulates the circadian rhythms. All right, extremely important that you know this. And also, the hypothalamus is also very, very sexually important. All right, it's because it produces oxytocin. You know, the hormone that helps you to relax in terms of sex and others. All right, let me not discuss evil. Now, remember the pineal gland. For the epithalamus, the only question they can ask in the epithalamus is the pineal gland. Why is pineal gland important? Because it's what? An endocrine organ gland. It produces melatonin. So they will ask you, pineal gland is found where? Epithalamus. Chicken, huh? And you're good to go. All right. This is the epithalamus. Look at it. This is the pineal gland here. Okay. Now, let's talk about the cerebrum. Cerebrum is so important. Seat of sensory perception, memory, thoughts, judgment, and voluntary motor actions. All right. Very, very important. We've discussed about the cerebral hemispheres. All right. This hemisphere is joined by the white fibrous tract known as what? The corpus callosum. It has gyri, it has sulci. Extremely important. This is the gyri. Sulci is this holes. I've mentioned it from the beginning. Now, these are the lobes of the cerebrum. We have the frontal, parietal, occipital, temporal, and insular. You need to know what each of them does, actually. Trust me, you need to know them. Frontal, judgment, social judgment, aggression, you know, foresight, planning, and memory. Very important. Parietal, talking about sense of taste. All right. General sense is like taste, like visual. Occipital is visual center. If they hit you here, you get blind. Trust me. Temporal, that is here for smelling, learning, and other things. All right. Then we have the insular. They will ask you this question. They say, which part is hidden? The part that is hidden deep. That's the only thing they ask about insula. You remember insula. If you open it, you see the opening of insula. All right. But familiarize yourself with these things. So these things, you use it for your wallpaper. All right. Now, the white matter, 3 projection tracts. We have the projection tracts, the commissural tracts, and the association tracts. All right. Extremely important. This projection tract, commissural tract, and association tract. Example, a major example of commissural tract is corpus callosum. Look at it. You see this thing that joins the two of them. That is a commissural tract. That's corpus callosum. All right. This one that goes up is projection. It's projecting upwards. All right. So it's connecting these guys to this the cerebrum. But this corpus callosum, that's commissural tract, is connecting the two parts of the what? Cerebrum. Then we have association tract. Association tract is the one that sensitizes one area in the cerebrum to another area. All right. Now, if you look at this picture, you understand it more. You see this association tract, this area to this area, this area to this area, this area to this area. But commissura is this one, like the corpus callosum that joins the two hemispheres together. This is the projection tract. This one that goes up. This is the projection tract, connecting this lower part to the cerebrum. Okay. Yes, they will ask you about the neocortex. There's a question about the neocortex. 90% of human cerebral cortex is neocortex. Remember that. All right. So the cortex, you talk about the gray matter is found in three places, major places. That's cerebral cortex, basal nuclei, and what? The limbic system. Remember these three things: the cerebral cortex, basal nuclei, and limbic system. These three things are where the gray matter is found. All right. Now, when you take the cerebral cortex out, all right, you are talking about neocortex of the cerebral cortex. It's extremely important that you know this. You have cells. They will ask you which cells are found in the cerebral cortex. You talk about the stellate cells and talk about the pyramidal cells. That's the best you should know about these things. Now, the second part is the limbic system. What do you need to know in the limbic system? Three parts: cingulate gyrus, hippocampus, and what? And amygdala. Cingulate gyrus is just the one that is on top of the corpus callosum. You remember? Then hippocampus, rather, memory. If they ask you memory, if I remove your hippocampus, you won't remember anything again. Memory. And it's short-term memory, actually, not long-term memory. So it is the hippocampus that teaches the cortex to have a long-term memory. You should remember that. So short-term memory, hippocampus. Amygdala, emotions. Oh, I love you. Oh, I hate you. Amygdala. All right? So the limbic system is the gratification center and aversion, sense of fear and sorrow, and also sense of pleasure. Extremely important. That's the limbic system. Remember, we discussed the cerebral cortex. Now we discussed the limbic system. All right. You also need to know about the basic nuclei. So this is the amygdala on top of the corpus callosum. This is cingulate gyrus on top of the corpus callosum. This is the amygdala, and this is the hippocampus. You need to remember this. All right. Sorry, guys, I'm almost done. Now, talk about the basal nuclei. It's the mass of cerebral gray matter buried deep in the white matter, lateral to the thalamus. Very, very important. What does it do? It receives input from the what? Substantia nigra. Do you remember the substantia nigra? The dark place, the dark part that we discussed initially? All right? Right. That's the place that has information about the dopamine, like the dopamine receptors. That's where it is found. All right? Involve the motor control. Very, very important. Now, what are the areas of the basal nuclei? You have the caudate nucleus, you have the putamen, you have the globule pallidum, and we also have the lentiform nucleus. All right, these are the different parts. These are the different parts of the basal nuclei. All right, different parts of the basal nuclei. You have the putamen, you have the globus pallidum. The two of them are known as what? Lentiform. All right. Then we have the corpus striatum. Okay. This is just rushing it. All right. Now, talking about sleep, you should know the 4 sleep patterns: alpha waves, beta waves, theta waves, and delta waves. Now, you guys are looking at me using the beta waves, all right? But when you are resting your brain, you are using the alpha waves. Theta waves is when you are a little drowsy. Somebody is drowsy now. Wake up. That's theta waves, all right? Delta waves, somebody is already snoring in deep sleep. Now, the waves, we have the 4 of them. I've already discussed them. Now, there's something called sleep paralysis that usually happens in REM. Remember the stages of sleep? We have the drowsy, we have the light sleep, we have the moderate sleep, and we have the terrible deep sleep. Somebody like me, if I sleep right now, you can take me to Brooklyn and come back. I will not even know. All right? That's stage 4. Now, there is a stage that goes in between stage 4 and back to stage 3. We call it REM. All right? That's what we call REM. It goes back from stage 4 to stage 3. That's backtracking. At this REM, that's what they usually ask you. Your eyes is moving. They will ask you which part will your eyes be moving. You're having vivid dreams. You have paralysis. Fire is burning and your leg is tied. You cannot run. That is this sleep, this stage. All right? Very, very important. That's REM. You know? Okay? And which part coordinates your sleep, right? That's the body clock. It's the suprachiasmatic nucleus of the hypothalamus. Remember, I mentioned it. Very, very, very important. The suprachiasmatic nucleus, they will always ask you this question. And there's something we call orexins. Hypothalamus produces these orexins, all right? They make you to be awake. A lot of you, your orexins is reduced because it's low. That's why you are feeling sleepy. Look at my eyes shining. I produce a lot of orexin. But if you produce a low orexin, you'll be always sleepy. Trust me, you will be always sleepy. So we call it what? Narcolepsy. Extremely important. Now, when you're talking about cognition, you also need to know cognition. Extremely important. All right. Cognitive functions in association areas. We have the parietal lobe, we have the temporal lobe, we have the frontal lobe. What do they do? I've already mentioned this thing before. I'm not discussing it. We have memory, you have short-term memory, you have long-term memory. Some people forget. All right. We have forgetfulness, that's eliminating trivial information. All right. Now we have amnesia. Amnesia is defects in declarative memory. Very, very important. Your inability to remember past events. And it can be anterograde or retrograde. They will ask you which one. All right. Anterograde, unable to store new information. Retrograde, you cannot record things that you know before the injury. All right. Now remember the hippocampus. You know what the hippocampus does? It's a member of the limbic system. All right. For memory. Why the amygdala is for emotional memory as well. All right. So you remember these two things: emotions, amygdala, feelings. All right. Amygdala. You should remember that. Okay. I'm not wasting too much time on this. Okay, these are different areas of the brain. This is the Broca's area. You need to remember Broca's area. You need to remember Wernicke's area. All right. This is tastes. Okay. No, you will not be seeing a question from the somatosensory. Sorry, guys. I'm trying to go to the most important things. We've already discussed the cerebellum. Okay, yes. The Wernicke area and the Broca area. You must know these two things. Wernicke area permits the recognition of spoken and written words, language, and Broca area generates motor program for the muscle of the this and this and this and this and this. All right? Very, very important. And how you'll be able to understand this thing is the aphasia. The Broca, we call it non-fluent aphasia, lesion in the Broca area, slow speech, difficulty in choosing words, using words that only approximate the correct word. I want to say, oh, I love you very much. I love you. You see, that is non-fluent. You are not fluent. That's non-fluent aphasia, and that is Broca's aphasia. They will ask you this. Fluent aphasia, you are speaking a lot of things that doesn't make sense. All right, that's Wernicke. Okay. All right. Let me see if there's any other thing I'm leaving behind. Lateralization. Remember lateralization. Very, very important. All right. Very, very important. There's a question on lateralization. And I can't. Okay. The question is asking you about males exhibit more lateralization than females and suffer more functional loss when one hemisphere is damaged. Males exhibit more lateralization than females. Very, very important that you know this. All right. And what is cerebral lateralization? The difference in the structure and function of the cerebral hemisphere. All right. Oh, this part controls this part. Oh, if you are more developed in this part, this is what you'll be doing. Like people that use the left hemisphere, right? They are very analytical. Math and science, extremely important. People that use the right, music and artistry. Okay. So now finally, cranial nerves. How many pairs? 12. All right. Where do they pass through? Different foraminals of the brain. Extremely important. These are the cranial nerves. All right. You need to know the pathways. You need to know what they do. Look at this. You need to know which one is sensory and which one is motor, which one is mixed. I gave you a mnemonics for it. I hope you can remember. So that is it. Everything is now talking about the cranial nerves and their roles. Okay, we have trigeminal neuralgia and Bell's palsy. We'll go read it up. I'm not discussing pathology. Okay, that is it. How many people are still here? Do I have up to 20 people? Please say yes. Let me start. I have to get up to 20 people. I need you to be active and alert. I'm waiting for you. Type yes, please. Everybody. Let me see. Let me estimate how many people I have here. I'm waiting, guys. Hurry up. One, two, three, four, five, six, seven. I'm here with no answers. We are still alive. here in spirit. Okay. You can't be tired, though. This is one of the most important topic. Trust me. I'm not even mincing words. This is the most important. This one and the first one, they are your most important topics. The second one is good, but it's very short, all right? But you see, this one is almost 179 slides to tell you how important it is. So please, no sleeping. If I'm you, I will stand up right now and be agile. All right? Oh boy. I'm drinking a lot of water. My energy comes from water. Keep water by your side. I know some people must have caffeinated themselves a lot. If you are going to work tomorrow, it's okay that you can listen to this. This thing will automatically save. And sure that we post it in your individual platforms for people that are in my classes. Oh boy, you can do your hand like this so that we can start. He said I didn't go for bathroom break. I'm actually feeling okay now that you said it. I have to go for bathroom break. Guys, give me 2 minutes. Hey God, I like this chair being covered. Give me 2 minutes, all right? Just 2 minutes. Now that she said it. Okay. Oh boy. I'm here. Energized. I hope you guys went on break. Oh, some people ran away. I left 40 something people here, 50 something people. Now it's 34 people. Why? Okay. I guess they will come and watch this video later. Okay, let's jump into this thing with our full chest. So, guys, please, we need a whole lot of people to make comments, all right, to give answers so that it will energize me, because you may be having your highest questions from here, meaning that I really need to give you as many questions as I could. Thank you so much. Thank you. Meaning that I need to give you as many questions as possible, especially people that have not been able to, read my this thing. So for the next 30 minutes, if you are very fast, we can finish up in the next 30 minutes. All right. So I need And you know me, I will not move if a lot of people haven't answered. So I need all of you to be awake now. If you are not sure, just write not sure so that I'll make sure that there's somebody a comment there. All right. Now let's test the microphone with this pathology. I've not even asked question. You're saying you are not here. You are not sure. Okay. Let's test the microphone with this. Quickly, guys. A patient is experiencing a high fever. Yes, testing the mic. No, I've not eaten there. A patient is experiencing a high fever, stiff neck, drowsiness, and intense headache. A spinal tap showed a bacteria and white blood cells in the CSF. The individual most likely has what condition? Quickly. He's just testing the microphone, guys. If you can answer very fast, then we'll be able to cover so many things. But I need a lot of people to answer. At least 10 per question. I'll be very fast this time around, but 10 people per question. So if you have friends, tell them to answer. If I just count up to 10, I move. So if I count up to 10 in 1 second, that means we are answering very fast. Perfect. That's 10. I hope one person is not typing all these things. Okay, that's 10. So that's meningitis, guys. Caused by inflammation of the meninges of the brain, all right? Anything itis is inflammation. Anything inflammation is from the word flame. Flame. So it's swollen, see the brain becomes swollen. And which area is affected? The arachnoid matter and the pia matter. And the arachnoid matter is more affected because it's very delicate. Okay. Look at this question. Very fast. What is the most posterior component of the brainstem? Quickly, quickly, quickly. Quickly, guys. Quickly, 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 quickly. Most posterior component of the brainstem. This part is for is a reward to people that are here. I understand, because I know some people, they wanted me to start from this part, but there's no way I can start from this part. You understand? Without doing the first and second part, it's a sequel, right? So I need 10 people. No, if you don't know the answer, you can always write not sure. If you need me to explain, write emergency, but I need you to write something. That's the point. If I get 10 stuffs, I move. 1, 2, 3, 4, 5, 6, 7. This is just testing the microphone now. 7, 8, 9. One more person. 10. Yes, the answer is medulla oblongata. Remember, we said the brainstem. Let me share this picture. Remember, we said, you see, this is the arrangements. Let me use any picture. See the brainstem, 1, 2, 3. So if you look at it, the most posterior is what? The medulla oblongata, followed by the pons, going up, followed by the midbrain. So that's, oh, I didn't even share it. What I was showing you. The most posterior here is the medulla oblongata. This is the brainstem. The three of them is brainstem, followed by the pons, followed by the midbrain. So the medulla oblongata is the most posterior. So you need to remember that. All right. Yes. Okay. We are still testing the microphone. No? Look at this question. Quickly, guys. The right and the left cerebral hemisphere are separated from each other by what? I think it's your internet. I'm not possible. Yes, the answer to that question was medulla oblongata. It's the most posterior, all right? So the right and the left cerebral hemisphere are separated from each other by dash. A, many sulci. B, many gyri. The brainstem, longitudinal fissure, the corpus callosum. Quickly, 10 people. I need 10 comments. Whether you get it right or wrong, it doesn't matter. I need 10 comments. The right and the left cerebral hemisphere are separated from each other by many sulci, many gyri, the brainstem, the longitudinal fissure, the corpus callosum. The faster I get 10 comments, the faster I move. 1, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so the answer is longitudinal fissure. Please remember that. The answer is longitudinal fissure. We are still testing the microphone. We are still testing the microphone. The cerebellum is dashed to the cerebrum. They are talking about the positioning. Remember, this is anatomy. Anatomy is location, 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 structure, structure, structure. All right. So the cerebellum is dashed to the cerebrum. Superficial, deep, posterior, rostral, medial. Quickly, guys. Quickly, quickly, quickly. 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. So it's posterior. The cerebellum is posterior, guys. You see how we are moving very fast? If you answer me very fast like this, we are moving very fast. Trust me. If you answer very fast, we are moving very fast. And if we move very fast, you'll be able to see a lot of questions. All right? Because I can decide, okay, let's just take 20 questions. And maybe, you know, like you will not be exposed to as many questions as you should. All I'm doing is to expose you guys to, you know, to let's palpate that brain. Let's excite that brain. The gray matter of the cerebrum forms a surface layer called dash, and the deeper masses called dash, surrounded by the white matter. A, nuclear tracts. B, cortex nuclei, cortex medulla, medulla midbrain, medulla nerves. Nuclei tracts, cortex nuclei, cortex medulla, medulla midbrain, medulla nerves. Now I will know people that watched the video I posted. Now let me know people that watched the video I posted. Can't hear? What? You can't hear me? I said nuclei tracts, cortex nuclei, cortex medulla, medulla midbrain, medulla nerves. 1, 2, 3, 4, 5, 6, 7, 8. Keep going, keep going, keep going. I need 2 more. 9, 10. Yes, the answer is cortex nuclei. All right. It's very, very straightforward. This is just testing the microphone. The gray matter of the cerebrum forms a surface layer called what? The cortex. And the deeper areas are called what? The nuclei. Extremely important that you know this. This is just testing the microphone, guys. Yes. Testing the microphone. Look at this question. 10 people. The pons and the cerebellum arises from which secondary embryonic vesicle? Quickly, guys. Quickly, quickly, quickly. Ten people. The pons and the cerebellum, where do they arise from? I have 2 answers. I need 10 people. 10 people. Keep going. You see how fast we are? Because you guys are responding very fast. You understand? But if I have 4 people, I won't move. Yes, you guys are so correct. It's metencephalon. Remember I told you the pons and the cerebellum met each other. All right? I don't know what they did when they met each other. That's their problem. If you know what they did, then you and them can discuss that one. But that's metencephalon. Look at this question. Which of the following structures appears as a large bulge just rostral to the medulla? Which of the following appears as a large bulge just rostral to the medulla? It's just asking you which one, what is on top of the medulla? That's just what they're asking you. If you remember this thing, you arrange it in your head. After the medulla, what is on top of it? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Exactly, it is the pons. Please, the answer is not cerebellum. It's not cerebellum. The answer is the pons. All right, the medulla, the pons, the midbrain. Cerebrum is just at the other part. I want to test the microphone with just these 10 questions, then we enter the main thing. Where I read wrong, pons. Where is the third ventricle located? Where is the third ventricle located? We have the diencephalon, we have the midbrain, diencephalon, midbrain, pons, medulla oblongata, cerebrum. I understand. Where is the but I need you to be activated right now, please. You know these parts, even if you're tired in the first and second part, that's understandable. You know these parts, you cannot be tired. Trust me. I'm going to ask you 10 questions testing the microphone and another 20 or 25 questions. I need to expose you a lot to this particular part. Where is the third ventricle located? Diencephalon, midbrain, pons, medulla oblongata, cerebrum. Answer. Not sure, not sure, not sure. So the answer is what? Diencephalon. All right. Remember, prosencephalon, that's the forebrain. Prosencephalon is divided into telencephalon and what? Diencephalon. Telencephalon is what takes care of the cerebrum. All right. But diencephalon takes care of the ventricles and the optics. All right. So remember that. So the answer is diencephalon there. We are still testing the microphone. Me, I'm not going to ask you this question. From superficial to deep, the meninges occur in which order? No, I can't ask you that. It's a waste of my time. It's a waste of my time. So look at this question. I'm going to post it here. And I want you to hold on. Let me give you the answers incoming. Are we still testing the microphone or the microphone has scattered? I think it has scattered though. This is A. This is B. This is C. This is D. And this is E. Which of the following is not a function of the CSF? To regulate the chemical environment of the nervous system, tissue, to rinse metabolic waste from the nervous tissue, to provide oxygen nutrients to the nervous tissue, to protect the brain from striking the cranium when the head is jolted, to allow the brain to attain considerable size without being impaired by its own weight, which is not 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. Yeah, the answer is C. C is not to provide oxygen and nutrients to the nervous tissue. No, that's not its primary function. So we are done with testing the microphone. We are now entering the question proper. All right. Look at this question. Cerebrospinal fluid is secreted by choroid plexus in the ventricles and reabsorbed by arachnoid granulations in the secreted by choroid plexus in the ventricles, yes. Reabsorbed by arachnoid granulations in the where are the arachnoid granulations? That's the question. I'll give you options. A, superior sagittal sinus. B, reticular formation. D, central canal of the spinal cord. D, tegmentum, and E, substantia nigra. Quickly, guys. A, I'll mention it again. A, superior sagittal sinus. B, reticular formation. C, central canal of the spinal cord. D, tegmentum. E, substantia nigra. Quickly, guys. 10 people. Quickly, quickly, quickly. Quickly, guys. Yes, we have up to 10. That's superior sagittal sinus. Please, the answer is superior sagittal sinus. That's where you see the arachnoid granulations. All right? Okay. So look at this question, guys. I like the way you guys are responding. I really love it. Honestly, like if you can respond like this, trust me, next 30 minutes, we are done with this thing. Honestly. Because I really want to give you as many questions as possible so that you'll be exposed to these questions. But I need you to understand it as we're doing it right now. This is B. This is C. This is D. And this is E. Anybody that is still here, you don't have a choice but to get 100 in exams. Which structures create the blood-brain barrier? Gap junctions between endothelial cells that form the capillary walls, tight junctions between endothelial cells that form the capillary walls, gap and tight junctions between astrocytes and endothelial cells that form the capillary walls, desmosomes and tight junctions between astrocytes and ependymal cells that form the capillary walls, gap junctions between ependymal cells and endothelial cells that form the capillary walls. Quickly, guys, quickly. We have 6 people commenting. I need 10. The faster we go this thing, the better. Okay, we have 10. So the answer is B, tight junction. Please, it's tight junction. Anywhere you see cap junctions, not positive, which one? Anywhere you see, what are you asking? Yes, the answer is tight junctions, not C. C is gap. You can't have gap. We are trying to tighten up everywhere so that things cannot pass, all right? So it's tight junction. No, I can't ask you this question now. You already know the answer to this one. Let me not waste time with this, but let me still ask you, maybe let me use it to give some people happiness this night. The medulla oblongata originates from which structure? Quickly, guys, quickly. Quickly, 10 people. One, two, three, four, five, 6, 7, 8. Two more. Okay. Two more. Good. So the answer is mile, all right? Met is for when the pond met the cerebellum. Okay, this is mile from medulla, all right? Look at this question. Where are the cardiac, vasomotor, and respiratory centers found? Where are the cardiac, vasomotor, and respiratory centers found? Quickly. Medulla oblongata, pons, midbrain, spinal cord, diencephalon. Quickly, guys. Quickly. If you have watched those my videos, you'll be answering this question with a very fast pace. Oh yeah, this question, and this question. Quickly, guys. Medulla oblongata. Yes, the answer is medulla oblongata, guys. Very, very important that you know that answer. The answer is medulla oblongata. Look at this, a bird is flying. Pew! Like this, you see? Flying. And you are following it like this. What is helping you to focus? We have the inferior colliculi, we have the superior colliculi, we have the tegmentum, we have the red nucleus, we have the substantia nigra. The dash functions in visual attention, such as to look and follow the flight of a butterfly. Inferior colliculi, superior colliculi, tegmentum, red nucleus, substantia nigra. I need 10 people to, attempt that question. Yes, the answer is superior colliculi, please. You see this question? They always bring it out. A bird is flying, you are busy following it like this. Superior colliculi, all right? Okay. You know, this question is, you will see it more in pathology, but I think you will still see it in physiology because it's not completely Superman flying, yes. Or maybe you see somebody beautiful and you are looking at it. Okay. So look at this. Degeneration of the neurons in which of the following structures leads to muscle tremors associated with Parkinson? What's the answer? We have cerebral crus, we have tegmentum, we have the pons, we have the substantia nigra, we have the inferior colliculi. Quickly, guys, quickly, quickly, quickly. I think somebody has watched this my video because it seems she's always the first to answer every question here. She definitely has watched the video because I gave a lot of these questions in the video. I discussed it. If you've not seen the video, this person is just coming. Oh. This person is, if you are coming, just coming. I told you that the spirit says 100. That's what I'm hearing right now. Hold on. Yes. Yes, Father. Yes. Yes. The spirit says 100. This is neuro. The spirit says 100. Okay. Yeah, you guys are correct. That's in a substantia nigra. Everybody knows that. Look at this question. Reticular formation is a web of dash scattered throughout the dash. A. Nerves. White matter in the cerebrum. B. White matter cerebrum. C. Gray matter brainstem. D. Gray matter cerebrum. E. Cell bodies hypothalamus. A. Nerves, white matter in the cerebrum. B. White matter cerebrum. C. Gray matter brainstem. D. Gray matter cerebrum. E. Cell bodies hypothalamus. So, hey, I know you watched the video because there's no way you can be answering this question so fast. That's what I told everybody. I wanted you guys to watch the videos. For me to make those videos back to back that fast, it took me like an entire day. You understand? I was even supposed to go to the lab, but I didn't. Why? Because I needed you guys. I wanted a situation whereby, okay, if you've learned to lecture, read the slides, watch the video, and be part of this review, it will consolidate. In the exam, you'll be smashing like 100. This is neuro. And if you know neuro, you've known it for life. Some of you will specialize in neuro. Trust me, some of you will. Yes, the answer is gray brainstem. The answer is gray brainstem. Gray matter, reticular formation is found everywhere. I would have asked you this question: what is the largest part of the hindbrain? But I'm not asking that question right now. I don't want to waste our time. It's too cheap. It's too cheap for the review. If you see it in the exam, you'll be able to. You definitely get it. So can't be asking this in review. Let's ask more questions that some people may most likely fail. Look at this question: loss of equilibrium and motor coordination could most likely be related to a lesion in which structure? Loss of equilibrium and motor coordination would most likely be related to a lesion in which structure? Limbic system, pons, pituitary gland, medulla oblongata, cerebellum, rather. Limbic system, pons, pituitary gland, medulla oblongata, cerebellum. Ten people. 10 people. 10 people. Ten people. Okay, cerebellum. Please, loss of equilibrium and motor coordination is cerebellum. Please. Now, you see that question I was asking you? I was telling you guys. I need 10 people to attempt it. In which structure is the abovita found? Quickly, quickly, quickly. We have the left cerebral hemisphere. We have the tegmentum in the midbrain. We have the cerebellum. We have the reticular formation. We have the diencephalon. Answer. Quickly, guys. Quickly, quickly. I need 10 people. We were fast before. What happened to our pace? If you've watched the video, you will be very fast. You'll be giving me the answer with reckless abandon. That's how you'll be giving me this answer. But you guys are being slow because you didn't watch the video. Please, these resources are for you to be the best, not just for this exam. Even if you know anatomy, I'm spending a lot of time on anatomy and physiology because if you know it, your pathology will be easy for you, your pharmacology will be easy for you, your medicine will be easy for you, your surgery will be easy for you. All right? But if you don't take it serious, you can pass this exam. Trust me, you will. You will. But you know, those times you will now start reading too much again. Or they will ask you a question in the clinic and you embarrass me. Please don't. Thank you. The answer is cerebellum. All right. Abovita is found in the cerebellum. Look at this. There are no cranial nerves associated with which part of the brain? No, it's okay. It's okay. It's okay. Don't worry. I was just kidding. I need 10 people to attempt this question. If you are sleepy, do like this. Do like this. That's my secret. Sometimes if you see me talking, I'm doing my hand like that. Like that. I just put it under the table and I'm doing like that. That's the secret. If you do it, you get strength. No. If you're in my class in CSI, Monday, I have 2 hours with you, and the question is 100. So Wednesday is just I don't know, less than 2 hours. So it's not possible. It has to be tomorrow. But you know, it's in the afternoon, so you can always watch this video again. All right, you can just go back. You wake up in the morning, look for the parts where you missed, and you watch this video. All right. And actually, you have the video, the ones I posted, and also the lectures you've been. So you don't have a reason. You pass this exam. Trust me, you will. You will. I'm very optimistic about it. Cerebellum, cerebellum. 1, 2, 3, 4, 5, 6. I need 10 people. Come on, let's go, guys. These questions are very straightforward, though. Minutes? No, I'm not timing it with minutes. I'm just timing it with questions. Yes, you guys are very correct. The answer is cerebellum. All right? The cerebellum does not have any nerve association. I wanted to ask you this one, but we already know it. The derivatives. Nearly all somatosensory. You already know this one. Sex. Look at this question. Look at this question, guys. Look at this question. Sex drive, body temperature, food and water intake are regulated by which part of the brain? 10 people, quickly. Which part of your brain regulates this? Limbic system, thalamus, pineal gland, hypothalamus, pituitary gland. Which part? Which part? 10 people, quickly, 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 quickly. If you are faster, you'll be able to see more questions. And the more questions you see, you are exposed to, the more likelihood of you passing the exam. Anatomy is your core course. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, perfect. The answer is what? Hypothalamus. Look at this question. A lesion in which structure would cause a person to have an erratic waking and sleeping hours? We have the satiety center, we have the mammillary nucleus, we have the suprachiasmatic nucleus, we have the pituitary gland, we have the medial geniculate nucleus. A lesion in which structure would cause a person to have an erratic waking and sleeping cycle? Satiety center, mammillary nucleus, suprachiasmatic nucleus, pituitary gland, medial geniculate nucleus. Which one? Not sure. Keep going. Keep going. 1, 2. You deleted. So I removed that count. 1, 2, 3, 4. Come on, let's go. Come on, let's go, guys. Give me up to 10. 1, 2, 3, 4, 5, 6. 6 people. Let's go. Let's go. Let's go. Let's go. Come on now. We need 10 people. If not, we'll be here waiting now. One, 2, 3, 4, 5, 6, 7, 8, 9. One more. I'm very serious about the 10 people. Okay. Yes, the answer is suprachiasmatic nuclei. I mentioned it. The pineal gland is a part of which larger region of the brain? Thalamus, hypothalamus, occipital lobe, midbrain, epithalamus. Quickly. As you're answering that question, please remember that the visual center of the brain is the occipital lobe. You can't forget it. That's the visual center. And where you plan motivation, social judgment, and all those things is frontal lobe. You need to know what each of them does. All right? Planning, motivation, and social judgment, frontal lobe. Primary visual center, occipital lobe. Extremely important. So what's that answer? Epithalamus. Yes, you guys are correct. Epithalamus, very correct. Look at this question. Tell me the answer. Yes, epithalamus. Which lobe is deep to the lateral sulcus and can only be seen by removing some of the overlying cerebrum? We have the frontal lobe, we have the occipital lobe, we have the parietal lobe, we have the temporal lobe, we have the insula. Quickly, guys. Quickly. I need 5 people to attempt it. No, 10 people rather. Yes, the other answer is epithalamus. You're correct. But which lobe is deep to the lateral sulcus and can only be seen by removing some of the overlying cerebrum? Yes, the answer is insula. 10 people have attempted. The answer is insula. You have to remove the other areas for you to be able to see it. It's deep. Look at this question. The great majority of which tracts pass through the corpus callosum? Ascending tract, descending tract, projection tracts, commissural tract, association tract. Which one? Which one is the corpus callosum an ambassador of? Which one? The great majority of which tract passes through the corpus callosum? Quickly, guys. 10 people, 10 people, 10 people. Not sure. Yeah, please, if you are not sure, write not sure, but I need to see 10 people saying something. What were the answer? Which answer? Is it the other one? Is insula? This one? Okay, perfect. So you guys are very correct. The answer is commissural. I told you commissural is an example. Corpus callosum is an example of commissural tract. Commissural is the one that joins the two hemispheres together, right? Projection tract is what takes information from below to the cortex. That's a projection tract. While association tract is the one that takes information from one area of the hemisphere to another area of the hemisphere. That's why you see them like this. See them like this. While projection tract is like this. All right. Okay. Most gray matter of the cerebrum is located in which region? Most gray matter of the cerebrum is located in which region? We have the reticular formation, we have the neocortex, we have the limbic system, we have the basal nuclei, we have the substantia nigra. Hurry up, guys. Hurry up. I have just 5 or more questions to go. As you're answering that question, the hippocampus and the amygdala is found in the limbic system. You know that. So I'm not going to repeat, ask you that question. Now, about the eye, the sleep, the waves, you need to know the waves, please. Predominance of which wave is found in the ECG, which indicate that the person is physically and mentally relaxed. alpha wave. You understand? Yes, the answer is what? The answer is neocortex. You guys are so correct. Look at this question. I'm going to post the options, and I need 10 people to attempt it. This is the question. I'm going to post the options. This is A. This is B. This is C. This is D. This is E. I need 10 people to answer it quickly. Which of the following occurs during rapid eye movement sleep? That's REM sleep. I discussed this, so I need you to just pick me the answer quickly. A, the muscles relax, the body temperature, blood pressure, heart rate, and respiratory rate fall. The muscles are very relaxed, and the body temperature, blood pressure, and the heart rate and respiratory rates are lower than their lowest levels. The muscles are paralyzed, the body temperature, the blood pressure, and the heart rate and respiratory rates increases. A person falls into light sleep. A person begins to relax and feels drowsy. 1, 2, 3, 4, 5, 6, 7. No, this person wrote 2 times. So 1, 2, 3, 4, 5, 6. 6. I need 4 more people. Quickly. Okay, that's 10. Yes, you guys are very correct. During REM sleep, the muscles are paralyzed, the body temperature and blood pressures and heart rate is actually increased. Please remember that question. Remember it. It's very, very important. So I have just 5 more questions to leave you guys. Now, this is one of those 5 questions. That's the question. This is the option. Yes, short-term memory is associated with DASH, whereas long-term memory is associated with DASH. A, cerebral cortex hippocampus. B, hippocampus cerebral cortex. C, cerebral cortex amygdala. D, amygdala hippocampus. E, hippocampus midbrain. Hurry up, guys. Hurry up, hurry up, hurry up. It's already very late. People are going to work tomorrow. One, two, three, 4, 5, 6, 7, 8, 9, 10. Perfect. Yes, the answer is what? Is B. Is B, hippocampus and cerebral cortex. Why the amygdala? You know what the amygdala does? The amygdala is also very important in emotions. Amygdala is emotions. If you see emotions, put amygdala. If you see memory, put hippocampus. All right? Cortex is long term. Amygdala, hippocampus is short term. Look at this question very fast. I told you there are 5 more questions to go. This is one of them. Non-fluent aphasia due to a lesion in the dash results in a slow speech, difficulty in choosing words, or use of words that are only approximate to the correct words. Primary motor area, cerebral lateralization, Broca area, Wernicke area, primary auditory area. Non-fluent aphasia is where? Quickly. 10 people. 3, 7 more to go. Quickly. One, 2, 3, 4, 5, 6, 7. Keep going, keep going. 3 more to go. One, 2, 3, 4, 5, 6, 7, 8. 2 more to go. Hurry up, hurry up, hurry up. Let's leave here. Perfect. The answer is Broca area, non-fluent aphasia. So you know that fluent aphasia is Waneke. Check your answer. I don't need to give you a question here on Waneke. Right? Automatically, if you know that non-fluent is Broca, then fluent is Waneke. So answer this question. Dash show more lateralization than dash. A, adult males, adult females. B, young children, adults. C, young children, elders. D, adult females, adult males. E, young male children, adult males. Dash show more lateralization than dash. A, adult males, adult females. B, young children, adults. C, young children, elders. D, adult females, adult males. E, young male children, adult males. Answer. 1, 2, 3, 4, 5, 6, 7, 8. Quickly, quickly, quickly. Three more to go. Yes, you guys are so correct. Adult males and adult women. Adult males show more lateralization than the adult women. Look at this question. Which of the following is not a motor cranial nerve? Which one is not motor? Which one is not motor? Options: A, trochlea. B, abducens. C, hypoglossus. D, vestibulocochlear. E, accessory nerve. Trochlea, cranial nerve 4. Abducens, cranial nerve 6. Hypoglossus, hypoglossal nerve, cranial nerve, hypoglossal should be 12. Vestibulocochlear should be 8. And accessory should be 11. Which one, guys? Which one is not modal? Can you remember? Come on, guys. 3 people. No. We need more. Hurry up, hurry up, hurry up. If you look at the video I posted, I put the mnemonic there, and I need you to go back there and look at it. Yeah, no idea, but you need to go back to because some nerves are motor, some nerves are sensory, some are mixed. I gave a mnemonics there, and I'm not saying it here. I gave a mnemonics there on my video. So go to that video because I posted Neuro 1, Neuro 2, Neuro 3. Go to Neuro 3, and you will see the mnemonics for you to know. The options: trochlear, abducens, hypoglossal, vestibulocochlear, and accessory. 1, 2, 3, 4, 5. I remember. Option D is vestibulocochlear. Cranial nerve 8. Okay, you guys, the answer is what? Cranial nerve 8, vestibulocochlear nerve. All right, it's not a motor. It's not a motor. Look at this. What is the largest cranial nerves and the most important sensory nerve of the face? A, accessory nerve. B, facial nerve. C, trigeminal nerve. D, hypoglossal nerve. E, abducens nerve. The largest cranial nerves and the most important sensory nerve of the face. A, accessory nerve. B, facial nerve. C, trigeminal nerve. D, hypoglossal nerve. E, abducens nerve. Hurry up, guys. One, two, three, 4, 5, 6, 7. Hurry up, guys. Hurry up. 8. Hurry up, guys. Look at this question. Which cranial nerve innervates? Yes, that answer is trigeminal. Guys, the answer is trigeminal. It's the largest. All right. It has 3 branches, V1, V2, V3. Now, look at this question. Which cranial nerve innervates most of the viscera in the thoracic and abdominal pelvic cavities? Which one? We have the hypoglossal nerve, we have the accessory nerve, we have the trochlear nerve, we have the abducens nerve, we have the vagus nerve. Apart from this, I have just one nerve question. Quickly, guys, quickly. One, two, continue going, keep going. Yes, you guys are so correct. The answer is vagus nerve. The answer is vagus nerve. Always remember that. Remember that question. Look at this. Which cranial nerve pathway would be used to look cross-eyed at the tip of the nose? Like you are looking at your nose like this. See my big nose? I'm looking at you. Which cranial nerve? Which one? Quickly. Trochlear, oculomotor, abducens, facial nerve, vagus nerve. Which one? Crossed eye. Trochlear, oculomotor, abducens. Which one? Hurry up. Oh, oculomotor. No. The answer is not oculomotor, guys. Please, thank God I gave this question. I was not. Oculomotor is usually elevation. This one is trochlear. The answer is trochlear, guys. Please, you have to go and know the difference. The answer is trochlear, not oculomotor. Please, don't make that mistake in the exam. It's trochlear, yes. Look at this question. Injury to the reticular formation can result in which of the following? A. Irreversible coma. B. Hypertension. C. Parkinson's disease. Alzheimer's disease. Type 2 diabetes. Injury to the reticular formation can result in which of the following? Irreversible coma, hypertension, Parkinson, Alzheimer. Yes, that answer is trochlear. Injury to the reticular formation. Remember the reticular formation, the one I say is found in every part of the brainstem, leads to what? Irreversible coma, hypertension, Parkinson's disease, Alzheimer's disease, type 2 DM. Okay. Yes, you are very, very correct. All right. So I need you to guys to that will be my last question for this part. But please, before you go, I want you to look at this diagram. I need you to go understand this diagram very well. This particular diagram very well. All right. You'll be getting some questions from this diagram. All right, some questions like, what are the names of the vessels? 1, 2, 3, 4, 5. You should be able to know. Eh? Okay, you know what? I need 5 people to give me the names of 1, 2, 3, 4, 5 in that order. Just write it as one sentence. Come, let's go. So that I don't need to be wasting time asking each of them. Give me 1, 2, 3, 4, 5 in that order. Come on, guys. Yes, you guys are so correct. Number 1 is telencephalon, right? Number 2 is diencephalon. Number 3 is mesencephalon, right? Yes. Then number 4 is met, and number 5 is male. It's myelencephalon. And also, I need you guys to be able to give me the answers to this. Yes, you guys are so correct. Please give me the answers to this. 1, 2, 3. Write it in one line. 1, 2, 3. 1, 2, 3. Write it in one line. All of them are tracts, so you don't need to write this tract, that tract. Just give me one of their names. Write it in one line. 1 is what, 2 is what, and 3 is what, in that order. Quickly. Do you need me to make it bigger? Just write all of them together. Hurry up. This is the... Only 2 people attempting. Why? We have almost 40 people here. Yes, you guys are so correct. So association, right? Let me see. Yeah, number 1 is association. Number 2 is commissural. Number 3 is projection. Yes. Okay. Finally, I know somebody is so happy. Somebody's like, what? At the end of the day, we got to the last scene. Yes. So I need you to just answer these 2 questions for me. See this place that this thing is pointing? Look at it. Look at the question. The question is, what is the function of the indicated parts? Yes, it's association, commissural, and projection. Yes, association, commissural, and projection. This question says, what is the function of the indicated brain region? A, production of speech. B, understanding written language. C, hearing. D, memory consolidation. E, emotional control. Quickly. Even then, the yellow part, you should also tell me what is in the yellow part. You are not asked the name of the thing, you are asked the function. So let's focus on the one that they pointed arrow. A, production of speech. B, understanding written language. C, hearing. D, memory consolidation. And E, emotional control. What was the answer? Come on, let's go, guys. Come on, let's go. We're almost done. Yes, you guys are so correct. Broca's area, that's speech production. All right. Broca, you need to know also about the aphasia, non-fluent aphasia, a problem in that area. Look at this second one. This is the last question for today. This yellow part, yes, this yellow part, the same option. Production of speech, understanding written language, hearing, memory consolidation, and emotional control. What is the function? Quickly. First part, yes, that first part is production of speech. Yes. But this second one, pointing to yellow, what is it? Production of speech, A. Understanding written language, B. Hearing, C. Memory consolidation, D. Emotional control. Is there speech as well? No. Yeah, so the first one is production of speech. The second one is understanding written language. All right? Understanding written language. That's why if you have aphasia in this second one, that's one eki, the yellow one, you don't have a problem with production. You are producing words, but it doesn't make sense. People cannot understand you. You understand? A lot of that's why it's fluent. Number two is fluent aphasia. Number one is what? Non-fluent aphasia. Word production. You are not able to produce a lot of words. Number two, you are not making sense. You are producing a lot of words, but you are not making sense. So, guys, thank you so much. Jesus Christ. I can't believe I spent 6 hours. Hey, I need an award though. Hey. See, if you don't get 100 in this exam, anybody, if you don't get 100 of 100 in this neuro, I will have issue with you. It's insane. Yes. Honestly. If you don't get 100 of 100, I'll have issue with you. All right? Yeah. If you need, also, if you need to revisit this video, just go to my stream, you revisit it. I'll post it for your different classes. Oh boy. You need to get 100 though. You need to get 100 though. Don't tell me I was confused after my 6 hours. I was confused. You cannot be confused. You're welcome. Thank you, Kelly. Thank you. You cannot be confused though. This part is extremely important. If you are mistaking anything, if you need anything, you can always come back to watch the video. All right? For real, six, Jesus. Okay, 5 hours, 55 minutes. It's you guys also tried so much. I have to also thank you guys for being here. You are the best. Please look at the video again. All right. If you miss anything, if you want some specific information, you can use the other videos I posted. They are still the same question. Or you can just come here and look at this. All right. Don't neglect the images. The images are so important. Thank you guys. I wish you success in your individual exams. You guys are the best, as always. All right. And have a nice night. Thank you so much. For those who stayed, and what will you give me? What will you give me? Eh? Oh boy. Yeah, good night. He said I have Halloween candy. I don't even take candy. God, please, like and subscribe, and make comments. Later, when you are watching the video, also keep making comments. Those comments are very important. For the last one is Weneki, that's understanding the written language. It's Weneki, understanding written language. If you have a problem there, you have fluent aphasia. Yes, fluent aphasia. Those are the only questions they can ask you about it. The name, what it entails, and what the problem in it. What does the problem do? So the answer there is understanding written language. Yes. I hope you are talking about this one on yellow, right? I guess you are talking about this one on yellow. Remember we did this one as well. Where is this one? Let me put it. Let me project it. Yes. So this other one, you remember we did this other one. This one is production of speech. Yes, that's the broker. The problem there is you'll not be able to produce enough speech. That's fluent aphasia. All right. So this one is production of speech. The other one is understanding written language. This one is production of speech. All right. Thank you. Have a nice night. You guys don't want to go. Okay. I'll see you guys later. Take care of yourself. Please come back to the channel anytime. Make sure you subscribe in case if I'm not teaching next time so that you'll be able to see when I post new videos. All right? Take care. I'll end the stream now.